has started.
Good morning, everyone. Welcome to the Sacramento County Board of Supervisors meeting dated January 25 already, or January 26. And this morning, for those of you who are dialing in, I want to thank you for your flexibility. And that's one thing we've learned through the whole COVID crisis is that we can be flexible and we can find different ways of doing things. So this morning we're going to have our entire meeting online with Blue Jeans, and we'll look forward to engaging everyone throughout the meeting. At this time, I'm going to our clerk to please call the roll, establish quorum.
Yes, good morning. Supervisors Desmond?
Here.
Kennedy?
Sorry, here.
Natoli?
Here.
Cerna?
Here.
Cross?
Here.
And you have a quorum. This meeting of the Sacramento County Board of Supervisors is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T Uverse cable systems. The meeting is closed caption and is webcast at sacmetrocable.tv. Today's meeting will be repeated Friday, January 29th at 6 p.m. on Channel 14. This meeting is also broadcast live on KUBU Radio on 96.5 FM, and a DVD copy is available for checkout from any local library branch.
And I'm going to invite everyone at this time, wherever possible, to rise for the Pledge of Allegiance. I pledge allegiance
Allegiance to the flag of the United States of America,
Republic for which it stands,
and
nation,
one nation, under God, indivisible, with liberty and justice for all.
Thank you. And see. In compliance with directives of the county, state, and Centers for Disease Control and Prevention, this meeting is live streamed and closed to the public. Temporary procedures are subject to change pursuant to guidelines related to social distancing and minimizing person-to-person contact. To make a verbal comment in today's meeting, dial 916-875-2500 and follow the prompts to be placed in the queue for a specific agenda item or off-agenda matter. Please refer to the agenda and/or watch the meeting to follow along to determine when it's best time to call and be placed in the queue to make your public comment. You may be on hold for up to an extended period of time, and your patience is appreciated. When I open public comments for a specific agenda item or off-agenda matter, clerk staff will begin transferring you into the meeting. Each agenda item queue will remain open until the public comment period is closed for that specific item. Written comments are always accepted. Send your email to boardclerk@saccounty.net. Your comment will be routed to the board and filed on the record. Thank you again for your patience. And at this time, I'll ask the clerk to read the next item.
Okay, so for your consent matters, items 1 through 35, I do need a motion to continue item number 7. This is to declare county-owned real property as surplus, authorize the execution of a sales and purchase agreement with Jack A. Shaw and Mary K. Shaw, trustees of the Shaw Family Revocable Trust, and authorize the execution of a quitclaim deed for the conveyance of real property located on the west side of Los Molinos Way, and the environmental document is exempt. That's a motion to continue to February the 9th.
I'll move. I'll continue. Second.
Motion
Sorry.
by Supervisor Desmond, second by Supervisor Cerna. And if the clerk will please call the roll call vote.
Desmond?
Aye.
Kennedy?
Aye.
Natoli?
Aye.
Cerna?
Aye.
Frost?
Aye.
Unanimous vote. I also need a motion to drop item 23, and this item is to endorse the Sacramento Northern Trail Project, authorize execution and submittal of a letter of support for a grant application to be submitted by the Sacramento Regional Conservation Corps for the 2021-2022 Caltrans Active Transportation Program Augmentation, certified local conservation corps, and authorized negotiation and execution of a funding agreement with the Sacramento Regional Conservation Corps not to exceed $36,000 should the grants be awarded. We got a request from the department to drop this item.
Okay, the chair. Do we have a second?
Second.
Second by Supervisor Desmond. Roll call vote, please.
Supervisors Desmond,
Aye.
Kennedy,
Aye.
Boyd, Natoli,
Aye.
Cerna,
Aye.
Frost,
Aye.
and that's a unanimous vote.
Okay, thank you.
That concludes the notes from the chair, from the clerk. Sorry.
Okay, do we have any members who have comments or items to discuss on our consent calendar? Supervisor Cerna, please.
Thank you, Chair. Yes, I have a comment question on item 12, and I'd also like to pull item 31 for separate consideration.
Okay.
Okay. So for item 12, really quick. Authority to retroactively amend and increase the fiscal year 2020-21 expenditure agreement with WellSpace Health by $2,622,000 from January 1st, 2021 through January 30th, 2021 to sustain the substance use respite and increase the provision of the outpatient and intensive outpatient substance use treatment services.
Thank you. So I'm certainly supportive of the effort to extend funding to see that this service is provided for the next few months. But as I mentioned to Ann during our briefing, I'm still very intent on seeing that we have a more permanent, sustainable program for those that are suffering methamphetamine addiction that are coming out of our jails. I understand that this program that is being administered by WellSpace in partnership with funding initially by the city of Sacramento is really intended to be a detoxification center, which in my estimation is really kind of a short-term service. It's certainly a welcome service, one that we need, but the vision that I've had and communicated to this board and to the public for a few years now is to have some type of service that is seamless when we have inmates that are released from custody that are, again, suffering methamphetamine addiction so that they have the ability to go into a more permanent program to address their long-term substance abuse issues. And I've suggested that we look at the space at the corner of 7th G, the former administrative space for the Sacramento Sheriff's Department. And so during my briefing with Ms. Edwards, I wanted to know from Lori Miller what the status of that is, given the fact that we're being asked to fund this now, which again I'm very supportive of. But I wanted to know that the longer term effort is underway or is being designed or there's a schedule. Really haven't received much of an update lately. So I don't know if Lori Miller is on the phone or not, but I would ask staff to respond, please.
Supervisor Bruce Wagstaff here. I believe Dr. Quist is on the line. I'm not sure about Lori, but I know Dr. Quist is on the line and can speak to your issues.
Okay.
Good morning, Supervisor Cerna. This is Dr. Ryan Quist, Behavioral Health. We're definitely committed towards getting the 711G site up and going. We have staff identified to begin that work. I'm trying to remember the specific timelines. I think we're aiming to open in June-ish.
I think July 1st. Ryan, I'm sorry to interrupt, but I believe either June or July 1st is the target date.
Thank you.
Okay, and we've identified a funding source to make sure that that is a sustained service.
Yep. Yes, we have.
Is there any ideas about how to maybe transition from the well space service, which again is really focused on detoxification, so that we can perhaps take advantage of their client list, that kind of thing?
Yeah. Yes. The well space program is called SURE, Substance Use, Respite, and Engagement. The engagement part is specifically intended to create a relationship with individuals within that program and help link them to other services. And we've already seen some good success with that. Individuals going into withdrawal management as well as residential.
Good. All right. Thank you. That satisfies my questions and comments on item 12. Madam Clerk, I would suggest that, or respectfully through the chair, that we ask other members of the board to see what other items they want to pull before we consider item 31.
And I would also I believe we have a public comment on item 12, so I wonder if there are any other board members who have comments or questions on item 12 before we.
Madam Chair, I do, Rich Desmond.
Supervisor Desmond.
So I want to echo what Supervisor Cerna said and really applaud him for his efforts and would like to support those efforts to look for more sustainable, long-term, meaningful treatment solutions for addiction. I too, I think that the SURE Center is great. I like that it's expanding into more outpatient, but Supervisor Cerna, I think, is spot on with his comments. The other thing I want to ask about, and I asked Ann about this during the meeting yesterday, when I toured the center, it was the director said it was focused for now, at least, or limited to intake from the Sacramento Police Department. And I had the question about, is this expansion and continuation of funding to SURE, will that include referrals from the Sacramento County Sheriff's Department, including in the unincorporated areas that I represent, because certainly this issue affects those areas as well. So I got a little bit of information back, but I'm wondering if Mr. Quist could respond to that and give me a little more information about expanding the intake process for the SURE Center.
Yeah, absolutely. So yes, the direct answer is yes. Sheriff's Department is able to bring consumers to that site. They're able to bring them to the site, and then once they're done with their services, they'll be returned back to their the part of the county that they call home. And so we are setting up relationships with the sheriff. So Lieutenant Rose has been invited for tours, and we're beginning to introduce the sheriff's staff to the mechanisms for how they can make referrals into that program. And WellSpace is also offered to make referrals available to probation as well, so that probation can also bring folks to that program.
Great. Thank you very much.
Thank you, Supervisor Desmond. I also totally agree. We need to. I think a large part of our homeless population is attributable to the unfortunate problem of meth and heroin, and we have to find a way to provide more services. So I totally agree with Supervisor Cerna as well. And I wonder if there are any other supervisors who have comments on 12. I believe we have a public comment on this item. This might be an appropriate time to take that. And then,
Yes,
we can move to identifying who has what other items to pull and speak to.
please transfer the caller.
Hello, caller. You are live in the meeting. You have 2 minutes to make your comments. Please mute the meeting in the background. Go ahead and start.
Thank you, Madam Chair, Supervisors, Dr. Quist. My name is Ben Aviat. I'm with WellSpace Health. We are the program operators for the SURE program. And I just wanted to stop by quickly. Dr. Porteous, of course, sends his regards. He was unfortunately not able to speak today. But we wanted to stop by quickly. Just thank you so much for where this program is. Some of you may remember that this program was kind of envisioned 2 years ago when Supervisor Cerna and Kennedy and Dr. Bielenson and Dr. Quist, you guys were all kind of brainstorming of how do we find that missing piece in the substance use continuum of care. And what we think that we found with SURE is that missing piece where we can engage people who are in the throes of addiction, the people that may not necessarily have identified that they have a problem, but we know that they need help. And we can refer them into a program where we can start having those therapeutic conversations and really help them figure out what they need to do in life, take that next step and look towards recovery. This is a recovery-oriented program, and I think we're already starting to see the value in that, having that conversation at that very difficult point in that person's life when they are recovering at SURE. The other thing I think we found, and law enforcement's really found this too, is that it's a new tool for quality of life issues. When law enforcement responds, just far too often, they don't have a good option for what to do with the person that they've encountered, and SURE provides a new tool to them. Somebody who's intoxicated but may not necessarily need to go to jail, this is their opportunity to take somewhere, not where they can just sober up, but also where we can engage them and have those therapeutic conversations. So, as Dr. Quist was saying, we're starting to see the value of that. We're really working hard to connect it to the county's existing continuum of care services so that we can get folks to treatment when they're ready. This is an incredible partnership that we are so proud of, and we are just thankful to county leadership for both your leadership on this issue and just the compassion that you've shown in really trying to develop a recovery-oriented program. We, too, are also very supportive of any efforts we can have around folks coming out of jail. As many of you may know, we do work with people in the jail system when they're leaving. We work with drug court. We do believe that there's a lot of opportunity for us to better engage folks in recovery as they are exiting the justice system. So thank you so much again, and we hope that you'll continue to support SURE moving forward. Thank you.
Thank you. Important. Okay, at this time, I will just kind of reach out to all the board members to see who wants to pull what. Supervisor Kennedy.
Thank you, Chair. I don't need to pull anything necessary, but I'd like to make comments on item 11, if the clerk can read that into the record.
Yes. Authority to execute a retroactive expenditure agreement with Sierra Health Foundation, Center for Health Program Management, in the amount of $6,400,000 for the term beginning January 1, 2020 through January 17, 2022 to provide additional services for COVID-19 health response.
Thank you. I support this, and I like the approach of this community-based approach, particularly bringing in a number of organizations under one umbrella. I guess the one thing that I would ask for, this is a lot of money, and I didn't see anywhere in the report, unless I missed it, where there's any kind of matrices for success. How are we going to determine whether or not we're spending this money correctly? So I'd like to see some matrices that show where we're putting $6.4 million and where it's having the impact, the desired impact that we're looking for. Number one. So what I'd like is I would like during our COVID-19 response reports that we're getting now on every board meeting, but quarterly, I would like a report back from on this as far as data on who's been reached, how they've been reached, where they've been reached, what outcomes were realized, just for accountability purposes. That's kind of aimed at our county executive, I guess.
Yes, I think we can absolutely do that. Bruce, do you see any issue with that?
Not at all. In fact, Supervisor, they are collecting data, and I think Jim Hunt's on the line as well as Dr. Kasiri, but we'll be happy to do that as you request, because we are collecting that information. It's a very valid request. Thank you.
Thank you. That's all I have.
Thank you, Supervisor Kennedy. Supervisor Natoli.
Thank you, Madam Chair. I have some comments on some items, so if we can read those in the record, and starting with item 5.
I didn't mean to ask you, Supervisor Cerna. This kind of got away. I assumed there might be others who had the same numbers, but agenda items. But we'll keep moving forward. I just
No, that's fine. Thank you.
Okay, for item 5, this is the contract for the B.T. Collins Youth Detention Facility, replace personal alarm device system, bids to be received on February 25th, 2021.
Yes, thank you, Madam Clerk. So, in my briefing yesterday, I did raise some questions. I got a response this morning, and thank you for the at least follow on. I think it went to all board members, but I wanted to delve just a little bit deeper into this. The concern that caught my attention, I think obviously we need to have, a system that provides the alarm device for those that are working within the youth detention facility. But as I understand it from the staff report, again, which is fairly brief, but this was the current system was installed in 2012, and here we are barely 8 years later, and we're, an estimated approved funding is $3.5 million. Estimated cost is just a little bit south of $2 million for this. And I guess my question was to the county executive, and obviously the response came back from General Services that, that there would be additional, as a bid alternate, a warranty period and either that or maintenance. But my question essentially goes to, do these, whatever we're buying, do they turn over that quickly? And if we're spending this kind of money, which is significant dollars, and again, for something that's very necessary, then I would think it wouldn't be a bid alternate to get an additional either warranty or maintenance. Whatever we're buying. I'm sorry, I was getting some feedback. Okay. That shouldn't be a bid alternate. And I guess my question essentially is that what's the estimated life of the system that we're going out to bid for? If we're going to spend $2 or $3 million every 8 years, that just seems, we ought to be looking a little more forward than just replacing a system that may no longer have the support behind it. And so I just have questions regarding that. And then lastly, there's no explanation behind added bid alternate number 3, tracking visitors. And what is that all about? There's no explanation behind that. And very frankly, again, I'm not looking to delay this, but there's just some questions here about life cycle costs, and if we put in alternates for support of this, and are we only anticipating we're going to get, right now, the warranty is for 1 year. So is this such that it's an electronic device tied in with other systems that becomes antiquated very quickly? Then it would seem to me we had maybe we have. Again, I'm not saying we haven't. So those are my questions, and I don't know if there's anybody on the line that wants to address that. And if we, delay this until, I guess, our February 9th meeting, obviously this is calling for bids on the 25th. So again, those are my questions, and I don't know if everybody's on the line.
Yeah, Supervisor.
Yeah.
There's feedback. I think John Master could probably answer the question about the life cycle of these items, and Julie Wary is on the line as well and can probably answer the question about the alternate number 3. Jeff, are you there?
Jeff Gassaway, Director of General Services. To answer your question on the life cycle of the system, with any electronic system, they get updated, and some of the electronic components go out of production. And so one of the things when we looked at this, we wanted to go to a system that gave us the flexibility and the longevity that we needed. And I think the team has done a great job of putting together a bid document that will get us where we need to go with that. And you know, dollars are very scarce, and so the additive bid alternate is for the warranty is to see what kind of pricing we can get, and then if funding's available, we'll negotiate additional years of warranty.
So what is the life cycle expectation here?
You know, I don't know. I'm thinking, you know, this last system lasted 8 years, and then, you know, parts were hard to get, and they weren't built anymore. So I would say that this system will probably be about 10 years.
Can you not build into a contract that you require support for, you know, again, there may come at a cost, but again, you know, I'm not questioning the team's thoroughness here, Jeff or Julie, but I guess what I want to know is that what, you know, what are we planning for? I mean, is it 8 years and are we going to spend, you know, I don't know what the cost of systems will be in replacing, you know, this comes to pass, you know, in 2028 or 2029. But can you not, you know, I mean, I know we've done that in some occasions with some of our IT systems, is that you at least, you know, you get some assurance that the support's going to be there. You know, you don't, you know, you take out some of that risk. Obviously, over time, things wear out and you need to replace. But
right, and you know, with some of the vendors, they have, you know, they do, you know, extend the warranty and coverage for, you know, up to 10 years. It's just a matter of cost. So, as I said, once we, you know, receive the bids, we'll, based on the feedback given today, we'll go ahead and look at, you know, adding additional years of coverage.
Well, the other thing is, the board's not going to see this back. I mean, this is our one shot at it if I read the staff report, because the construction project would be awarded by as Administrative Services Deputy County Executive. So, so again, I guess we would know if we asked the question or if we asked you to report back on that. But I guess I'm still a little fuzzy on what are we expecting for life cycle? What are we asking for in our bid?
I would have to check with staff.
Could we, Madam Chair,
I think I said,
come back to this on, you know, maybe after at 2 o'clock, maybe with, again, you know, if that's okay. Again, I don't want to tie up a lot of time here this morning. You know, maybe a little more background, you know, provided to all of us would be helpful, at least for my purposes.
Yes, Flo, do we need to vote on that or just direction from the board?
That could be direction from the board. Is this to continue or hold?
Just hold it over. Just hold it over to the afternoon session. So
no, you don't need to vote on that. I'll take note and we'll take item 5 at 2.
Okay. If I could though, if Julie's on there, again, I would like to know. Last question though. So what is it that we're looking for in bid alternative number 3, with the tracking units for awards and visitors that we don't have?
Supervisor, I believe Marlon Yarber's on the line.
Oh, okay.
Yeah, Marlon.
Good morning, Supervisor. Thank you,
Marlon.
Marlon Yarber here for Chief Steele and sitting in for Julie Wary as it relates to our juvenile operations. Additive alternate number 3, the tracking for awards and visitors, really speaks to what our consultant has shared is really the latest in technology for managing these types of systems in correctional settings and juvenile facility settings. They've mentioned that the latest tech really provides for the opportunity to track both the whereabouts of both our youth in custody as well as any visitors who might enter the facility, and they wondered if we might be interested in that. So we're curious what a respondent might state in the way of their capacity to provide that level of service for us. So a feature that we currently don't have, but something we're interested in considering. And essentially what it does is it could pinpoint at a control center the exact location of a visitor in the facility. So if they're, you know, in the visiting center or in a recreation space or an education space, we can identify exactly where they are at any given point in time.
So is it an electronic device that's attached or given to someone as they check in, or is it a different approach than that?
Correct. It could be, I believe, either a lanyard or a wrist bracelet, if you will.
And then there's a central location where all that's monitored from, then, Martin?
Absolutely. Our control, correct, could pinpoint essentially on an electronic map exactly where that person may be located.
Okay, thanks. All right, well, I just, again, if we hold this over till.
Happy to do it. Okay. Okay. Did you have another one?
Yeah, I did. I had some comments if I could, then here real quickly. On item 22.
Item 22 is the Accessible Curb Ramp Project 2021. Bids to be received on February 25th, 2021. The environmental document is a categorical exemption.
Okay. Just very quickly on this one, there was a location, I noticed that a number of these locations are in the Rosemont community, and I wanted to call attention to a location that I had spoken with Department of Transportation about last year relative to location of the accessible ramp and its placement under prior work and some concerns by one of the residents there about the location. And it was, if I recall right, the information came back to me is that when we next looked at doing accessible ramp projects, we would consider modifying that particular location, and that goes back probably a year or more ago. And so I just wanted, this has a contract behind it, but I wanted to call it to the attention of Mr. Vicari and Mr. Rodriguez or whoever was handling this, that there was a location we were going to look at modifying. There had been an install. It was close to a storm drain, and it was right in an area where there was, it might have been located in a better location, at least with respect to the neighbors, and maybe still provide the same accessibility. And I wanted to ask them to take a look at that as a part of this contract. Maybe too late or not, but I did want to note that. I don't know, Mr. Vicari, I trust you'll take a note and we can follow up offline on that.
Supervisor Natoli, this is Ron Vicari, Director of Transportation.
Yeah.
Yes, I am aware of that location, and we address the curb ramps as they come in based on requests, so we are aware of trying to address that location and fix that and rectify that issue.
Okay, that's good, because I just noticed we were doing a lot of work, and if you're going to mobilize a contractor, you're in the very close proximity to that location.
Yeah, so
right.
we are close, and we have multiple projects that are, every year, as you know, we put out a curb ramp project, so it's a matter of waiting till it comes up in the timing of the request. Because we address the curb ramps as they come in through requests, based on the time in which the request was placed. So we are aware of that location still.
All right, very good, thanks. Okay, and then, Madam Chair, I had just on item 29, we could.
Item 29, approve a reimbursement agreement with Lennar Homes of California, the California Corporation, in the amount of $694 for trunk drainage facilities in Zone 11A, and authorize the Director of the Department of Water Resources, acting as the agency engineer, to execute the reimbursement agreement.
Okay, thanks. This has been continued. The reason I call attention continued from prior meeting. I did have a follow-up from Water Resources yesterday. I'm prepared to support the item today. I didn't have a problem with the reimbursement agreement, but I would respectfully ask that as a follow-on to this, there is some landscaping improvements contemplated. The basin is located in a location where apparently it's not very visible from either Florin Road currently or from the interior streets yet to be constructed. But I would like an opportunity to meet with staff at appropriate time, talk about the coordination effort between DOT, Department of Transportation, and Water Resources on the landscaping for those areas that are adjacent to, the public streets. I'd like to again, make arrangements to meet with staff regarding that. But I for what was provided by way of response, I'm satisfied with that for today's purposes and prepared to go forward with item 29. And lastly, I would just, if we get a briefing, and maybe Supervisor Kennedy would like to join me, but we've got on item 25, $2 million of improvements in the same general area. And I'd like to have a briefing regarding that as well. So we share.
This is Michael Peterson, Director of Water Resources. We can set up both of those meetings. Not a problem.
Very good. Okay, thanks. Okay, that's all I had. And I had some comments on item 31, but we're going to pull that off with consent calendar. Thanks.
Okay, and so I believe Supervisor Cerna had originally pulled item 31. So would you like to begin with your comments, Supervisor Cerna?
Yes, thank you, Chair. I've asked,
into the record.
Oh, yeah, sure.
Oh, sorry. Okay, let me get back to that item. Item 31 is the resolution of the Board of Supervisors of Sacramento County, Healthy Communities.
Great, thank you. So one of the concerns I had in my briefing with Dr. Kasiri that I have each week, and I suspect others do have similar frequency with which they consult with our public health officer. First, I was very concerned that she was unaware of this until I brought it to her attention this weekend. And as this resolution is intended to address broadly, it looks like our relationship, the county's relationship with the state's attempt to respond to the COVID pandemic. The fact that our public health officer didn't even know about it, A, is very concerning, and B, I would like to know from Dr. Kasiri and Mr. Hunt, I understand that they're on the phone, what the material effect would be of this resolution if it should be passed by the board, because it seems to me it is a bit provocative and almost punitive relative to the state's efforts to work with counties to address the pandemic. So I'm asking for comment from our public health professionals on this one.
Dr. Kasiri, you want to handle that?
Jim, do you want to go first, and then I'll add to that?
No, go ahead.
Oh, okay. Good morning, supervisors. This is Dr. Olivia Kasiri. The blueprint was set up by the state as a way of being able to provide uniform guidance throughout the state as we were going through the process of reopening. If you recall, at the beginning when we first reopened, it happened very quickly, and we got a point where we started having the surge that occurred in the summer. And so the state put a lot of work and effort, and there are a lot of experts who were able to provide input into developing this blueprint that really helped us at the county level in being able to provide guidance to the businesses as we were going through this effort of reopening our economy, and also trying to make sure that we mitigated the risk of COVID-19 in the community as well.
So, Dr. Kasiri, this is Supervisor Cerna. Given the fact you have had a chance to read through this carefully now, what would it mean, for instance, given the fact that the resolution attempts to declare that the county would shift its focus to a much more localized effort, even down to the zip code level? What does that mean when we're trying to deal with something that doesn't respect political boundaries. It doesn't respect zip codes. And given the fact that we actually have a state construct, whether you agree with it or not, there is a state construct to deal with this regionally. What does that mean, given that this resolution would attempt to shift the county's focus to that much more localized intent?
Well, one thing is in the health and safety codes, it's very clear that the authority, the public health authority, actually resides with the state, and then the state gives that authority to the local health officer. So, according to the health and safety codes, I am required to follow the state guidance and the order. So, basically, the state, we are all required to follow the state health officer order. And they have repeated this several times that we can be more strict if we choose to, but we cannot be more lenient than the state health officer order. So that would be going against that.
Okay. Is it your opinion or Mr. Hunt's opinion that this, if it were to pass, at the very least could be interpreted by our state partners, those that you've been working with Dr. Casario for months now, could be viewed as punitive?
I have not had a chance to check with them with this resolution, but I do know that in the past they have been very clear to us that they wanted us to follow the state health officer order.
Okay. And then one of the resolves in the resolution, it's the last one, addresses schools and school districts and an intent to urge, opening schools as soon as possible. Those are the words used. In your estimation, given where we are in the county, the region, to accelerate the opening of schools outside of what being coordinated through the state, and now with the new Biden administration and the very clear intent expressed by President Biden to actually focus on doing exactly that, but doing it very safely. What is your opinion about the intent to accelerate the opening of schools in particular?
Well, we've been working very closely with Superintendent Gordon throughout this pandemic, right from the start, and we've worked together on guidance, and I've also had multiple conversations with the other school superintendents and also presented at some of their school board meetings. And very clearly, everyone is very interested in being able to get all of our schools back to that point where we're able to have in-person learning. There is no question about the value of in-person learning, but again, we're in a public health, it's a pandemic, it's a crisis, and so we also need to look at how to be able to do that safely. The California CDPH recently released new guidance for being able to reopen schools because they also are in agreement that we need to do it as quickly as possible, but as safely as possible as well. And that guidance goes into a lot of details in terms of the protocols that the schools need to put together, as well as they need to be in compliance with the Cal OSHA rules for workplaces. So they have to have a protocol that needs to be posted on their website. I think for the schools that are open right now, it has to be posted by February 2nd. And in the guidance also, it gives detailed guidance about testing, which is one way, in addition to the protocols for face covering and social distancing. Testing is another way that helps us in being able to provide a safe environment for return to in-person learning. And I believe the governor is also in the process of releasing additional funds that the schools can then be able to access to be able to set up a testing protocol. Right now, the testing that we have made available to the schools would only be able to accommodate once every 2 months. But the new guidance actually calls for every week or every other week testing, not only for the school staff, but also for the students. So that's a huge increase in the amount of testing. And so it takes a lot to logistically get that, especially for the larger schools and school districts, being able to see how that can be operationalized. So we've been in discussions, seeing how we can get that in place, and also while waiting for the additional funding, which the schools will need in order to be able to do this. There's also a state lab that opened recently that the state is providing as a resource for schools to be able to send specimens, and also the state has been providing us with rapid testing antigen test kits that we have made available to the schools, but all of it requires a lot of logistical planning to be able to actually operationalize it. So yes, we are working towards that goal, and everyone would like to be able to get to the in-person learning, but we want to do it safely as well. We've also had discussions about vaccine for school staff, and I know there's been a little bit of a debate as to whether the state was going to change their prioritization, but we have been advocating that we would like to be able to continue doing it the way that we have, so that we can get to the school teachers and be able to get them vaccinated. And that will be an additional way of protection for the adults, especially as we go back to in-person learning.
Okay, thank you. Madam Chair, those are my questions for now. I see Supervisor Kennedy has been waiting patiently too. So,
Supervisor Kennedy, please.
Thank you, Chair. Thank you, Supervisor Serna. I'm going to go through a few point by points on this. First of all, I was a little surprised to see this on consent, something like this, that, I mean, consent's reserved for non-controversial items, and I think that anybody that reads something like this would see that it would be controversial. So I would hope that in the future, something that's, foreseeably controversial doesn't end up on consent. As far as the whereases go, a few of them, for example, it says on here, empirical evidence without regard to politics or influence of special interest groups. This to me looks like it was written by special interests. It certainly wasn't written by medical professionals, certainly not by our medical professionals, as Dr. Supervisor Serna had pointed out. Some other things like our county has seen increases in drug abuse. Now, intuitively and anecdotally, I can see where that comes from, but I'm not comfortable putting a statement like that into an official county resolution passed by this Board of Supervisors without data to back it up and actually show empirically that is the case. It may very well be the case, but the way it's stated, I think, is a little thin. A few other things, this breaking it down to zip codes, I will agree with Supervisor Serna in that I think that this is punitive for low income and people of color. Those areas in District 2 where we have some of the highest case rates in a couple of zip codes, one in particular, those folks they haven't had the luxury of staying home. They've been essential from the beginning. They've gone to work every day since this pandemic started, and they're not going to work necessarily in their zip code. So I think that this is a bit of folly if we think that breaking up zip codes is going to solve this, as if people don't cross zip codes every single day, multiple times a day. So I think that breaking this down to zip code is a huge mistake. I'm not in favor, frankly, of the governor's approach on the regional basis, but I am in favor of at the very least countywide. And so I think that this really is, I see this quite frankly as, something that is, we should look at as race baiting, as well as, it's a bit elitist. And finally, on the school thing, this assumes that schools aren't doing everything they can to go back in. When it, I can tell you, I speak with, as Dr. Kassiri, I speak with superintendents, including Dave Gordon of SCOE. I can't think of any group of people who want to go back to in-person learning more than our educators. And this assumes that they need to be pushed to do so, and that's not the case. They're ready to go back from a standpoint of wanting to teach kids and recognizing that kids need to be taught in person. But they're not willing to do so until, science, medical professionals say it's safe to do so. So I find this highly politically charged and not based on science, not based on medicine. So therefore, I cannot support this. Thank you.
Supervisor Natoli.
Thank you, Madam Chair. Clearly, listening to comments of my colleagues, and obviously, reflecting on this as well, that a couple of things I just wanted to draw out of this. One being that certainly we recognize that our county is large geographically. It's 1,000 square miles. We have communities that are made up of a diversity of folks from different walks of life, of different ages, of different capacities to access health care and such. And I know that as our board obviously has come into session regularly since the start of the pandemic, we've had this discussion about zip codes or other geographical breakdowns within the county to recognize either low testing or pause text and or other measures that have been outlined. And I just, I guess as I've reflected on this, though, that into some of the points that Supervisor Kennedy made, that, and again, I have a large geographical district. It's, certainly diverse with, two, very sizable cities. I have rural areas. I have, smaller cities as with Gallatin, Ileton. And again, I've heard many of the same comments that obviously others have, in both in our board meetings, but also obviously from, folks that have businesses, folks in their own personal lives, obviously the issue around schools. And I guess as I thought about this is that, to the point made about, the regional approach and how, even with this most recent, now, past tense, with the stay-at-home order that, you had Greater Sacramento, you had a region, you had Northern California, how all those were constructed, I don't know. I don't know if, again, that's, lies with the state. But I think that as we've tried to work through this, there certainly has been a good degree of frustration and concern about, how calls are being made relative to, both health orders, but also with, I think most recently, how people can access vaccines in order to, in their, certainly in their own personal circumstances, but also as we talk about with schools and so forth, how we can, move to a safe reopening as quickly as possible. I think, certainly those words, are important. But I'll just say that, as I read through this, again, and I appreciate whoever maybe crafted this. And again, I've seen, the materials that come through from, various parties as it relates to, healthy communities. And I think that, we all want to have healthy communities and healthy people in our communities. But one, I'm not so sure about our charge, even though it's, put in the words of urging to safely open. That last resolve was troubling to me, because I do think that school districts, certainly in, both public as well as private schools, want nothing, more than to get back to in-person instruction. And again, I've, like I'm sure all of my colleagues would have talked with superintendents, with leadership, both on their school boards, but also, parents who, are anxious to want to, have that resume for the welfare and benefit of their children and those students. But, as it relates to all the other activities that go with schools, including obviously athletic endeavors and so forth. But I think that, as we've seen certainly in the last 90 days, this, tremendous impact from a health standpoint in our communities to do that in a way that's safe, that provides the assurances Dr. Kasuri outlines, that if that's done, not our call, I think we certainly can, be supportive. I guess what I kind of come down to on this is that, I think we really need to, and we're going to talk more about it in item 36, to, devote our efforts to one, with regards to testing and the vaccine, but also, working with our business partners, with obviously our educational community, with our communities at large, to, do our best to be in the role where we provide leadership, but also be supportive of, some of the things that are certainly outlined here with, reopening our schools, reopening our businesses, to do our best to, be a very strong partner and a leader in doing that. And I just, concerns me that some of this, again, is maybe as toned down as it might be, there are some things here that, I, without getting into a lot of wordsmithing, have some heartburn about. And I think that, again, a broader statement about what we want to do as a county to, both play a role in as we have for many, many, many months now, in related to public health, but also in some of the other things that I think we can be, very supportive and very much a part of, that, doesn't kind of get into this about, whether the blueprint's a good thing or a bad thing, whether it ought to be zip codes or not. I think, we're at a point in time, in my own assessment of this, where obviously we still need to, take on head on the health implications and, and as they're presenting themselves this very moment, but also then, work together to, get things reopened and to, hopefully restore some normalcy to daily lives for all of our residents who, again, I think obviously there have been impacts, and whether there's empirical evidence or not, I think we recognize that this has had tremendous, beyond the death and health impacts of the pandemic and related conditions that have, seen, loss of, 1,200 plus, county residents, but there have been other things, and mental health, obviously, and some of the things, the impacts to our young people. And so, again, I think embedded in this are some good thoughts, but the resolution certainly in its current construct, I think it, maybe it looks back a little more than it looks forward. And again, last thing I would say is that, I'm certainly a supporter of local control for us as a board of supervisors, working with our other local electeds and certainly our communities and our leadership, and supportive of that. But with regards to this, we're well into this, and I don't know that kind of issuing this challenge to the state at this juncture, albeit it might be something that would find favor with some folks, and tell the state to kind of take a hike. That we're deep into this now, and I think we ought to keep our eyes kind of looking to what lies ahead here, and hopefully be a strong part in that regard. So I'll leave it at that right now. Thanks.
Thank you, Supervisor Desmond.
Thank you, and I do have a lot of the same comments of my colleagues who've already spoken. I like that line from Supervisor Natoli that this seems like it looks back a little more than it looks forward, and I think that we're at a time now where there are some good indicators. We're seeing some good news instead of getting, I think, bogged down so much in what happened before and decisions that were made before. Decisions by, I think, people at all levels of government, people, well-meaning people trying to figure out the best way to approach this pandemic. And there's been a lot of mistakes made, I think, by people, but there's a lot of fits and starts. But there's been no playbook for how to do this the best way. I thank you for bringing this up. I would have also preferred to have this as a as a discussion item to see if we board could come up with a common set of principles, things we agree on, like supporting small businesses. And I especially appreciate, Madam Chair, you're calling attention to the impact on businesses. And that's specifically something I think we need to always be very, very cognizant of. And also the other effects, certainly, of the COVID-19 pandemic. As someone who spent, most of my entire career at the state level, I'm certainly very cognizant of the state overreaching and maybe disregarding local control. But I think that's always a balancing act, right? I mean, I like the county approach, giving the county more authority to determine what's best for our county. I agree with Supervisor Kennedy that I think the regional approach, it may have mixed urban counties and some rural counties, didn't quite make sense. But so we need to make sure, we have the flexibility of local control, but there's also a lot to be said for consistency. And I echo what Supervisor Cerna said. When it comes to trying to get even more granular down to the zip code level with how we're handling this crisis, I think we would realize a lot more public confusion and inconsistency that would really have a counterproductive impact in how we're responding to the pandemic. I think we're seeing that, frankly, in a lot of the vaccine discussions. I mean, it's being done differently in a lot of different ways, despite the state trying to keep to some standards and Dr. Kusiri trying to keep to some standards. There's a lot of inconsistency, and that's causing confusion, and I think that's working against us in some cases. I look at some of the specific resolution and the principles. I mean, number one, I thought to myself when I read that, I mean, it seems like the county, we do by and large have the ability to respond locally. And I look at the last point, which number 3 regarding the schools. I also agree. I've talked to a lot of people in education, educators, administrators, and I do think that everybody has the objective of opening safely. I just think obviously people have different ideas of what that safety might mean and what that might entail. But I think we share that common principle. I think my biggest concern with it is certainly emphasis on going down to the zip level. I think that would cause a problem. But I will say also, Madam Chair, I mean, if there is a willingness from my fellow members and you, certainly I'd be willing to work on maybe something that demonstrates a common set of principles by the body, if you'd be willing to pursue them. Those are my thoughts, comments.
Thank you, Supervisor Desmond. Well, I will, I know we have some public comments on this, but wanted to respond and kind of share a little bit about what was on my mind when I brought this. I first want to say that I feel the adoption of the Healthy Communities Resolution is an important step, not only for this time and place in this pandemic, but for future pandemics, because it codifies our intention and how we feel we want to manage future situations such as this. It doesn't dismiss the seriousness of COVID-19. It really doesn't make any political claims. The COVID by zip code is, in that comment, it's in the resolution. It's basically saying, that rather than imposing a blueprint, and based on a larger geographic area, it would be better to tailor it to individual counties. And I know there are many counties that have signed on to this Healthy Communities Resolution. It's not unusual over time for counties to advocate for local control. And it's consistent with what CSAC and League of Cities and what we've been doing all along, which is, under the idea of we are closest to our community and we have a better understanding of the makeup of our community. Sacramento County is very diverse. And so you could say you could say, such as, by zip code, but you could also say something like, by COVID positive, businesses that are spreading COVID. We know that there has been empirical data that has shown that there were many, some businesses that were deemed, essential, while others were not essential. And there were those that were not essential that were closed down, that were representing a very small part of the spread. And by closing them down, we're causing pain and suffering in areas that we don't really have to. They could be going back to work, and we could be redirecting our resources to those underserved communities. So to say this is elitist or race baiting or political or controversial is hard for me to understand, because I really feel like we should let those who can go back to work so that we can shift our resources to those who really need it. We know over time, we've been in this for like 9 months, we know that the chance of survival for people who are anywhere from 20 and under is 99.997%. We know from age 20 to 49 that the survival rate is 99.98%. And from age 50 to 69, it's 99.50%. And over 70, it's 95% survival rate. And we also know there are treatments, amazing treatments that are having 100% success rate in saving lives and reducing hospitalizations. And we know that other countries, such as Africa, there are countries that are not having these shutdowns, and they are using those medical treatments, and they are not overwhelmed in their ICUs or their hospitals. It's, they're not having the same catastrophic unintended consequence that comes from the lockdowns. And we also know, that working, with our public health officer who has worked tirelessly between our public health and the state and us, we can make better decisions for our individual counties. And I think that's what the counties are going, trying to attempt. This isn't a resolution that says we have to do it this way. It's saying that there might be different ways that we could do it, and that what it's basically saying is that as county supervisors, we've been elected to serve in our county, to protect the well-being of our county. But during this COVID emergency declaration, we've been stripped of all of our real ability to determine what is best for our constituents, while people at higher levels have been making these decisions, and we have been, working on the streets with these people, trying to figure out how to help them, recover from the impact of these decisions. We know that we have unintended, we have depression, we have chronic illnesses that have not been treated. We have increased deaths because of that. We will have increased deaths because of preventative treatments that have not been done because they weren't able to go to the hospital and do their screening for, such as breast cancer. So we know, we don't know the full impact of it, but what we do know is, and I think Dr. Kassirier has done an amazing job trying to get answers, trying to get the data. And I know there have been, public requests trying to get data from the state to justify, the decisions that are being made, and who's essential and why they're essential, and why this lockdown, when such a large portion of our population is not, at high risk. the other thing I want to say is those communities that are more remote and rural, they have a, you know, less, they have less, a better outcome. It's in the, you know, it's in the urban core, in places like New York. I think that was part of the reason New York made their decision to try something different, which was COVID by zip code. But this doesn't say it has to be by zip code. It just says that we should be able to make COVID-19 response that's tailored to our geographic areas. So I didn't really see this as stating a final, you know, it has to be done this way. You know, you could take COVID by zip code out of it. I would be happy to, you know, change that. But I think, I guess, what this is it's you know, basically advocating for local control, and it's advocating for us to be a bigger part. We would like to be a bigger part of that decision making, because in the future, this pandemic and the way this has been responded to sets a precedent, and we want to be able, you know, since we're elected to represent, I feel our intention should be to be at the table and in the conversation. So this is just us saying, you know, we would like, that's what we would like. So I'm hoping you might reconsider and you might support the Healthy Communities resolution. It's really saying that there's more to public health than pandemic. There is a lot of impact for every action. There's a reaction, as we all know, as you know, policymakers, and we don't always know ahead of time. And I know everyone's done their best. The state has done their best, and our public health team have worked tirelessly. But I think this is just saying, as elected individuals, we would like to be more a part of that conversation and have control over how our local jurisdiction is managed. So with that, I will, unless anyone else has a comment, I'm going to move to public comment. I think we have some public comments on this matter.
Yes, we do. Please transfer the first caller.
Please start with your comments. You have 2 minutes.
Good morning, Board of Supervisors. Thank you for taking my call. I am calling today to encourage you to vote no on this resolution. I do agree with what Sue Frost just recently said about public health is more than just a pandemic, and I hope that she remembers that after the pandemic is under control. We live in a multi-generational household community, and my greatest concern is that we have kids that will go to school and bring this back to our parents and our grandparents. Everyone wants our schools to open, but we do want it to open safely. I do feel that this resolution is discriminatory when I read the documentation related to the zip codes. Teachers are at a much higher risk in the age category of 65 and older to actually contract the COVID. We have had a lot of difficulties with our government rolling out the vaccines. So many of us that are 65 and older have not been able to get the vaccine. There are not even vaccines available, and I think this is something that should be considered. The unknown risk of this new virus is that now in California is also unknown. And I think that when we're looking at our community, we need to look at it as a whole. We're all suffering. The people that are workers that actually serve the restaurants, they're suffering as well. But they have kids at home. Everyone has kids at home, and we're all in this together. So I don't think we need to be discriminatory and start talking about zip codes. So many people that are in rural areas more than likely have better access to health care. So more than likely they're more healthier than people that live in inner city. So we need to consider all these things, but I do encourage you to please vote no on this resolution. And the next time, I would really appreciate if the resolutions or anything that's going to be on the public comment section would be posted earlier, because I just found out about this on yesterday. And I do appreciate you taking my call. Thank you for your service. Bye-bye.
Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Good morning, Board of Supervisors. My name is Kula Koenig. And first, I just want you to know I was born in Liberia, which is a country on the continent of Africa. So I just wanted to make that clear, that Africa is a continent, not a country. I'm also a proud resident of District 3. So Rich Desmond, welcome. I've got my eyes on you. But I just want to say that I reject the whole premise of this resolution that Supervisor Frost has put forward, or Sneaky Sue, as I've come to call her these days. It's not about local control. It's about eroding the fabric and the processes of how we've been dealing with COVID-19. Supervisor Frost, are you a medical doctor? Also, do you know that people can leave from South Sacramento and come to Folsom very easily? So the zip codes part doesn't work. If anyone should be talking about zip codes, it should probably be Donna Tolley, because many people don't even know where Ileton is, but people know how to get to the Folsom outlets. So it bothers me that Dr. Kassiria didn't know about this. As the public health officer, I find this very, very disrespectful. Also, as a citizen, a resident of District 3, and someone who pays attention, I find this is in violation of the Brown Act, because when I tried to look at this yesterday, I couldn't click on anything to read any details, and so I'm trying to play catch-up this morning. That is a violation of Brown Act. And so, Sue Frost, you said in your comments that you thought it was an important first step to have this discussion, but if you thought it was an important first step, then why weren't you transparent? Why didn't you include the details so that folks could know about it and be able to comment accordingly? Do you remember Nav Gill? He was sneaky, and look what happened to him. So I think you should really actually answer the questions that your colleagues brought up, because I think the whole premise of this is not about local control. And if we start to go down this dangerous route that you're putting on and accept your premise, then that opens up a whole another ballgame. So what we need to talk about is why this was on consent, why this was allowed to be there, and the public didn't have time to be a part of it. So anyways, I guess we got to pay attention, especially with Sue Frost as chair. Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Good morning. I'm happy that the Board of Supervisors prioritizes healthy communities for Sacramento County. But today I'm asking that the board vote no on agenda item number 31. As of Sunday night, the resolution was not posted on the county website, so there were no details on what this is about. When information was provided, there were no impacts or implications addressed. The term healthy communities is very broad and means many things. By not even specifying COVID in the title feels like a deliberate move to misinform and mislead public interest and involvement. This raises Brown Act concerns, as the description is too vague in general to adequately inform the public as called for under the Brown Act. Further, putting this on the agenda as a consent item further undermines an open and public participatory process. It further exacerbates the distrust of government by the community. If this is a new practice of the chair, I ask that it cease. The proposed resolution would require that our public health department would have to develop their own criteria and system, which brings significant issues with capacity and enforcement. Additionally, it could jeopardize funds coming to help with the response. We still have high rates of infection and a more infectious COVID variation spreading across California and elsewhere. Undertaking and going this on our own would be negligent and irresponsible. Even if the county were to end the state's health officer order, businesses are still subject to the state health order and could be targeted for fines and license revocation if the board takes this route. Lastly, our county public health staff have an incredible job to do in trying to test, vaccinate, keeping the public informed, engaging with community partners to help the community, and countless other things. So please quit wasting their valuable time and the county's limited resources in bringing matters like this forward that haven't been vetted and properly researched. It serves as a distraction to the actual life-saving work our public health staff needs to be doing. I ask that you vote no on this resolution and commit to being an open and transparent government by appropriately titling, describing, and providing timely information to the public so that we can participate in this process. Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Yes, hi, PJ from District 4. Hey, Sue. So, Sue, can you tell me what area of immunology, virology, or epidemiology did you study? What did you have your PhD in? And if you don't, but you're choosing economy over human lives, do you have the fortitude to tell the people of the County of Sacramento that because of prior inaction at the federal level to ensure their continued financial viability, and because of mismanagement at the county level with COVID funding, that some people will just have to sacrifice their babies, their parents, and their grandparents to our economy? Because make no mistake, that isn't a conflation. That is your choice. Now, I feel for you because many in your district have inane views towards public health orders meant to protect us all. Many of them feel that it's a hoax. Despite hundreds of thousands of people dying, family members dying, friends dying, family and friends' lives being irrevocably altered for the worse because of a pandemic that wasn't taken seriously at many levels. I would like for you to tell them why it's okay for their loved ones to die. Because make no mistake, ignoring the public health orders and choosing economy over human life is what you are doing. Now, my understanding is that the Republican Party is the party of personal responsibility. So take responsibility for what the results of your actions and your decisions will be. Also, it's pretty impressive that you just became board chair and are already violating the Brown Act by not providing information on item 31 at least 72 hours before the meeting. The text of Resolution of the Board of Supervisors of Sacramento County Health Communities does not a description provide. I finally saw a link show up yesterday evening, but I have a screenshot from my phone that shows unlinked text as of yesterday at 10:28 a.m. Be better. Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Good morning. My name is Dr. Flojan Kofer, and I actually am an epidemiologist. I'm also the Senior Director of Policy for Public Health Advocates. I won't mince words. This policy proposal is ill-conceived, poorly structured, and counterproductive to the goals of public health and community well-being. As has previously been highlighted, it was put together without consultation of key stakeholders, most importantly, public health professionals, as well as educators and administrators who are directly called out. Everyone wants to reopen and resume the important parts of pre-pandemic life. But what distinguishes responsible adults from petulant children is the ability to think critically and comprehensively about the pros and cons of our actions. We're currently experiencing COVID rates that exceed what we previously thought was the peak in July 2020. We have several new mutated strains circulating that are far more infectious than their predecessors. And evidence suggests that children can be the cause of super spreader events, and we have to consider workplace safety when making decisions about reopening schools. When you have no background in health, a 1% or less than 1% death rate sounds low. But if we did nothing to prevent the spread, 1% of Californians dying is 400,000 people. That is more than twice as many people as usually die in a year in the state. Imagine how much that will overburden our systems, as well as compound the devastating impact this pandemic has had on people's mental health and social support. And COVID doesn't replace the people who would die in a year, it adds to them. But survival isn't our only key consideration. The long-term health effects of this pandemic are as yet unknown. Treatments under emergency use authorization have less data to support them than even our vaccines, which at least have the benefit of randomized controlled trials. So while I'm sympathetic to the needs of small businesses that have been financially impacted by COVID, I also want to remind you that it was the negligent oversight of the CARES Act dollars by this body that resulted in the greatest harm and the least protection to those
Please wrap
businesses.
up your comments.
Certainly. My last 2 points are this. Chair Frost, Africa is a continent comprised of 54 countries. And as Supervisor Kennedy indicated, it lacks integrity to put this item on consent. We demand better. Please vote no on this item. Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Hi, I was calling in support of the resolution, and I don't even remember what I was going to say, just listening to the other callers. Just wow. I've been on epidemiology studies, and I can tell you that the conclusions that you find are only as good as the data that the foundation is built on. You give me some data, some raw data, and I can come to any endpoint you want based on manipulation of it. So Sunday is when I read the agenda packet, and yes, the link wasn't working, and I would say that would be the fault of somebody in the administrative side, not anybody sitting on the board, whether I like them or not. I read the packet. I even downloaded a copy of the resolution to dig through. Anyway, this is absolutely critical that we get to some common sense approach and start looking at things on the zip code level. We know the outbreaks are isolated to certain parts of the county. Having this unilateral approach where you're looking at the whole greater Sacramento County and basing the decisions for 1.5 million people off of little localized area makes zero sense. Unless you're trying to keep the counties closed and you're trying to squash our entire economic engine. That's the only way this makes sense. I don't know how people don't see that yet when our own governor is not following the science and opens up counties that we thought would be closed down for a while based on the science, and he's opening them up on Monday. The politicization of this is very obvious in terms of keeping us shut down. If we continue looking at things on the statewide and the city level or the greater county level, it's very clear that we're going to stay shut down for a whole year versus looking at things one zip code area at a time. The race baiting thing, I don't even want to go into that. It's so ridiculous. The second there's any disagreement in what you're thinking, and it goes against your little fundamental morals, you throw out race, and then everybody's supposed to back away. It's old. It's so old. Look at things based on the data. Look at things based on the science.
Comments.
That's it. Thanks.
Please send the next caller. Please start with your comments. You have 2 minutes.
Hello, this is Suzanne Georgie. I am also a member of the ACLU chapter of the local Sacramento office. So my first comment is, Ms. Frost, this resolution is utterly absurd. It is a distraction from the real work that needs to be done. As I have spoken previously to this board, there is so much work that needs to be done with testing, tracing, and now vaccinations. And you're distracting everyone with this wasteful resolution. Specifically, you're advocating placing economics over human rights. Human rights, the right to live. So how safe is it right now? Why have so many people in our county have died? Why have our health workers been so overstretched? If it's so safe, look out your doors. Look at the news. It is not safe. This is absurd. And then also, your comments about Africa. How about some personal knowledge about what's going on in Africa? My daughter is in Africa. She is fighting the COVID infection over there. She is seeing people die. She sees the resources they have, what they don't have. But also, there is a theory going on that because of their lifestyle, they have the ability to respond to the COVID, unlike us. Don't cite Africa. You don't know what's going on over there. Please don't vote for this resolution. Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Yeah, nice try, Sue Frost, to sneak this ridiculously racist resolution into the consent calendar without following the Brown Act 72-hour rule or even providing clear guidelines on providing brief, clear descriptions for agenda items. Yeah, that alone is enough to disqualify this resolution. But the more troubling is how even while the general public was unable to see this resolution until yesterday, somehow, some way, I was hearing supervisors receiving messages from people in support of this resolution, almost as if you selectively leaked this resolution with your allies while trying to hide from scrutinizing eyes from the rest of the public. Because, you're talking about how we need to respond to this as a community. We need to treat this some places are dealing with this differently. And I keep looking at the COVID-19 dashboard and noticing where the majority of zip codes that are dealing with with COVID cases, over 1,200 COVID cases per zip code, that's in your district, District 4. You have five cases, 5 zip codes with 1,200 cases or more. And then you have an additional 5 from that had 800 or more. So if we're looking at this and looking to treat certain constituencies differently based on their zip codes, let's look at yours, because apparently you're ignoring the COVID impact in your own district, which brings the question, who are you actually listening to? Are you just listening to a few NIMBY business leaders who are desperate to just make as much money as possible during this COVID pandemic, even though they're the most well off and have been the best protected in the response so far? Or are you listening to the thousands of people of color,
please wrap up
young
your
people
comments.
of color who are dying disproportionately at a rate of as high as 70% for young people of color? It's ridiculous that we have to say this to you. But then again, that's par for the course for someone, the only supervisor on here who apparently can't recognize racism as a public health emergency that it is. Shame on you. Vote no on this resolution. It's bullshit. Fuck you, Sue Frost, for being so goddamn white supremacist.
Thank you for your comments. Please send the next caller. Please start your comments. You have 2 minutes.
Thank you. Good morning, board. Surprisingly, it's still morning. Usually it's a little later when I get a chance to talk about an item. Sue, you're doing a good job. Local control. I love it. And of course, I hope you were expecting to be stepped on by the unions. That's what they want to do when you take away the federal and state control, because that's where they get their power. They think that they're going to survive this on top, just shut everyone else down. They'll be guaranteed their jobs because they've been scratching the back of their promoted socialist leaders. So expect some union, fallback on that. But local control takes away the abuses of the state and federal government that I believe are responsible for more of the COVID deaths than anything else, and COVID even itself. Forcing people into skilled facilities that are infected, denial of therapeutics, misinformation, false science, et cetera, et cetera. But the local control is where it's at, because you guys are governance that are right here, and you see us, you talk to us, you know who we are. You're able to make decisions for yourself. You can step away from the false media. You can see what's actually working and what's not. You can walk downtown and see how more lives are going to be lost now because of the devastation that's been done to our economy than COVID could ever take. For those union thugs out there that are trying to force people to have vaccinations before they go back to school, I want to make this very clear. This thing that they're putting out there is truly not a vaccine. If you were an honest doctor or scientist, you'd be able to say that. But if I'm vaccinated, or if I am not vaccinated, or my child is not vaccinated, and you are, and please, board, listen to this, because it's simple logic, and that's why people are waking up. If you're vaccinated and I'm not, then why am I such a threat to you? Forced vaccination is a joke. All these same folks that talk about freedom of choice, that want to murder unborn babies,
please wrap up your
they're
comments.
abandoning freedom of choice because of the fear of a virus. And all this fear stuff is the only reason why that you would not want to have local control, because you fear one thing or you fear another. But take it upon yourself. You've been have the capability of making good decisions, and I hope that you will. Thank you.
Supervisor Frost, that concludes your comments.
Thank you, Flo. And I just want to confirm with you, Flo, because I had downloaded the agenda last week, and the resolution, Healthy Communities resolution, was there. So I was.
Yes. The agenda was posted at 9:30. The agenda was posted at 9:30. The material was distributed and published to the board members at 3:30 or shortly thereafter.
On Thursday or Friday?
On Friday.
Yeah. So that.
Madam Chair, on that point.
Yes, Supervisor Cerna.
On that point, I just want to be clear. There's a difference between the materials being posted on an agenda for the board members to have access to versus the public portal. And so what I was hearing from many of my constituents is that they were having a great deal of difficulty, and in some cases found it impossible to access these materials through that public portal. So I just want to make that distinction that when we attempt to use our platform internally here, Agenda to Go or otherwise, it doesn't always necessarily mean that the same materials are accessible in the public portal. And I think that's where the problem lies.
Supervisor and Chairperson Frost, may I address the board?
Yes.
I just wanted to point out that what our process is that when we provide the material to the board members, part of that process is to publish the material online at the same time. So one doesn't happen without the other, so that we're in line with the Brown Act. So what I mean by that is when you guys are getting your material, it's the same system that we're using, that you're accessing your material online is the same out to the public. So there may have been confusion that when and if a member of the public went to get the agenda and the material at any time 9:30 on Friday, they would not have accessed material because there wasn't any material in the system at 9:30 on Friday. The only thing in the system was the agenda notice to meet the Brown Act. The material was uploaded at 3:30 or thereafter, and that was when we distributed the material to board members, and it was published online anytime after 3:30.
So Flo, this is Supervisor Cerna. If someone had tried to access on Friday the material and left their browser open and just continued to hit refresh without going back out and coming back in, let's say by Sunday, that doesn't necessarily mean that they would see the material there, right?
Correct. If they don't clear out their cache or they don't refresh, right, that very well could be the situation.
We might think about a more explicit way to explain accessibility to materials for the public. Just a notion.
Absolutely. We can make an update on the public website so that the public is aware of that and provide any other tips that might help them.
Okay, great. Thank you. Madam Clerk, if I may, I'd like to speak to the substance of the matter here. In light of certainly my concerns, and I too am opposed to, if it wasn't clear, I'm strongly opposed to the resolution, but I would suggest respectfully to the chair that she asks for a second if she intends to make a motion, and if not, then drop the resolution altogether.
I would like to ask for a second and take a vote on it. And if I don't get a second, it automatically drops, is my understanding. So I think probably at this point it's appropriate to separate out item 31. Should we vote on that first, Flo, and then move to consent?
Yes, please.
Okay. So I will move item 31 and ask for a second. And it's clear I don't have a second, and so that does not carry to a vote. And then
Fails due to a lack of a second.
yes. And I will ask for a motion on the consent calendar.
I move the consent calendar, acknowledging the items that have already been either acted upon or dropped.
Second.
Thank you, Supervisor Natoli. Second by Supervisor Kennedy was the one I heard first. And roll call vote, please.
Supervisors Desmond?
Aye.
Kennedy?
Aye.
Natoli?
Aye.
Serna?
Aye.
Frost?
Aye.
Okay, and so the motion, that's a unanimous vote for items 1 through 35, except items 5 and 31.
Okay, great. And I would like to ask our clerk if we have any off-agenda callers at this time.
We do have some off-agenda callers. Please transfer the first caller.
Please start with your comments. You have 2 minutes.
Okay. Right now?
Yes, please also mute the meeting in the background.
Okay, do I talk now?
Yes, please start now.
Okay, hello, supervisors. Good morning. My name is Ginger Rutland, and I live in District 1. I was alarmed by the disclosure by Sheriff Scott Jones that at least 2 Sacramento deputies participated in the January 6th Trump rally in Washington, D.C. that turned into a riot. Rally-goers invaded the nation's capital and killed at least 1 Capitol Police and injured several others. They threatened the former vice president and members of Congress. I want the board to investigate whether Sacramento deputies participated in that riot, and if so, are those deputies still with the department? Also, given the tenor of the riot and the strong support for former President Trump among some members of the Sheriff's Department, I want the board to investigate whether we have a white supremacist, anti-Semitic element within the Sheriff's Department. I'd very much like that to be investigated by the board. Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Okay. My name is Allison App Roberts. I live in Supervisor Kennedy's district. I understand that he has asked the County Inspector General to investigate any involvement by sheriff's deputies in any of the insurrection events of January 6th. I will be watching very carefully to see what kinds of, I would hope and urge that this investigation be undertaken. I think the public has a pressing need to know if any department members were involved and in what ways. And I also, whether or not the department's ranks itself ethnically reflect the communities they serve, and any ways that I think there's a great deal of public distrust, I'm afraid, of the Sheriff's Department, and I'm afraid for very good reason. And seeing things like the Gadsden flag, which has been long affiliated with white supremacy, prominently displayed on people on the public-facing Facebook page of Kevin Mickelson, president of the Deputies Association, I find very disturbing. It's more than a dog whistle. It's a dog siren. That's it. Thank you. I just hope that you do pursue this. I think many of us are very concerned and watching to see what results. Thank you.
Please send the next caller. please start with your comments. You have 2 minutes.
Hi, in regards to the riots, if they're national in another like DC, I want to add on to investigate our local riots. That's what's more important. Our local terrorism that we have that has destroyed many cars and buildings downtown in the Sacramento, and where that's going. If you could please put that on the agenda to figure out who's responsible for terrorizing our communities here in Sacramento. I also want to ask the board to COVID-19 is real, but the scientific proof making this a pandemic is yet to be provided by Dr. Kasiri and her team. On December 30th, she has stated that the local homeless shelter was able to contain an outbreak. So that's fantastic. We want to hear more about that. If a local homeless shelter is able to contain an outbreak, then those of us that have been, closed and have been, participating in staying at home orders, we should not be punished. That's the elitist way. When we're the ones following the rules and the stay-at-home orders, yet we're being punished for following those orders, and that's the elites. And a third point is, talking about elites, my best friend is a teacher in Palo Alto, and guess what? Their local schools have been opened since October. So guess who lives in Palo Alto, Los Altos? Yes, the elites of our Bay Area, Northern California, and their schools have been opened. They've been tested every other, I think, week or something like that. And they've been open since October. So talk about elites. Why do Palo Alto, Los Altos, where tons of Northern California money resides, why do they get those counties, those schools get to be opened, and we get to be punished for participating in, following the guidelines? So I would appreciate you looking into that. I've sent you many emails regarding Dr. Kasiri's. We need the data to justify why it is essential for us to still continue to be locked down. Thank you for your time.
That's the conclusion of your public comments for off agenda.
Sure.
Yes, Supervisor Natoli.
Yes. Again, I know these are non-actionable items, but a couple of the callers who made comments this morning sent written correspondence to all members of the board. I know that the clerk has received them as well. I just wanted to ask then, it was referenced that Supervisor Kennedy had asked that the Inspector General review the substance of those. So could we be kept apprised of not only of any referral, but also any outcome of that investigation? So I just think it would be important to, again, I see Patrick's raising his hand. I just wanted to say that if we get that, and again, some of this has been received fairly recently, going back to last Wednesday and Thursday, but if that's the appropriate way, if we get subsequent communications regarding the same matters, if that's where we end these, then that would be important to know for all, I think for all of us to know that. So,
Supervisor Kennedy.
Yes, thank you. Supervisor Natoli and other supervisors, the Inspector General assured me that any communication that goes back to me goes back to all of us.
Okay, good. Thanks.
Thank you. Any other comments from supervisors? Okay, then we will at this time move on to our next item, please.
Okay, for your next item, this is item 36. It's the report on COVID-19 response.
Jim Hunt, Acting Director of your Department of Health Services. On the financial, you'll see in your packet the general fund money that's been allocated for COVID-19 control. We have combined those sources, so we do have the $65 million that your board has approved. And of that, we've expended $31 million, have encumbered in contracts $19 million, with the remaining balance of just shy of $15 million. With the time, I'd like to just move right along. If we could bring up slides for our presentation. We'll run through this real quick. What I want to do is just show a few charts that were taken from the California Department of Public Health's online dashboard last Friday. The numbers today are different, but what I want to demonstrate are the patterns we're seeing, which have not changed since last week. Could we have the next slide? Not seeing any slides on the TV.
We're getting the slide up for you just now. Sorry about that. If you could just give us 1 second.
Okay. The first slide is Sacramento County's positive COVID-19 cases, just shy of 82,000. Okay. Okay. Could we get the first chart? Next slide. What this chart shows is the increase from last April through the most current period that the state was reviewing, and the dramatic impact of the Thanksgiving surge. But that has stabilized. It plateaued and is now going down, so we are certainly going in the right direction, and we're glad to see that. So we could have the next slide, please. Okay, all right. What's on the TV now is the test positivity rate, which also followed the same pattern, and this is really good news because fewer and fewer people testing positive means fewer and fewer cases and fewer people going to the hospital. Could we have the next slide, please? So this is the hospitalized patients, and again, the same trend. So this is really super news that we have stalled the rapid rise, plateaued, and are starting to go down. But I think it's imperative to point out that the rate we're at right now is extremely high. The virus is virulent, and it's just throughout the community, and we still need to have our protective measures in place. Next slide is the intensive care beds unit available. And of course, this is a lagging trend, and the chart shows the number of beds available. But what's most watched is the percentage of ICU beds available in 5 different regions of California. The Sacramento region has remained below 14% available for all of January. And the most recent report from last Friday was at 11.9%. But the state uses current data elements, such as the case rates and positivity rates, to project the ICU available 4 weeks into the future to determine restrictions. The Sacramento region is projected to be at 27.3 ICU beds available on February 21st. So that is looking very positive. And then total deaths, you can see the same trends in this tragic period. So if we have just the next slide, Dr. Kasiri was asked by the board chair to present our detailed vaccination plan, which she'll do in just a moment. Before she does, I'd just like to briefly put everything into context. The state of California receives an allocation of COVID-19 vaccine, both first and second doses, every Tuesday. In a statewide conference call last week, the California Department of Public Health stated that they received 485 first doses that week. They expect similar allocations for the foreseeable future. To give an idea of the scale of the challenge we face, they told us that with that amount of vaccine, it would take 80 weeks for every person in California to receive their first dose. Of course, not everyone will want the vaccine, and the federal administration is moving to ramp up production, and before too long, we hope other manufacturers will be approved, which will hasten the full vaccination efforts. Nonetheless, this is clearly a long-term project before we've achieved herd immunity. And we've been asked as a department about the possibility of opening up mass vaccination sites in partnership with the Army National Guard. We could expand our efforts at Cal Expo from 3 lanes through to 10. I'm happy to say we've received offers of other venues that could be used for mass vaccination sites. The Sacramento Republic soccer franchise has offered their stadium that's on the grounds of Cal Expo, along with ushers, staff, the big screen video, and parking. AT&T has offered the use of their auditorium on Watt Avenue. And we could quickly set up sites such as these if we had the vaccine. We simply can't do it now with our current allocations. And while we wait for this pandemic to be gone and more vaccine to be available, we need to remember that the best way to prevent the spread until herd immunity is reached is to wear a mask, avoid gatherings, and socially distance. If everyone did that when they left home, we would see about the same level of protection from COVID-19 as universal immunization. Dr. Kasiri will now present our vaccination efforts as requested. Dr. Kasiri.
Yes, this is Dr. Kasiri, County Health Officer. Could we move to slide 8, please? and just let me know when you're there. So slide 8 just gives an overview of what the discussion that we're going to have today about our vaccine plan, which is what I was requested to do. So talk a little bit about vaccine information, the specific storage and handling that is needed for the vaccines that we're using, the distribution and dispensing, and then also the strategy that we have in Sacramento County. Next slide. So this next slide shows, this is slide number 9, shows just gives a little bit of background about the vaccine. We've gotten a lot of questions about how this vaccine works, and so this is just a picture that shows both the Pfizer and Moderna use an mRNA, which is a fraction that goes into a cell and then helps that cell to create what we call the spike protein. The spike protein is part of the virus, and it is the part that is recognized by the body, and then the body creates the antibodies. One of the questions we've been asked about is, will this affect a person's DNA? It does not, because the mRNA never enters the nucleus. That is where you find your DNA. And also, the cell will break down the mRNA as soon as it gives the instructions for producing the spike protein. Next slide.
Dr. Kassirier?
Yes.
I wanted to ask you, does the vaccine stimulate an antibody response? And if so, would that create future positive COVID tests? Would that potentially create that person who received the vaccine testing positive because they have the antibodies?
The COVID tests that we use identify parts of the virus. So since the vaccine does not introduce any virus into the body, it does not give a positive test.
Thank you.
So one of the questions also that's important for people to know about is with the vaccine reactions. When a person does go to get a vaccine, they will be told to anticipate that they might get side effects. And in fact, we are directed under the emergency use authorization that a person needs to be monitored for 15 minutes after they get the vaccine to make sure that they don't have any severe reactions. So the common side effects are pain at the site of injection, and a day or two after they may get headache, muscle ache, tiredness, or fever or chills. Most people get very mild symptoms, and actually the majority of people do not get any side effects at all. Rarely, a person might get severe side effects or severe allergic reaction called anaphylaxis. And that is why, in addition to the 15-minute wait, we also are at our site prepared to deal with these kinds of situations. But so far with the vaccinations that we've been doing, we have not had any anaphylaxis reaction, though we've had some that we've had to observe for a longer time. Next slide. So the vaccine management, one of the things that makes this different from, for example, the flu vaccine is that the vaccine requires very careful monitoring of temperatures, and the Pfizer vaccine actually has to be stored in ultra cold freezers, so like minus 80-degree freezers. So we have to be very careful in terms of making sure that we maintain the cold chain and also closely monitor the temperatures as well as monitor the expiration dates. So because of the specific handling of the vaccine, some of the providers that we usually work with are not able to deal with the Pfizer vaccine at this time. Some of the providers we have are using the Moderna, which can be handled using the regular freezers. But again, even with that, it still needs a lot of careful handling. And also, for example, when you open a dose or vial, you have 6 hours to use it. So that's one of the reasons why we make sure that we have people registered for the clinics so that we can make sure that we don't have any wastage of vaccine at the end of the day. Next slide. So moving to distribution, the vaccine is initially the initial distribution is at the federal level, where the federal government decides how much each state will get. And right at the top, because of a contract between CVS and Walgreens and the CDC, there's a certain number of doses that are allocated to these pharmacies, and these are specifically to be able to vaccinate residents and workers in long-term care facilities. And the region for targeting the long-term care facilities is, as you recall from information we've given before, we've had several outbreaks, and this is not unique only to Sacramento. It's throughout California and throughout the U.S. as well. Outbreaks have been very widespread in long-term care facilities, and because these are people who are usually elderly with chronic diseases, they're at high risk. And so, for example, in Sacramento, you find that 50% of our deaths are actually from people in these facilities. After the cutoff for the pharmacies, then the federal government distributes it to the states. And at the state level, in California, the state takes a certain portion of that for the hospitals. Initially, the hospitals, also called the multi-county entities, were given vaccine for their healthcare workers, and now they're also beginning to start vaccinating those over the age of 65. And after that cutoff, then there is a distribution to the counties. So we get a certain amount every week. We don't know from week to week how much we're going to get until the date when we get the email. So that does make it a little challenging for long-term planning, and we try to anticipate how many doses we're going to get. But usually we have to wait until we know for sure before we are able to plan for the following week. Next slide.
Madam Chair?
Yes. Yes, Supervisor Natoli.
Yeah, Dr. Kasari, just back to the last point you were making. If I recall correctly, last week we were allocated 960 vaccine doses for the entire county for public health to administer. Is that a correct number? And what is it for this week?
That was 2 weeks ago. Actually, we were allocated 975, and we understand because we asked the state about that week when they were making their allocations, the formula that they were using showed that because they were looking at how many people we had who are 75 and older, that from the information that they had, they were told that most of those were going to be taken care of by the hospitals. And so most of the allocation that was for Sacramento County was given to the hospitals. But we've had multiple conversations with them, and they've since told us that they will not do that again because they do recognize that not everybody goes to the hospital. And plus, Sacramento County was still at that time working to get through the Phase 1A, which is the healthcare providers that were not included in the hospital allocation. So we were short that week, and we did have to go to our hospital partners to get additional doses to take us through the week. The following one, we got 13,000, which is more closer to what we expected to get.
Okay, I appreciate that. So without getting too deep into it, so who were they relying on that told them that you're the public health officer? Certainly you've got your, I think, hands on a lot of this, you and your staff, and you know, to think that our county got, you know, again, obviously you went to the hospitals to make some additional available, but that, you know, when you look at a county this size, and I saw that number, I didn't have a chance to talk to you offline about that. That just shocked me. I thought that, you know, you get less than 1,000 doses. And then that was about the same time they made the announcement that, you know, now it's available to people 65 and older versus the 75. And as you're well aware, maybe you're going to touch on that later in your presentation, but that's caused, you know, quite a bit of angst and frustration for any number of folks. And I'm sure receiving some of the same inquiries and complaints about that. And I know you've done, you know, some good work over the last, you know, 8 or 10 days to try to clarify that. So we got 13,000 last week. What do we get this week?
I don't have the allocation for this week. And actually, the slide that you have up right now shows you the dates of when we get notified. And usually that goes to our immunization coordinator, and then she will let us know how much we have. I do suspect that it's about the same 13,000, but I can get back and clarify that for you. Okay. So, again, who were they relying upon for their information to decide that we were going to get less than 1,000 doses? They obviously weren't relying on you or your staff. And it sounds like that's, you know, I don't want to keep looking back, but that's, you know, we take a lot of criticism at the local level, as you're well aware, and a lot of the inquiries. And that, you know, to think of a county this size and make that calculation that somehow, to the discussion we had earlier about the diversity of this community and so forth, that, you know, everybody 75 and older was going to get, you know, large part get their vaccines from the hospital. So who are they relying on? Was that their in-house staff, or, you know, because obviously up to that point, I know you've been pressing and continue to press very hard for availability and access to vaccines. They got the information from two sources. One was a survey that they did with the hospitals, where they asked the hospitals how many of their patients were over the age of 75, and the other also is a formula that they applied to the allocation, because of course one thing is that nobody is getting enough vaccine, and so they use a formula to try and allocate how much, and this is dependent on such factors as the population size, as well as for the phase that we are working on, how many they estimate would be part of that. But they do admit that, you know, that this was a mistake, that they shouldn't have gone with just the information that the hospitals gave them.
So just one follow-up point then. So you went to the hospitals. Were we able to make up for the difference, the other 12,000, that we would have probably been in the queue for, or that's just, you know, you went to the hospitals, we worked with our partners, and were able to administer some higher number than 975. Or was there any offer to make up the difference? And so that rather than sending us 13,000, they send us, you know, 20,000 for successive weeks, not to short anybody else, but certainly to make up for what wasn't accounted for in that period of time. Or we just keep on going, and that was a mistake, and so sorry.
Yeah, they did give us, the following Monday, they did give us an additional 5,700 doses, but they did not make up for the 12,000.
All right. Thank you.
Okay. So this slide just shows you the dates on when we expect to get notified on vaccinations. So I'll go on to the next slide. One of the other questions we've been asked about is being able to get additional providers registered to help with also being able to administer the vaccine. And there is a process that the state has set up, and this I won't go into detail, but basically any provider who wants to get the COVID vaccine has to submit an application and be registered in the state database. At the beginning, that did slow down the process a little bit because, as you can imagine, everybody from around California, all the providers were trying to get into this database to be registered. So that did contribute a little bit to our slow start. But since then, it's been opened up, and right now we have about 57 of our providers in the system. And so what happens is every week when we get our allocation, we then look at how much we will need for Cal Expo, and then we redistribute the rest of the doses to the providers based on their need and also based on where we feel that the vaccine should go. Next slide.
Dr. Kasiri,
yes.
Are the instructions on how to get on that, apply through the state to be on that list at our website?
We do have a link on our website, yes.
So it's easy because I'm getting a lot of calls. I know I've forwarded them to you, but that's probably not as expeditious as if we needed just to send them to this link and they can apply through the state and you don't have to even deal with it. Is it?
We can certainly send out information to the providers also through our system to make sure that they are aware of the link. But again, also because most of the providers do not have the ultra cold freezers, most of them are dependent on the Moderna vaccine, so we're limited by how many doses we get, because even if we had 100 providers and we can only distribute to 50 of them, it does limit what we're able to do. But we can definitely put that information out.
Is it easier just to send them to you then, or would you prefer that we just send them to the website?
We at least the ones that you've sent to me, we've been able to talk with them, because oftentimes, in addition to getting the link, they also have questions about how the process works, and they want to know if this is something they're able to do at this time. So right now, we've still been able to manage with the emails that you send.
And that brings me to, is there a way to do a Q&A on the website around the vaccines so that there's one place people can go where they can submit questions and we can build on that. So because I'm getting questions regarding, people during some of these meetings, and I know we got some public comments via email regarding people who felt like their question didn't get addressed in one of the public meetings. I don't know if it was because time ran out or they felt like they weren't able to express all their questions. Is there a place where we could maybe do, frequently asked questions and post it on the website so that we have full transparency and people get answers to their questions around the vaccines and all that?
Yes, actually, we've worked with our PIOs and they've updated. We have a COVID vaccine webpage that provides the Q&As and provides additional information, and also has a link for a survey that people over the age of 65 can fill in, so that when we have vaccine available, we're able to contact them and get them an appointment. And as far as the community forum, I think the last one we did, we got as many as 800 questions. So within 1.5 hours, it's definitely not possible to get through all of them. But the facilitators have been going through those questions and sending them to us so that we can respond to them. And many times you find actually that it might be the same question asked a different way. So one of the things that facilitators do also is try and collate the questions so that they can get answered. But some of the comments we've heard is that sometimes if a person doesn't hear their question being read exactly as they typed it in, then they feel like their question was not answered. But we definitely are trying to do our best to answer the questions. We also do have 2 emails that the public can send questions to. One is COVID-19, and the other is COVID vaccine at saccounty.net. And both of those, we have staff that pull up those questions and respond to them.
So it might help to have frequently asked questions on the website. It might help curb some of them. That sounds like an awful lot of follow-up to do over and over with the same questions.
Sure, and we do have that, and our PIOs, I'll ask them to recheck and make sure that they're updating it with the questions that we're receiving.
Thank you.
Thanks.
Madam Chair?
Madam Chair.
Supervisor Natoli first, and then Desmond.
Okay, just real quickly, we got a email from a party. I trust you may have seen it, Dr. Casera, although I know the volume of the materials coming in is pretty heavy. That using the SurveyMonkey tool, that there's some questions, but that there may have been an optional portion of the survey that this party, I wrote to all of us, that they were concerned that some of the questions were of a political nature and may not have been appropriate for, to put out there. Is somebody looking into that? Are you aware of it?
I'm not aware of any political questions in there. What the questions that we received are because our survey does ask about if somebody has a chronic condition, such as hypertension and diabetes. And the reason for asking those questions is it helps us with being able to prioritize, because again, we are not receiving any additional vaccine, and yet the state did make the change and say that people who are over the age of 65 can now get the vaccine. So this is one way for us to be able to try and prioritize, because we know that people with chronic conditions are at higher risk for severe disease and death. And people do not have to answer those questions. They can choose not to. There is no political question in there. So I would like to know what the...
Yeah, so the correspondence received, Dr. Kasiri, says, however, after registry on the county site, there was an optional survey listed immediately below, which was administered by SurveyMonkey. There were routine questions similar to those on the daily basis for COVID survey conducted by Stanford. The person goes on to say, though, however, the SurveyMonkey on the county site also asked political questions like party sympathies, etc. And this person says that this is completely inappropriate. So maybe somebody can check and see what linkages there is beyond what was in the, and maybe, again, I don't know. This was correspondence though that we all received last Saturday.
Sure, we'll check into that, and if it's something that SurveyMonkey sends out, then we will look into that as well, because I do understand that if it's connected with our survey, someone could get confused and think that it's information that we're collecting, but we do not.
Right. Okay, got it. Thanks. That's all I have, Chair.
Thank you. So we'll follow up on that. So just quickly about the vaccine eligibility. Yes. Sorry.
Oh, excuse me. Sorry. Supervisor Desmond had a question also.
Sure.
Yes, thank you, Madam Chair. Thank you, Dr. Kasiri. And I certainly appreciate the how much you're making yourself available to the community and to all of us to explain things, because I know it's very confusing for all of us and certainly a lot of consumers out there and the public. Are you going to be talking about outreach and education? Because I don't want to get ahead of myself on your presentation.
Not in detail, because that would take up a whole other presentation.
Okay, all right. Well, so I had a question first about prior slide about that onboarding process for a provider. Once someone gets listed, maybe they get approved as a provider, does that then make them eligible only to be a provider for allocations distributed directly to Sacramento County Public Health, or also eligible as a provider for direct state or federal allocations?
No, only for Sacramento County, because the way that the vaccine is distributed, the state tells us how many doses we're getting, and then it's our responsibility to reallocate it. The hospitals are allocated to by the state, but for any of the other providers, it's up to Sacramento County. And the vaccine does get shipped directly to them, or if in some circumstances we have, after receiving the vaccine at Public Health, have repackaged vaccine to give to providers, especially if they're asking for something as small as just 100 doses. But otherwise, they cannot get the allocation directly from the state.
But again, those providers that have been approved through that onboarding process, say they get a direct shipment to them, like you just mentioned. Those are doses that are still included in your total count that you relate to us. Doses, in other words, that are directly controlled by SCP. Yeah. Okay, got it. I want to make, because I think that's where obviously a lot of the constituent confusion, and my office is getting inundated like everybody else is about this. And another question, you may have addressed this in prior presentations. For practical purposes, what influence or impact do you have over the way those local healthcare providers that are getting direct allocations from the state or the feds, what practical influence or impact do you have over how they handle the distributions, how they administer things? You
mean the hospitals?
Yes. And the other healthcare partners that are getting direct allocation from the state or
no impact. And actually, part of our discussions with the state has been in them being able to give us information about how many doses are going to the hospitals. But right now, they are dealing directly with the state.
I appreciate that. This helps me, when we. And then one final question. I think it's great. You have the Survey Monkey. I know you have means for people to contact you and your staff online. How about your outreach efforts to seniors who are not online and don't have online access? What efforts are you making to reach out to them and educate them about kind of where we are in the process and when, what resources they may have to find out about their own eligibility?
Yes, and that's been more of a challenge because we are so dependent on, the electronic information. One of the ways that we are working on that, we do have a coordinator that is specifically tasked with working with different groups, and so not only just the seniors, but also with some of the disadvantaged communities. And so we're still in the process of setting up calls with them to be able to find out what's the best way of being able to get information, or actually where we can even locate some of these mobile clinics. When we have enough vaccine, we've been able to have mobile clinics in certain areas. So being able to work very closely with especially the service providers, because if they don't have if they directly don't have like an email or way of getting the information, then we are dependent on their service providers to help us in being able to get the information to them.
Okay, yeah, I'm sure that's a challenge, but so very, very much needed. And one other question on the providers, we had brought this up a couple weeks ago about school districts, and I think the superintendent has contacted probably all the board members, and I've been contacted by other school district administrators, that they are clamoring to become authorized distribution sites themselves, maybe at a specific school or within the district. Have they been direct? I mean, would they be eligible to become onboarded as an authorized provider based on the criteria you've set forth?
And actually, the criteria is set forth by the state. Yes, and we have actually been in conversation with two of the school districts that already have one of the requirements, which is because they've been in the past they've been able to get flu vaccines, so they already have some of the requirements that are needed in terms of the refrigerator, staffing, as well as access to some of the state databases. So they're completing the process for being able to receive the COVID-19 vaccine, and we will be able to work with them so that we can start allocating vaccine to them. And one of the things that we're working with, it's still being worked on with one of the school districts, is we have an urgent care clinic that's been doing mobile clinics in some communities, and so they're going to partner to be able to provide it in one of these neighborhoods. And our hope is that once we have a model that works well, that we'll be able to use that in the other school districts as well.
Thank you.
Okay. And so I won't spend too much time on this slide, but just to remind everyone that we do have a prioritization that's been set up by the state. And so we've been working through vaccinating healthcare workers and those in long-term care facilities. We're wrapping that up and actually on phase 1B, which includes emergency responders, teachers, agricultural workers, and then those age over 65. So that's a broad group. So it will take us a while to work through it, but we're trying to do this methodically and just asking everyone to be patient as we work through it so that we can make sure that we have vaccine available. And we're also very pleased with partners, the hospitals. They've all contacted us and said they would like to be able to start helping us with vaccinating those over 65, even those that are not part of their patient base. And so we're working with them on details of how to do this, so hoping to be able to have more sites that, especially those over 65, can access to get the vaccination. Next slide.
Dr. Kassirier?
Yes.
I was wondering, are those individuals that are in the at-risk category more susceptible to having an adverse reaction to the vaccine?
No, the adverse reaction to the vaccine is based on certain factors. For example, there are people who have had allergic reactions in the past to other vaccines, or they might have severe allergies to one of the substances in the vaccine. So those are some of the questions that will be asked before they are given the vaccine. And for those individuals, they will be asked to actually wait for 30 minutes and be observed for 30 minutes. And we also do have EpiPens on site in case somebody has a reaction so that we can address it immediately.
Thank you.
So this slide, I won't go in detail again, but it just gives you a description of our operations and our planning. And when we are planning where to put the location of the clinics, we use both the data showing us where the cases are, as well as the populations that we want to be able to target. And then we get community input as well. We're still in the early processes of getting the community input. We thought we had a little bit more time because the way that the initial prioritization was set up, we wouldn't be getting to vaccinating the general population for quite a while. But now, because of opening it up to those over 65, we are trying to expedite that and have the conversations with the different communities and see how to serve the different geographic areas and the different needs as well, especially for those that don't have their own transportation, because at least now with the sites that we have with for example, the Cal Expo, people can drive to those sites, but if somebody does not have their own car or has difficulty with getting transportation, that would not be ideal. So being able to provide sites that are more amenable to the different people that need it. So we're still working on those details. So next slide. So this one shows you the types of clinics, and we use a term, medical points of dispensing. So you'll hear us talk a lot about MPODs. That's basically what it means, is the different clinics. And there are different types that we are using. All of these are scalable depending on how much vaccine we have. I know Supervisor Frost, one of the questions you had asked is, do we have a plan for if we get a lot of vaccine? And the answer is yes. But right now, because of the limited supplies, we're just have opened up only the ones that we're able to maintain right now. If we do get to a point where we're getting a lot more vaccine, then we'll be able to move further and open up additional sites. So the large ones, for example, are the Cal Expo, and then the smaller ones are, for example, what we've been talking about with being able to work with some of the school districts to set up sites at some of the schools. Next slide. Some of what we can do also, especially for some of the larger industries, I know that we've been contacted, for example, by places like the airport and also Amazon, and they've asked the possibility of being able to have a vaccine clinic at their site, and we're looking at that. But again, with limited vaccine, it does become challenging, but that is one of the options we can use once we have more vaccine. We also have what we call strike teams, and these are a lot more mobile, and we've been using those for being able to go to some of the smaller board and care facilities that are not part of the large pharmacy contract that the CDC set up. So making sure that we're able to have teams that go to those sites as well. And then the pop-up sites, I talked about urgent care, one of the clinics that is setting up pop-up sites at the different places, because we might not need to have an ongoing vaccine clinic at a specific site, but this gives us the flexibility and option to set up a site and then be able to move on to others. Next slide.
Madam Chair, I have a quick question.
Desmond, please.
Dr. Kashiri, sorry to interrupt you again. So,
Sure.
what about, is it feasible or advisable to co-locate any of the vaccination sites with any of the existing testing sites? And again, I apologize if this is something you had addressed in prior presentations that I wasn't privy to. Because, like, for instance, the one in Foothill Farms that serves Foothill Farms in North Highlands at Liberty Towers Church, I've volunteered there a few times. They've been doing it for a while. I mean, they're very efficient. They have the logistics down very well. What about those as sites that you can scale up for distribution?
Yes, those are sites that we've been looking at, and probably those would be the smaller clinics because of the facilities, but definitely the process that we went through in selecting those sites for testing, we did have this in mind that there would potentially be sites that we can use for vaccination as well. But we're reaching out to the communities to ask them if those sites do make sense for the vaccination as well, and then also discussing with the groups, the community-based agencies that are running these sites, to get them ready to be able to assist people to sign up for vaccination, and also assist with some of the logistics for being able to run these clinics. So yes, that is part of our thinking.
Great.
So the
Thank you.
slide, thank you. The next slide actually gives more details about the Cal Expo, and then also some of the future locations that actually have Jim Hunt already mentioned. Again, dependent on the need as well as the availability of vaccine, we'll be able to move on to those. Next slide. We also have the option of using vaccine trailers. These would be very useful for us to be able to use because everything is already contained within the trailer, and it would help us a lot, especially with being able to have the pop-up vaccine clinics. Right now, we do have 2 that are still on order. We're hoping to have them probably by the end of February, and definitely in March, we're hoping to be able to have them ready because especially when we start full on vaccinating within the general public, these would really be helpful because it would take away the need for setup and breakdown, and it would be easier for us to move from one place to another. Next slide.
Madam Chair, before you leave that slide, please.
Cerna.
Thank you. Dr. Kasseri, do you know whether or not anyone has spoken with any of our dental and oral health partners, especially those that have a history working through First 5 Sacramento, who have historically had their mobile units, they're in some cases large RV type vehicles that are, obviously outfitted with dental chairs and that kind of thing, that typically go out and do, varnishings and cleanings and checkups for especially our young people. There may be an opportunity to, I'm thinking there may be an opportunity to perhaps look at the use of some of those vehicles. And I suspect you wouldn't have to do much in the way of retrofitting. There was some discussion, I will say, about 3 years ago, relative to the Smile Keepers vehicle in particular. So I would just encourage you perhaps to coordinate or ask the question of Julie Galelo, our First 5 executive director, to find out whether or not there is any opportunity to partner with those agencies or those CBOs, those nonprofits that do already have medically outfitted vehicles to do remote vaccination.
Yes, we are looking at that, and actually our homeless task force, they have been talking with Elica Health that when we get to the point of vaccinating, especially the homeless, because Elica Health does already have a program that does outreach and provides medical services to that population, that they would be able to use their vans. So we would be able to do that. And for those that do have these vans, as much as we are able to use them for our purposes, I think it helps, especially I think the main thing that we would like to do is to have multiple points where people can actually sign up or get the vaccination as long as we have it available. So yes, we are considering that as well.
Very good. Thank you.
Thank you. So just switching gears to one of the questions that we were asked is, how are we ensuring that we are being equitable in our placement of vaccination clinics, especially moving forward when we get to the general public? So the state has asked us to use this framework called the Healthy Places Index, and it shows you the 7 domains that are considered as we look at the different neighborhoods to make decisions on which neighborhoods are disadvantaged, and so that we can have additional efforts in terms of being able to place clinics in those neighborhoods, and also being able to reach out to some of the CBOs that provide services in those neighborhoods, so that we can partner with them in being able to provide information about the vaccine, to address some of the vaccine hesitancy, and then also to assist people in being able to sign up for the vaccine as well and understand the information that we're providing for them. So we have not made decisions on the specific sites yet. Once we do, I will definitely bring that back, showing you a map of where the sites are and the input that we have received from the different community groups. So wrapping up, just wanted to show you what the allocation has been for Sacramento County Public Health. And as you can see, of the 87,925 that we have received so far, the bulk of it, 80,394 has, oh, sorry, I went to the next slide without letting you know. My apologies. Next slide, please. So again, as I mentioned, Sacramento County Public Health has received 87,925, and 80,000 of that has been redistributed or allocated to our providers. So they're all helping us in being able to give vaccines. So those providers include the community clinics. Sac State has opened up a clinic recently. Cal North State has also opened up a clinic. And then we also have some of the pharmacies that are working with us, such as Poochie's and then also Safeway. And there's definitely room for more partners, dependent on how much vaccine we have. So of the 3,157 that public health has dispensed, take that back. Public health has dispensed 3,157, and then we do keep a little less than 2,000 on hand. As I mentioned, sometimes there is some unpredictability with how much vaccine we'll get from each 1 week to another. So we want to make sure that we have enough to at least get us through some of those tight spots. And then we are also given vaccine for second doses separately. Next slide.
Madam Chair.
Yes, Supervisor Cerna, please.
Thank you. If you can go back to the last slide, please. Thank you. So I just want to be clear, the 80,394 that have been quote unquote reallocated to providers. Dr. Kasseri, is that the number, or is that the issue that you mentioned earlier, where you're hearing from the local hospitals that they're not going to do quote unquote do this again? That is kind of
So the numbers that I'm showing. Sorry, go ahead.
No, just in terms of acquiring the doses ahead of time, so that we're left with a very small balance to distribute cells. Not that there should be a turf war necessarily in terms of who has the doses. I mean, I think we can all agree we want the doses in arms, and we want to do it methodically, and we want to do it with a lot of forethought in terms of who's most at risk. But I'm trying to put the numbers with some of the statements earlier.
Right. So the numbers that I'm showing you, the totals, are actually from the beginning of the period where we started receiving vaccines. So this is from the second week of December. Sorry, the third week of December. It shows you the total that has been allocated to Sacramento County. There was only that 1 week where they made that switch where they gave us only 975. But otherwise, for the other weeks, we've been getting roughly about the same as some of the counties that are about our size. So it's been anywhere from 13,000 to 15,000 doses on a weekly basis. And as I mentioned, we do have almost 50 partners. And so we redistribute or reallocate a lot of our doses to those partners. And then we had a small clinic over at our primary care clinic, but now since we opened the large center at Cal Expo, we are taking more doses for ourselves. So in terms of the vaccine that we get allocated, that's separate from what the hospitals get. We do try as much as possible to make sure that we are distributing it through with our partners the providers that are able to receive it, because we do also see that being able to have multiple sites where people can sign up for vaccine will actually help to make it more equitable.
So I appreciate that. Moving forward, though, should we expect that kind of these ratios between what's allocated to providers versus what's dispensed directly through Sacramento County Public Health will be the same, or will that change so that it's a little more balanced?
That will change depending on how many partners we have and how much vaccine we have. We have expanded CalExpo, so we are actually hoping to be able to do over 1,000 per day starting next week. And so that means that we definitely will be keeping more for ourselves. And that, again, is only for the portion that we have control over. We have been told by the state that they will make sure that they don't make the mistake again, and that they, even though they will give a portion to the hospitals, they'll make sure that the larger percentage of it, I think they said 80%, will come to county public health.
Thank you.
Thank you. Next slide. So this this page just shows the resources that the pages that we mentioned where people can go to get information. The Sacramento County Vaccine webpage that we are managing together with the PIOs, and then also for any inquiries, the specific email address that people can email and get information or get on a wait list to be able to get vaccine. And that concludes my presentation. I guess there's one more slide that just shows when we did have one visitor come to CalExpo. Last slide.
Thank you, Dr. Casseria. That was so helpful, and I think it'll be helpful for a lot of the community that are wanting to participate in helping with the vaccine and to get the vaccine. And we have a couple more questions. Supervisor Natoli raised his hand first, and then Supervisor Cerner.
Yeah, thank you. First part of the question is for Dr. Casseria. Thank you, Dr. Casseria, for all your work ongoing and time you spent today. So at our discussion in December, the end of December, and then I don't know, it was touched on 2 weeks ago, but it was my understanding from what you reported that the testing was going to be shifting to, I guess, expand the capacity that the state was going to have available, and that might allow us to then adjust certainly the contractual commitments going forward for testing is currently, been in place for some time. Could you just give us a brief update on what the status of what that is and whether that's occurred yet? Are they up and running, or is it still anticipated? I just didn't head track it since we last talked about that in our board meeting a few weeks back.
Sure. So our coordinator for testing, Liz Gomez, has been working very hard to get it in place. We had to get a contract in place with the state lab in Valencia, and also get a courier system in place so that we can make sure that the specimens are able to get to the lab in time. And also we had to do a retraining of the staff that were over at the different sites. I think there are 13 actually that we have right now that we're managing, and making sure that they were able to get onto the new system, and then also hiring additional staff that would help with making sure that we collected the specimens in the appropriate manner. So that is still ongoing. I believe that right now many of the sites have started with the new system, and we're still in the process of getting all of them on board. We are also in the process of switching over with our long-term care facilities. We've been using STEM Express to process those specimens, and we're in the process of switching that over to the state lab as well. So that should take a little bit, because I believe we have, if I'm not mistaken, over 100 facilities that we all need to transition over. So it's taking a little bit of time to make sure that each of them has the appropriate process in place to make sure that the specimens do not get lost, go to the correct place, and that we have the career process in place. So we anticipate that by the end of February that the bulk of this will be done, and we will present our budget, or at least the status of our budget, to the administration, so that we can give you an idea of how much money would be left over once we've completed that transition.
Thank you for the update, and thanks to you and to Liz and to all the other folks who are working to cut that over. Obviously, with the idea of maintaining certainly the integrity of the tests and the quick turnaround and tracing and or information that flows behind that. So thanks for that. My second part of my question then goes to maybe to Ann and to Jim, Mr. Hunt. So we get the financial report accompanying this report, and I guess I'm curious as to, one, have we heard any more on the front as it relates to the December stimulus bill and to what it would provide as to whether it's CARES funding or something akin to that, and what that may look like? We had notice from the state, and I think as a part of my question, then going back to conversations we've had multiple times, and proposal we had as recently as a few weeks ago from some of the business representatives as to how we might provide some relief and recovery if and when the dollars would become available for this board to have some further discussion about. So I guess I'm curious, is there any update beyond just the financials that relates to the first CARES Act tranches that came through?
Yes, sir.
So Jim, I'll take the first part of that question, then I'll let you respond to the remaining funds that you have in the department. So we do not yet know what our allocation will be for the second round, unless Mr. Hunt and Dr. Kassiri have heard very recently. We do have many proposals from the business community, chambers, PBIDs, et cetera, that we are in the process of evaluating, so that once we know how much money is available, that we will be able to quickly allocate it.
Yeah, Supervisor Natoli, we've got no news on what may be coming down. We are as anxious as you are, but let me say that we have been working with Economic Development and the Deputy County Executive to look at the proposals we've received, and using our own process and what the community need, we've been evaluating those and are hoping to be ready to go very soon after we get any information from the feds or the state as to what might be available. We want to be able to move as quickly as possible and get money out to the businesses that we know are hurting.
Thank you both for that. Just one other comment then. In this, certainly with news both at the federal and the state level of the extensions on I think the news that you brought forward last meeting, and that we received notice that we were going to get $30 million in rental assistance. I think some coordination, obviously, not just with renters, but obviously, the community, the rental community, rental housing community as well, and how that rolls out. Obviously, allowing folks to stay in place and maintain their housing structure, but also then what that's going to look like, what sort of relief it provides both to renters, but also working folks who our landlords that, in some cases, it will be a year under the current order, as I understand it, or more than a year with deferrals and so forth. So how that plays out, I guess maybe some report on that going forward would be, I think, useful for people we represent, but also to kind of know how we're going to administer whatever dollars are available to the county to assist them.
We can certainly bring that back next time at the next meeting.
Okay, that's fine. Okay, good. Thank you. Thank you, Madam Chair.
Thank you. I have one question that kind of goes back to Jim Hunt's portion of the update, and that was relating to the new cases that are reported on our website. And I noticed that although the 7-day average is going down, it seems like every Monday there's a surge. And I was just curious to know why there are more on Monday. Is it because we're catching up over the weekend, or it seemed like the number of cases on Monday versus the rest of the week is much higher?
Oh, I think you're right, Supervisor Frost. I think it's a reporting anomaly, not that Monday's a bad day. I believe you're right. The weekend catch-up on reporting is probably the biggest issue there.
Okay. Supervisor Cerna, you had a question?
Yes, thank you. Well, more of a comment. On Friday, I had a chance to spend a considerable amount of time at both our primary healthcare center with Dr. G and his staff. These are all the staff that are doing the epidemiological follow-up and the testing, and had a chance to have some good conversations with his very capable, skilled staff that are on the front lines there, as well as visit the vaccination site at CalExpo. And of course, in both instances, I wanted to make sure that all of our public health professionals know that they're very much appreciated by all of us. Question for Dr. Kassiri about the CalExpo site. You mentioned, and I saw for myself, how the ramp up to 1,000 a day, where that would be staged and how it would be managed. But is that limitation of 1,000? Is that really based on the space, which right now is one of the livestock showing arenas? And if that is the case, is anyone looking into perhaps other drive-through indoor space, either at CalExpo or elsewhere, where we might be able to increase the number more than 1,000?
Yes, we are looking at other sites as well, but I think that what has helped with CalExpo is that it's been easier for us to be able to actually expand it. We started off with just 4 lanes, and I mentioned that we're going to be able to expand that to 10 lanes, and we're working through the logistics of that starting next week. And definitely there are ways in which we are able to increase the throughput as well. I think the reason that we are still sticking with the 1,000 per day is because of the limitations with the vaccine. We are very appreciative of our collaboration with the National Guard. And in fact, recently we submitted an additional request, and they sent additional units for us to be able to expand. So there is still capacity to expand at CalExpo. We are looking at other sites, but right now this has been very convenient and has lent itself very well to the operations that we have.
Great. Thank you.
And I just have one more question, Dr. Kassiri. The state approval of locations for vaccine dissemination, if they are on that approved list, do they go on an approved list that you have at the county? And is there, are you making tentative contract agreements with those that you've selected, so that when those come down, it can be activated quickly, or what? Or I'm just, because I'm getting those calls, and so I'm wondering if there's a way to let them know whether or not they qualified and why, and so that they know where they stand, because there are several that are really excited about helping. I'm just wondering how you're working with them in preparation for those vaccines that are coming.
So there are two types of calls we're getting. One is the providers, and those do have to register with the state system in order to be approved to be able to get the vaccine allocated to them. As far as locations, that is at our level, the public health, and we've been working with different partners in being able to do that. In terms of where we decide to locate some of these clinics, some of the factors we're looking at is the population as well as the need in each of those areas, and working closely with the different communities. We in order for us to allocate vaccine to the provider, we do not need a contract, because that is already put in place when they get approved by the state, because they actually agree to abiding by all of the state guidelines and rules. But as far as where the different clinics are placed, it is dependent on the type of facility. For example, with CalExpo, yes, we do have a contract in place. If we were to move it to another large arena, we would probably have to work on a contract as well. And also with some of the schools also, we'd have to look at the arrangements that we have in order to decide whether a contract is needed or not. We are looking at all of that and in multiple discussions with the different sites in being able to make determinations. And also, as I pointed out, again, what we're looking at is a scalable plan where we have decisions as to where the different clinic sites are right now, but also looking in the future of where we can have additional clinics and having those conversations so that if we get more vaccine, we would be able to expand.
Okay, well, this was an amazing presentation. It's much appreciated. It's obvious that you have the vaccines plan rolling and under control, and I'm excited that you were able to bring this, because this will help. I think it not only help us, but help those out in the community that have questions. So thank you so much I know that was a lot of hard work to put that together so fast before today, and I really appreciate you and Jim Hunt for doing that. And I know we do have some public comment. I believe we have a public comment at this time. Do we?
Yes, we do. We have one public comment.
Okay, we can move forward to public comment.
Please start with your comments. You have 2 minutes.
Good afternoon. This is Richard again. I want to start with something prevalent with COVID. When we're waiting on hold to speak to you guys, we listen to some real boring elevator music. But it might be, I know it's possible because I've heard it at state level and other city council meetings, to have the meeting streamed into the background while we're waiting on hold so we can keep up with what's actually being said. Going to the COVID, started out your health portion of this with the doctors reiterating a false truth. And that false truth is this mask insanity of people being so self-righteously believing that they're saving the world by wearing a mask that supposedly stops a virus, which is farthest from the truth. You have to take a look at putting chicken wire up in front of your door to stop mosquitoes from coming in the house. That's as well as a mask will work on a vaccine. What the mask does is it might help people that are sick from catching a bacteria, let alone they might catch their own bacteria. As I did have a friend just recently die about a week ago because he wore a mask and got a bacterial infection in his lungs. That is truth. And of course, your current doctor may not want to tell you that truth. She's not being asked it directly, but that is the truth. And the masks worn even on the boxes, they won't stop the spread of the virus. So on that, they have put this false truth on people out of fear of the bug, and they're putting that thing about the vaccine out of fear of the bug. When the vaccine, by its definition, if you look at the definition of vaccine, it's not even a vaccine. Of course, will you ask the health doctor that? Is this actually a vaccine by definition? Will she be willing to lie on record about that as well as all the other false truths that she's preached? The union hypocrisy about the Browns Act. They haven't been concerned about all the violations of the Brown Act in the last 9 months until it was something that might benefit them, even though there wasn't a violation of the Browns Act. So the unions don't represent the people. You do. We do. We're the government, not the unions. So please stop the fear-mongering about
wrap
this
up your comments.
COVID thing. Thank you.
Thank you. And do we have further callers, Flo?
No, you don't. That concludes your public comments.
Okay, and do any of the board members have any further questions or comments before we move to the next item? Hearing none, I will say thank you, Jim and Dr. Kasiri, for a very thorough report and for doing this every time we come together. I think it's very helpful for all of us, and we really appreciate it. And next item, please.
Item 37 is the homeless response update.
Good afternoon. This is Cindy Kavanaugh, County Director of Homeless Initiatives. I do have a PowerPoint. Looking at the intro page, I want to start by recognizing my collaborator in this presentation and the material you received on county programs serving families, Ethan Dye, Acting Director of Department of Human Assistance. We've approached this update with a deeper dive in this PowerPoint presentation into family homelessness, and that will be followed by verbal updates on some related and additional topics. Going to slide 2, to give some context to family homelessness, I want to provide three opening comments. First is to recognize the cyclical nature of family homelessness. Family homelessness episodes are typically part of a longer period of residential instability involving frequent moves and doubling up with relatives and friends as families strive to remain housed. Secondly, families experiencing homelessness are more similar to other poor families than to single individuals. The most important stabilizing services then are those that are applicable to both families experiencing homelessness and just poor families, and they relate to income stability and access to subsidized housing. And then my last point in the context is the prevalence of homelessness is higher for young families and African American families. Young adults experiencing homelessness are disproportionately parents. Going to the next slide, which is slide 3. At a national level, family homelessness and unsheltered homelessness has been declining. And also of note, there are more shelter resources, that is crisis response resources, than identified housing resources. So it's been noted in national observations that there is a bit of a mismatch at the national level. However, the states and the local picture is different than the national picture. Going to slide 4, it cites 2 sources, the point-in-time count, which is from 2019, and the housing inventory count, both linked in this slide, which is the inventory of all the resources that we report to HUD to respond to homelessness broadly. Family households represent 9% of the population, and the PIT found about 1,140 people in family households, or 372 family households. Just want to note that the unsheltered portion of that population includes in the PIT, per HUD guidelines, persons staying temporarily in motels with a voucher, including the county voucher. On the shelter side, or the resource side, there are 742 shelter beds, representing 46% of the shelter inventory, and family permanent housing is about 49% of the housing inventory in the HIC. We do recognize that no family should be unsheltered and are expanding the network with the eyes on the street to identify unsheltered families, and I'll go into that a bit more later. We're also digging into more current data to confirm what's happening now and to reconcile some of the data to what our networks on the streets are seeing. Going to slide 5, given the cyclical nature of family homelessness and housing instability, prevention and diversion solutions are essential, and that's what that first column is showing. Getting families back into stable and safe housing as quickly as possible and connecting them to mainstream resources is also essential if we are going to help them avoid the crisis and trauma of homelessness on children and on the family. And then the third underpinning of solutions underscores the central role of subsidized housing options. To resolve homelessness and housing instability, families need housing that they can afford and sustain. In fact, subsidized housing is the most important predictor of ongoing stability for families. So looking at Sacramento's, moving to slide 6, Sacramento's response to family homelessness, the county supports a range of interventions to address the needs and aggressively seeks funding or flexibility within mainstream funding to serve at-risk and families experiencing homelessness. Part of this material with this presentation today is an 8-page of those programs. That is county-supported family programs in the crisis response area, from prevention and diversion to sheltering to supportive services and housing. And I'll just note that that listing does not include programs identified as primarily serving youth, although I did point out earlier that there is this very large crossover, and it doesn't include programs operated outside of the county. Moving to slide 7, this slide is about, just highlights a few of the diversion programs or prevention programs. Obviously, the CalWORKs menu of programs is a very significant part of this, but also important is the shelter diversion funding we added in the initiatives a few years back to really work with families who are at the front door in that unstable housing cycle, but may be able to stay in the place where they are safely. And that program has been successful, and we are looking at how we might expand it. And then I've also noted on this slide some of the community programs that I would like to see deeper connection to. These are programs that serve families in crisis, have resources. Some are more housing-based, some are less housing-based. But this is just an example of some of the programs outside of the county network that it is important to connect with. Under the emergency shelter slide on slide 8, this has a little bit, let me note, a mix and match of units and beds. There are 60 family units, and just assume an average of 3 beds per family. At 3 shelter sites, there are 125 domestic violence beds serving families. At 3 sites, there is motel sheltering, which happens for those who are unsheltered, for the most vulnerable, including families. And I'm going to speak a little bit about the new weather respite expansion of that. There has also been the medical isolation during the COVID-19 pandemic. The county capacity is at about 165 families nightly. Going to the slide on rehousing, which is slide 9, I just noted some of the programs in various departments that have been really important and exciting to see. Some of them are new, two of them are new. So the Bringing Families Home program offers both prevention and rehousing assistance to CPS-involved families. And the CalWORKs Housing Support Program is a very major program helping families to be rehoused. And then the recent addition through the behavioral health flexible integrated treatment side, adding the rehousing and the housing risk dollars to those providers. And just in 2020, you can see 249 children and their families were served in that program. So the slide 10 talks about accessing county homeless services. And I'm going to characterize that access in 3 ways. First, on the left is the access for persons who are living unsheltered. That is primarily through our outreach partners, including law enforcement with 24/7 eyes, who have access to vouchering and can place that family in that situation when they come across them. But we're also increasing that, and it's through outreach workers as well. We're increasing that outreach presence in the winter respite program using an expanded network of providers who are identifying vulnerable persons, including families, for that service. The middle category is what I call safety net services. This is where services, we meet the families where they are engaging with services, and they're either at risk or experiencing homelessness, but are seeking services or otherwise engaged with services in those places. And that's a really good way to find families and provide homelessness services. And then on the right is what is called open access or system-wide access. So families are the only subpopulation that have this identified phone number for bed reservation and have a place to go, which is when open the CalWORKS bureaus. Both of those places allow us to quickly connect families, not just to a shelter bed, but to have a more nuanced conversation and engage them in broader services, some of those income and employment supports I mentioned as earlier as essential to both resolving homelessness and ongoing housing stability. So I'm on the last slide called takeaways. I'm just going to highlight a few things and then turn to some verbal updates. The county crisis response services, as I just said, are embedded where families are and leverage multiple complex funding sources. The family programs are diffuse, and that can sometimes hinder a system-wide coordination and evaluation. So that's something we can look to improve on. The county has created these family access points, but reaching families in crisis is an ongoing effort, and I mentioned some of the ways we can look to improve that. And then finally, the family crisis services are robust and diverse, but the funding is rather complex, and some of that continuing those services is dependent on those funding sources, but also on connecting to the broader family support services, particularly around jobs and employment and reemployment and housing, subsidized housing. So I am going to turn to the verbal update. Would you like me to continue? I haven't heard anything.
I don't see any hands raised.
Okay, great. Okay, thank you. It's a little hard operating virtually. I know I'm usually looking at your faces, and I'm not doing that right now. So let me give a few verbal updates.
Cindy.
Yes.
Cindy. I'm sorry. Yes. I saw a hand just as I released it for a question. Supervisor does question.
I'm sorry, and thank you, Cindy, and thank you very much for the conversation we had last week as well. Just back on slide 8 under the emergency shelters, the 60 units at the 3 shelter sites, 125 beds at 3 additional sites, and then another 165 capacity for 165. Is that total, or is the 165 just the 60 and the 125, or those additional beds somewhere?
So that is the total number of families the county supports in shelter. That's the confusion between the beds. What the first 60 is for families, and the second one was beds. But that is what we estimated as the county capacity. Yeah.
Excuse my slow uptake.
That's all right.
And I really appreciate you on this update focusing specifically on one kind of group. And I, in my conversations with Ann yesterday, she said that's going to be kind of the ongoing theme, I guess. Maybe in a general overview of things, but you'll you'll focus on one area when you give us these updates. And I appreciate how this is such a, I mean, like every group of folks experiencing homelessness, how complex it is to serve them and find resources for them. With respect to families, what is, and I also looked over the chart of all the different programs. What are some things you think we could be doing? What things that are most effective and that we can be doing more of if we had the resources to reach this specific group?
Yes, I would point to that last slide where there are some of the thoughts around that. So I think we can do more coordinating across departments as well as externally on family services as well as families in crisis. I think moving upstream, we have done, recognizing the cyclical nature, we have moved upstream, if you will, so we are trying to prevent, but I think looking at how that diversion program has worked and looking at perhaps supporting it more would be another theme I would mention. I think we need to continue the conversation with external partners as to what we aren't seeing, as well as, sharing what we are doing and what we are seeing. So I think that is more, and it relates to this broader network of services that families need and use. And that brings me to the point of really also connecting to families in crisis and programs that support poor families in general. Again, we do a lot of that, but I think we can, families cycle in and out as long as they cannot really afford their rent. And so what's been found nationally is that biggest predictor of stabilizing in housing is subsidized housing. Now, can every family have that now? No. But can we do better on connecting families to subsidized programs, to public housing, to places where their income, they will pay a third of their income? I think we can do a better job there as well. So a lot of my answers focuses on coordination, evaluation, but also the housing and income needs to stabilize families.
Thank you.
Mm-hmm. Supervisor Natoli. I'm sorry, we can't hear you, Supervisor Natoli.
Okay now?
Yes.
Okay, thanks. Thank you, Cindy. Kind of piggybacking on what Supervisor Desmond had inquired about. So, again, you point out, what we've been able to provide, how we triage in some cases, and I appreciated the reference to, moving further upstream to actually, get to some of the roots of the problem. But what's your sense? Because again, you've coordinated with these county departments, and I guess what's really on my mind is, we're into a weather pattern that's, been more typical of many years past of Sacramento weather with rain and cold and wind and so forth. But it makes me think about folks who maybe, in their cars, haven't been identified, may not know how best to access resources. What's your sense about meeting the ongoing demand at any given? And again, I'm kind of more from the urgency situation versus, again, what will potentially become that because people fall behind the rent or whatever. So what's your sense about the percentage? Because when I look at the numbers, again, it reflects a whole lot of good effort. We're talking about hundreds here, not thousands of individuals. I guess maybe we are with families. You total them up in any given year. But, when we talk about 125, it's not inconsequential. We're meeting some of the need, but I want to get some sense about, because I like my colleagues, and I'm sure you as well, get input from a lot of different sources. And, I think, part of what prompted this report back was, some of the providers saying that, we're still, way short of the mark here. So again, I'm trying to get some sense about what you think we're meeting is relative to demand, and that may fluctuate, but.
So I'm going to start to answer that and then also ask Ethan if he wants to add, because it's a question really on our mind, Supervisor Natoli. We have the data, some of it's old, we have the numbers, and we also have the networks of what we're seeing and what they are seeing on the street. I do think there are unsheltered families, and do we get to them as quickly as, obviously families will become unsheltered, and our, goal is to get to them as soon as possible. Relying on the outreach and DHA outreach as well as other outreach, when we come across families, we can provide those sheltering services in a motel. And again, can we improve the network of people with eyes on the street? I think the winter respite sheltering is already doing that, looking for vulnerable individuals as well as families with young children to offer this sheltering through an additional 40 to 60 motel rooms, not during the season, not reflected in the numbers I gave you. So we've had some conversation with some of the providers. We certainly follow up with any lead we get. But my sense is, perhaps it is mostly in cars. And I know there are some areas of cars that I've noticed of recent that have expanded. So it may be that is where. But I think we struggle with the numbers and then using our on-the-ground network, including law enforcement, to say when you come across families, we want to bring them in. And so I think we have more work to do to understand what's out there through the partners as well as the data, and some of that work's underway. And I don't know if Ethan wants to add to that.
Thank you, Cindy, Supervisor Natoli and Board. Ethan Dye, Acting Director, Department of Human Assistance. I think Cindy actually said it really well, and what we're seeing is different than what we're hearing. And when we get an inquiry from one of our providers about a family, we act on it as soon as we get it. So I really, we're struggling with the data, and we're struggling with the question of where are the families at so we can get to them. And so I think that part of what you're going to hear in the winter respite expansion piece is, in order to have more boots on the ground, we have to increase our provider network and have a better system of tracking and data to be able to know and do our best outreach to ensure that families are safe and taken care of.
Appreciate response by both of you. Just going to follow on, because one of the comments that seems to me has been fairly current that we've had that, the concern by folks who are, surviving and trying to keep their family unit together and struggling with whatever issues have, contributed to their homelessness, but concerned that if they come forward that due to other factors that, they might have their children put in protective services, they might face incarceration, any number of other things that obviously would weigh on their mind besides just trying to, survive and keep their family safe. So how do we, I think, and I think this has to be a constant affirmation and reaffirmation to folks that, yes, we're here and willing to help and do our best to help cope with some of those situations, and that, we're not approaching it from a criminality standpoint or, neglect standpoint. Obviously those conditions might exist, and we have people who are very skilled at trying to decipher that, but, to the point that both of you made is to help them get that housing for them and their family and get them to a safe place where there's, hot and cold running water, and there's heater and air conditioner, depending upon the season, and, a bed to put your head on and so forth. So I guess, has it been your sense that is a barrier? Because that was mentioned in some of the written communication we had, several weeks ago, but I kind of get the sense that maybe why some folks really hunker down beyond just trying to survive?
This is Cindy, and I'll start. I think it's been hard for us to quantify that, or more than we hear, or this may be a barrier. I think what I have heard more and seen more, and I think would be borne out by the DHA frontline staff, is the reluctance for families to go into congregate settings, especially during COVID. So I do think there are barriers, and we did make those efforts to really reduce those barriers at the shelters, to make it longer stay and not a cycling there, to really focus on housing, to accept pets and partners and different family configurations. So I think that is one area. Whether the other, I think we tried to track that down, and I do not think we were successful. But it could still exist. I'm not discounting it completely. All kinds of barriers exist to people being interested in a shelter service or another service. And a lot of it is dealing with the crisis that they're in. So there is, and we've had some good conversations on how we can make even our bed reservation more accessible for folks really in crisis and unable to manage that. How can we lower our barriers for that service? We thought it was low, but it needs to be lower. So I think we can constantly get that feedback and look at that. And I would ask Ethan if he can think of other specific conversations we've had on that or ideas.
This is Ethan. Yeah, I think part of the family concern is, especially around some of the stuff we've put in place, is knowledge of what comes next. So we have, somebody will go in, be able to be signed up for our bed through the reservation system, and there's nothing out there that says what to expect next. So then they go out to one of our community providers who knows how to get in touch with somebody here. So it kind of looks like there's this, you can only access services by if you know somebody. And so I think that one of the things that we can do better, and so I think Cindy alluded to it, was, redesign our systems to be user-friendly and to give them information. After you do this, you're going to get your reservation number. You're going to be able to, we'll contact you. Here's what you can expect. So at least it will start to release or alleviate some of the additional stress of, I got a reservation number, now what? I don't know what to do. I don't know what to expect. So I think a lot of it really hinges on how are we in the community, how many of us are out in the community, being able to talk to families and really engage in the network. And I think that's really where we're at. And I think that there's definitely some things we can do better, but I also think that we need, as a community, for our folks, the navigators and the people that we work with, to let us know where folks are so we can actively engage them in housing and continued supports.
And I would just add to continue to get that feedback on, things that may be barriers to the system, because that is really important. And we look for that collaboration with those other, all the community partners working with families. I will go to my updates unless I hear another.
No, just let me finish. I just wanted to finish one comment, Madam Chair.
Sure.
Yeah, well, I wanted to, again, thank you for response, but I also wanted to say that, and I mentioned this to Ann yesterday in my briefing, that, I think there's an opportunity, particularly with, and I think maybe taking some of the mystique, for lack of a better description, or uncertainty out of, what happens next. I appreciate that response, but I want to just offer that, again, it will take some investment, both capital, but obviously having the programmatic support. But I still believe that the Mather campus, that recognizing that family sizes, can fluctuate and so forth, that, going back 20 plus years ago, we authorized up to 60 families out there. And obviously that program has evolved as well, but it's a critical piece of the, access as well as delivery of services for folks, particularly families, as well as others that are single persons. But I would just offer that, I think with an approach and a plan that this board obviously did and be a part of, a discussion and commitment if it's going to be forthcoming. We have an opportunity out there to We've got 25 acres of land that has some very old buildings that have served this community well, as they were repurposed, following the closure of Mather. But I just think there's an ability to do some things there that, reinvest in the campus, obviously working with our providers of services out there. And I would just encourage us, as we're looking long-term, because that's not necessarily congregate. You have apartments and such, and I think there's services that are available. Obviously, I know they are. And I would just say that as we're looking at how we do things better, recognizing that, subsidized housing is maybe the end game, but we know how long it takes to build subsidized housing for more permanency. But I do think that Mather provides some opportunity if we have some, particularly as we're just the numbers of folks that need to be served. So I would encourage us to continue to look at that, but it's going to require some investment and reinvestment at the campus. That's all I have to say. Thanks.
Thank you. I know Supervisor Cerna wanted to say we're up against the clock. It's 10 minutes after 1, and so I'm going to, I guess, use the chair's discretion to push item 38 to 2 p.m. because I know we also have a closed session, and we're going to need time for that as well. So unless anyone has any objections, I'd like to do that. And then Supervisor Cerna also had some comments, and we do have a public comment caller waiting on the line for this item also.
Thank you. Just a quick question off of both Supervisor Desmond and Natoli's, I think, rightful concern focus for families, especially the uniqueness of how families in particular have been impacted during the pandemic. I'd like to hear from either Ann or Jim about whether or not we are currently looking at any budget programming from this latest round of federal assistance that would be specifically directed to enhance, the array of programs and support, safety net support for families suffering homelessness in particular. Because I think I know we as a county, we have the broader public health charge, and certainly that's going to be part and parcel of how we continue to use state and federal resources. But it seems to me that especially first-time homeless families are unfortunately kind of the newest victims of homelessness due to the consequence of losing jobs or missing rents. And it seems to me that would be a really wise investment for this board to be considering here in short order in terms of how best to apply some of those resources. And it's not to suggest that we've done a poor job in terms of what we've allocated in terms of tens of millions specifically for public health, but this certainly is also a very dire need in our community, and so I'd like to hear from Anna and or Jim about that.
So this is Ann, and we have not yet had those conversations. We certainly can, and I don't know if Jim has internally. I do think, and maybe Ethan can weigh in on this, I'm not 100% sure, but I do think there's some additional funding in the governor's budget for at least CalWorks families who are homeless. But we can definitely have that conversation.
And maybe it's a matter of using a complement of both sources, not just one or the other.
Yeah, no, we can consider all of those options. Yes.
Well, I for one would love to have either one-on-one report backs for each of the board members, or we can agendize it at some point, maybe in the broader context of how staff sees the most effective use of the new tranche of federal assistance. But this is a good discussion, especially as it relates to families and homelessness. And so I think you're hearing from all of us that's definitely a priority. And so I'd like to see that reflected in how we use those federal funds.
Okay, thank you.
Okay, and at this time, I think we have a public comment, a caller on the line.
Yes, we do. Please transfer the caller.
Please start with your comments. You have 2 minutes.
Hi, Supervisors. This is Kula Koenig from District 3. I'm calling because, I really enjoyed this discussion. I was listening when Supervisor Desmond asked Ms. Kavanaugh kind of like what her thoughts were in terms of what can we do. And I was, struck by the same thing. She started speaking in generalities around, coordination with the other departments, or let's just know what the needs are. It wasn't until the end that she said, and rent control. It was almost like that's a throwaway, but that actually should have been first. You as a body need to focus on policy versus programs. Programs can be easier. You can say, what can we throw at it? But that doesn't get at the policy, at the systemic things that are keeping people on the street. When you look at rent prices having gone up about 16.2%, right? Median rent being $1,400. It costs less for me to own a home than somebody who's renting. And that's why people are on the street. I was in a meeting with the community impact group of Arden Arcade. And we were talking about how the rent is getting so high that people are being put on the street. But also what's happening is that those who are immigrants are also being discriminated against. So landlords will rent to them, but they're afraid they can't say anything like if they need pest control or if there's mold or if they need something fixed because they're going to get kicked out of their house. And so I'm asking you to actually be really bold. Be bolder than asking for what types of programs, but actually, Ms. Ann Edwards-Buckley, come back with some discussion about some policies that we can take to protect people from high rent prices, from them having to live on the street, or being afraid to call and say there's mold in my apartment, but I'm an immigrant, and I'm afraid that if I say anything that I'm going to be kicked out and be on the street. You have to be bold about the types of policies and not just talk about the programs. When the moratorium was going to be out at the end of this month, the city of Sacramento at least had a discussion on what they could do if the state didn't come in. I didn't hear that from the county.
Please wrap up
somebody
your
who lives in
comments.
an unincorporated area, this is what I'm asking you all to do. Thank you.
Thank you. Okay, we are now, does anyone else have comments or questions of Cindy? And I'm seeing that Supervisor Natoli.
Yeah, I just wanted to say, I'm not, was Cindy done with her presentation? I think we kind of jumped in. I mean, I'm certainly going through the chair. I wasn't quite sure if she was done. Or maybe she is, but I thought maybe she had more to go through.
Cindy, I'm going to feel terrible if I interrupted your presentation.
Well, I did have some verbal updates on some other topics. If you'd like, I can give them quickly.
That'd be great.
Okay, I will do it as quickly as I know you have a very demanding schedule. So with the COVID-19 homeless response team, I want to say with the most recent funding from the State Department of Social Services of $2.28 million, bringing the total to $39 million, $25 million of which is from the county sources. We plan to continue the preventative quarantine and medical isolation in a staggered closing, with one motel closing mid-February, one mid-March, and the third the end of March. That is what current funding can allow, but we will continue to look as new resources become available. And we also continue, with the sanitation and water through March, as well as the rehousing efforts. A caller mentioned the low incidence of the COVID-19 in the population. We have worked very hard towards that goal, and so those efforts continue. Let me say that I mentioned the new non-congregate winter respite sheltering. DHA has very quickly and has operationalized as of yesterday the increase in the ability of that program to respond during weather events that are more liberal than the existing OES standard, and it makes sense to approach it that way. So with $600,000 from the Sacramento City County Continuum of Care and Sacramento Steps Forward, we are anticipating an additional 40 to 60 additional motel rooms during the weather-related events. And we are awaiting final state approval, but we have had the early indication that this is a go. So we're very happy to get that on the ground. I want to mention I wanted to mention some new funding. I mentioned last time the Housing for Healthy California. That's about $10 million going to rehouse about 125 households that are behavioral health clients using an approach like the flexible housing pool. That was a competitive award. The HAP2, which is the the state's homeless assistance housing prevention program. I got it nearly right. We just submitted, DHA just submitted application, as did the Continuum of Care in the city of Sacramento. We've put in an application to continue the weather respite approach to really respond to the unsheltered homeless population, as well as a continuation of the encampment team, as well as youth activities. You will see that application and have an opportunity for input, of course, but it was a very tight time frame. And then finally, on the new funding side, mentioned last time was the $31 million from the Emergency Rental Assistance Program. Planning is underway with Sacramento Housing Redevelopment Agency and county departments on how to get that funding out to prevent folks being evicted with help with rent and utilities. There are some changes in the program from that $1 million program that you approved earlier, but we're going to learn from that program and really have hopefully a good way to reach these families we've been talking about. And this is huge, so I think that's really exciting to look forward to. I think with that, I would like to end. I had a couple more, but I think it's okay for me to close there.
Cindy, we thank you so much for your update and for all the work that you're doing, and we'll look forward to the follow-up on some of those items that the supervisors brought up. And at this time, I'm going to adjourn to closed session. I want to remind everyone that we have two phones numbers to call into, and we're going to call into labor first. And so meeting is to closed session. Good afternoon, everyone. Welcome back to the Board of Supervisors meeting dated January 26th. I'm going to ask our clerk if she will call the roll and reestablish quorum.
Yes, Supervisors Desmond,
Here.
Kennedy,
Here.
Natoli.
He's silent. Hope not for the entire.
There we go.
Okay. I think Super Toli's sound is not working right, so you may want to be aware of that. And
that's because I have control of it now.
Okay, this meeting is hereby called to order. We're back to business. It's been a big day, and we just finished our closed session, and there are no items to report out at this time. And I'm going to ask our clerk, Florence Evans, to read the items 38, 40, and 41. We, in view of our timing today and the meeting being so long, we're going to push a couple of our agenda items forward to the next meeting. And so, Flo, would you please read those out for the benefit of anyone who might be watching or calling in on those items?
Yes. For item 38, this is the domestic violence in Sacramento and the impacts of COVID-19. We are continuing this item to February 9th. And then for item 40, this is the George Schultz annual report presentation. We are continuing this to February 9th. On item 41, your board will take up that item after you take up item 5, but you will do a partial action on that. That item will call for an appointment and then to continue the balance to February 9th. So when you are ready for item 5, let me know and I'll go ahead and call that into the record.
Please proceed with item 5.
Okay, Okay, for item 5, This is the BT Collins Youth Detention Facility, replace personal alarm device systems, bids to be received on February 25th, 2021. This was an item that was on your consent calendar and it was held over until 2 p.m.
And I believe Supervisor Natoli had wanted to push this forward to 2 p.m. because there were some questions he wanted staff to address. Oh boy, we can't hear him. Sorry to say. And is there something you could start with? Because I know he had asked questions.
I am unfortunately not aware of the answer to his questions.
Hi, this is Jeff Gasaway with General Services.
Hi, Jeff.
Hi. I believe Supervisor Natoli's question was related to, how long do these systems usually, what's their lifespan or their life cycle? And I think I mentioned earlier that their life cycle is about 10 years, and I confirmed that with staff. It's about 10 years. Or 10 plus years, depending on the maintenance of the system. So I think that was the first part of the question. And I think the second part of the question was, adding additional years of warranty to rather than, 1 year with additional 3 years, can we add more? And what I would like to recommend is that we allow this to go out to bid, and depending on if we get favorable bids, we can negotiate additional years of warranty, or I can look at the funding availability within our budget to see if we can come up with some extra funds to be able to add some additional years to the warranty.
Okay, I'm sorry that Supervisor Natoli is having this problem.
Can you hear me now?
Yes.
Oh, yes.
Thank you. I'm glad you made it.
Mr. Robert Katie is technical assistant here, so okay. Okay.
Well, you
the explanation.
While you were gone, Jeff Casaway had stated that the life cycle of these are 10 years, and he made some suggestions. I'm going to let Jeff go ahead and reiterate that for the benefit of Supervisor Natoli, since it was his concern.
So yes, these systems last on average about 10 years, and what I recommended was letting this go out to bid, and if the bids come in favorably and under to where we can allocate more money to add additional years of warranty to the system, or also evaluate if we can add additional funding to be able to add additional years to the system.
Okay. That's helpful. I just think, again, if that's value added, I mean, again, there's that assessment, but I mean, so if they last 10 years, we got 8 out of the last one, I guess, and maybe it doesn't make sense. So could we have, since this is going to go out under director's authority, could we at least have a report back once you've done that? It doesn't require the board approval once we allow you to go to bid on this one under the authority, but would you keep us apprised of that, please?
Yes, we can do a report back.
Great. So, do we have any other questions regarding item 5? And I'm going to see if Flo has any public comment.
No, and I didn't reopen the public comments on this item, just to want to be clear on the record. I didn't reopen that, but we didn't have any from this morning either.
Okay.
I would move the item then.
Okay, we have a motion.
Move the item in.
Supervisor Natoli.
Second.
Second by Supervisor Cerna.
Supervisor Okay, can we get everyone to mute your microphones, please?
Okay, Supervisor Desmond,
Aye.
Kennedy,
Here. Aye.
Natoli,
Aye.
Cerna,
Aye.
Frost.
Aye.
And that's a unanimous vote.
Thank you. Next item, please.
Okay, for your next item, get to it.
Item 39.
Sorry about that. I have two different docs here. Okay, so for your next item, this is JT Stack Incorporated doing business as 7-Eleven store. Request for review of license suspension, tobacco retailer's business license.
Did we have business on item 41 still?
Pardon?
We're
Appointment.
on item 39, but we will get to 41 in just a couple minutes.
So we have County Counsel Diana Reese on the line.
Yes, Deputy County Counsel Diana Reese on behalf of the county, business licensing. And also present with me is Business License Manager Laura Jacobson and Deputy Nicholas Thompson, who organized this operation.
Thank you, Diana.
Oh.
And we also have the appellant on the line as well.
Yes, we do.
Yes, Peter. Exactly. Sir, how are you? Crushing it? Yes, Kira Thota.
So, Diana, did you want to start out?
Yes. This matter concerns an appeal of a decision by a hearing officer to uphold.
Somebody sent me. I don't know. Somebody sent me something about some ABC.
Excuse me, I believe this is the appellant. Could you please mute your phone?
Just BOS.
Please mute the phone. And then I'm going to ask Manya if you could mute the phones in the system. I'm not sure where this is coming in from.
Thank you, Flo.
Thank you for letting me do that.
Yes, thank you. I think you can proceed, Diana. Diana might be muted.
Okay. Hello? Hello? Can you hear?
I can hear you.
You can hear me now? Okay.
Yes. Yes.
Okay. This is an appeal of a hearing officer's decision upholding the county's 30-day suspension of a tobacco retailer's license for the business JT Stack Incorporated doing business as 7-Eleven store 2365 232 33D, and we're going to call them appellant from here on out. And so there was an undercover operation, and an employee of the store sold a tobacco product to a person under 21 years of age. The employee admitted the violation. The appellant admitted the violation. There was an administrative hearing on this. The hearing officer upheld the suspension based on the evidence presented, and the appellant then appealed the matter, requested review by the Board of Supervisors, and the Board of Supervisors has the choice of denying introduction of evidence and deciding the matter on oral argument, or admitting supplementary evidence, with respect to challenges or particular findings of the hearing officer, or rejecting the findings and conclusions of the hearing officer and conducting a de novo hearing. That's pursuant to Sacramento County Code Section 407-135. County Council is recommending that the board deny the introduction of a supplementary evidence and conduct the hearing by argument only, and that the board uphold the findings and orders of the hearing officer in the decision dated October 13th, 2020, and uphold the order of the 30-day suspension because this was a first-time within 3 years violation of the tobacco ordinance. The ordinance that was violated is Sacramento County Code Section 407-110A1 and also Penal Code Section 308A, which is the state law governing the prohibition of tobacco sales to persons under 21 years of age. And
excuse me, Diane. Supervisor Kennedy has a question.
Thank you, Chair. I'm married to a school teacher. I can sit with my hand up for a very long period of time. I have a question of council. Are we being asked to take a vote, or how do we give direction as to whether or not it's a de novo hearing, or if we introduce new evidence, or if we just go on oral arguments? How do we get past that threshold?
Diana, this is Lisa. You can't see me, but I can answer the question if you would like me to, since I'm advising the board on this item. To answer your question, Supervisor Kennedy, at this time, I think it would be appropriate to do that if you would like to make such a motion.
I'd like to make a motion then at this time that we just take oral arguments and not allow the introduction of new evidence. I believe that the record is very complete, and we can go on all of the documentation that we have received up till now.
So that's we have a motion. Do we need a motion on it?
I think that would be appropriate.
I'll second.
Second by Supervisor Desmond. And roll call vote, please.
Supervisor Desmond?
Aye.
Kennedy?
Aye.
Natoli?
Aye.
Turner?
Aye.
Cross?
Aye.
Unanimous vote.
Thank you, Supervisor Kennedy.
So if I might just summarize what happened for the public and the appellant and anyone else listening. At this time, the board has decided that it will not be seeking or receiving supplemental evidence and will only hear this item based on oral argument. So if Ms. Ruiz has anything else to add, she may do so. And if not, I would suggest that the appellant then proceed with his arguments.
Yes. On behalf of the county, the gist of the argument is that Sacramento County Code Section 407-1110A1 provides that upon a finding of a first license violation for sale to persons under 21 years of age of tobacco products, the tobacco retailer's license shall be suspended for 30 days. And the critical language is that it shall be suspended. It's mandatory. That's what the hearing officer found, that there was no discretion. And that is the county's position, that there is no discretion. Once there is a finding of violation, the suspension must be imposed. However, as indicated in the board letter, the Department of Finance Business Licensing has in the past and is willing to do in this case to break up the suspension into segments to reduce the financial hardship on the appellant. And so we would ask that the suspension be upheld. I have nothing further at the moment.
And do Laura Jacobson and Nicholas Thompson have presentations, or should
No, they're just here to answer questions if the board has any questions.
Okay. So at this time, I'll invite the appellant to make their comments.
Hello, my name is Siraj Sahota. Hello, Chair and Member, Board of Supervisors. First of all, I would like to acknowledge that this is a very big mistake my employee has made. I don't want to make an excuse, but I want to understand that this is not the way I do my business. I have been in the retail business since 1991. I've worked for Circle K, and I have 7-Eleven since 2001. And I never sell. I have no problem selling a restricted item to the legal age person. I always train all my employees one-on-one. I also use the training software provided by 7-Eleven. Every day, when I go to my business, I educate my manager and employees the importance of checking ID. I also have outside company who do the secret service to see if my employee checking ID for the restricted item. I'm also involved in community project with the law enforcement, and I've been sponsor of Sacramento Sheriff League and a local school, and we give school supply and other things. I care about the youth in our community, and would never want to promote underage alcohol or underage smoking. My request is please reconsider my appeal. My sincere beg you for forgiveness. I will work more harder to never be this situation. Time are also tough. The pandemic, small business is hurting already, and I will be in bad situation if my sales will be suspended. Please reconsider, and I thank you for giving me time to address my issue. Thank you.
Thank you, Ms. Sahota. And I will back to the board for deliberation. Supervisor Kennedy.
Thank you, Chair. We've all seen the record. I want to thank the Sheriff's Department and all those involved, as well as Ms. Ruiz, for putting together a thorough record and documenting. I believe that the administrative law judge, or whichever level it was at the time, decision was actually a sound decision. During these times, the last thing that we want to do is, hit a small business with something that's going to be detrimental to that business. But this is a question of, public health. We're seeing a spike and a rise in the use of tobacco products by our youth, like we haven't seen in a long time. This is extremely serious. When kids get started smoking, they often don't stop until it's too late. This coming from somebody I've had an entire generation of my family wiped out by lung cancer. And so I take this extremely seriously. I empathize with the store owner. I do believe that there is a sincere level of contrition there, but at the same time, I think that we put penalties in place for a reason, and to protect our youth in this particular case. So therefore, when at the appropriate time, I will be making the motion to support staff recommendation.
Thank you, Supervisor Kennedy. Do we have any other comments or questions? If not that, a second.
I'd second it.
Thank you, Supervisor Natoli, and roll call vote, please.
Supervisor Desmond?
Aye.
Kennedy?
Aye.
Natoli?
Aye.
Cerna?
Aye.
Ross?
Aye.
Unanimous vote.
And so I know it's hard when you're a business owner. You can't always, it's not easy to know what other people will do while they're working with you. But Mr. Sahota, I know hopefully moving forward, there will be a way that you can, work really closely with your employees and let them know how important it is to do the right thing and go by the rules. So thank you, everyone, and we'll move on to the next item, please.
Okay, so for item 41, this is the fiscal year 2019-20 transient occupancy tax grant program report back and fiscal year 2020-21 TOT grant program update.
And we're not.
Madam Chair.
I'm sorry. At this time, we're not going to receive the update, but we do need to nominate. Oh, who do we have on the line? Was that
Madam Chair? This is Britt Ferguson, the county's interim chief fiscal officer, and I was just going to say what you just said, which is at this point, all we're asking is that you appoint 2 of your members to serve on the TOT grant review panel. As you all know, and as Supervisor Kennedy well knows, that panel oversees the TOT program application review process and reviews rankings and recommendations from the various subject matter panels and makes recommendations to the board on funding. We are scheduled to complete the subject matter panel reviews in early February, and then go to the grant review panel, which is comprised of the 2 board members and then the chiefs of staff for the 3 board members who are not on the panel. The new contracts are scheduled to start April 1st.
First, I want to say it's really good to hear your voice, Britt.
Thank you.
Thrown up your ski rope around your neck here.
Yeah.
Oh, we're still hearing voices. Okay, so as Britt stated, there are 2 of the supervisors who are kind of heading up the TOT committee, and because of the Brown Act, there can only be 2 of us. Supervisor Peters is no longer with us, and so we need a nomination for someone who might desire to serve on that. I'm assuming Supervisor Kennedy is continuing in his.
I'd like to say that I thank you, Chair. I would like to continue at least for one more year since Supervisor Peters left. We went through years of painstakingly changing, and I think we got to a sweet spot. So I think that the historical memory on there would be valuable for at least one more year.
I completely agree. Supervisor Natoli?
Yeah, I was just going to ask, I know that Supervisor Peters had served with President Kennedy as noted, and again, I don't know if Supervisor Cerna has interest in it, but if Supervisor Desmond were interested, it's a good way to get acquainted with a lot of our community groups and certainly the funding cycle. So I would ask Rich, I guess, before I nominated him, if he'd be interested in serving.
I would be, yes. Thank you, Supervisor Natoli.
Okay, good.
Yeah,
So you're okay.
Supervisor Stern, I would, if someone else wasn't going to nominate Supervisor Desmond, I certainly was. I think it's important to not only have Supervisor Kennedy there in terms of the kind of institutional background on this, but I think it also should be a committee that's comprised of a supervisor that has principally the unincorporated area in his district and another member that has a good portion of the city in his. So I think it's a good balance in terms of the political geography, as well as also giving Supervisor Desmond the opportunity to get up to speed very quickly. And your time's going to be taxed on this one. So
yes, thank you, sir.
We appreciate you taking the team. Thank you.
For the benefit of those that are watching, all the districts are represented. Just some of us have our chiefs representing us on that committee. And I know it's difficult because we always have way more applications than we have money. And that's the hardest part, because we always want to give as much as we can to as many as we can. So I want to thank Supervisor Kennedy and Desmond for being willing to do that hard job. And so with that, I'll ask the clerk. We have a motion. Well, we have a nomination and we have a second for Supervisor Desmond. Are we only nominating Supervisor Desmond because Supervisor Kennedy is already on the committee?
No, you guys are making a new appointment today. So this would be appointing Kennedy and Desmond.
No.
That's the motion.
Go to a roll call vote.
Second.
And who was the second?
First, the second is Cerna.
Mr. Cerna, okay. Okay, Supervisor Desmond?
Aye.
Kennedy?
Aye.
Natoli?
Aye.
Cerna?
Aye.
Frost?
Aye.
Unanimous vote.
Okay. Next item, please.
Okay, for your next item, this is the Circle D Food Store PCN, a request for a letter of public convenience or necessity from the Board of Supervisors for a Type 20 off-sale beer and wine liquor license for an existing store at 3040 Auburn Boulevard in the Arden Arcade community.
All right, good afternoon, Chair Frost, and I'm sorry.
Hi, Chris. Good to see you.
Good afternoon. Yes, Chair Frost and board members, Chris Bahuli with the Office of Planning and Environmental Review. I do have a PowerPoint presentation that I'll be providing. And again, we'll be providing staff's presentation for this item, which is a request for a letter of public convenience or necessity, also known as a PCN, for the Circle D food store. Next slide. The store is located at 3400 Auburn Boulevard on the southwest corner of Auburn Boulevard, Morse Avenue, and is west of Watt Avenue. As I mentioned, the applicant is requesting a letter of PCN to allow for the State Department of Alcoholic Beverage Control to issue a Type 20 off-sale beer and wine license. Next slide, please. The state's Business and Professions Code requires a letter of PCN from the county to issue this license, as it is in a census tract over-concentrated with existing alcohol licenses. Based on the state's formula, 2 licenses are permitted in the census tract, and there are currently 6. Staff has also reviewed the number of licenses in a 1-mile radius of the subject site and found there were 11 active licenses, with 7 of those licenses being within 1/2 mile. We also reviewed nearby sensitive uses and did not find many being in close proximity, with the nearest school being located approximately 1 mile away. Next slide. The subject site is located in the West Arden Arcade Environmental Justice Community, and the county's general plan contains EJ policies seeking to minimize environmental hazards in the community. Staff have received letters in opposition to the granting of the letter of PCN, with concerns including criminal activity in the area and over-concentration of liquor stores. I should acknowledge the applicant has provided a petition with support for granting the letter with their application, and members of the public have indicated support for the application during public meetings. The request was brought before the Arden Arcade CPAC on May 28, 2020, and they recommended the board deny the request. Although staff is recommending denial of the letter of the PCN, the report includes the conditions provided by the Sheriff's Department that would be applied to the ABC license and business license should the board approve the letter. Next slide, please. This slide contains the graphic showing the 1-mile radius with the 11 active ABC licenses and is included as attachment 5 in your report package. Next slide. In closing, staff is recommending denial of the request for a letter of PCN based on the analysis in the report package and due to the number of existing licenses in the immediate vicinity of the subject site, community opposition to the requested license, and the request conflict with objectives of the environmental justice element. That concludes my presentation. I'm available for questions, and I should also note that Steve Heffelfinger from the Sheriff's Department is also on the line and available.
Thank you, Chris. I see a hand from Supervisor Natoli.
Yes. Thank you, Madam Chair. Just a question for the Sheriff's Department. One of the things that, in some of the correspondence that we all received, and I know this is Supervisor Desmond's district, but I want to just ask real quickly, the area was not designated a high crime under the data that we used to calculate that, but I'm curious because we did have some comments about some very serious issues, and I don't know if it related to the property itself or the immediate area. So I guess I'd just like to hear from Steve the assessment that the Sheriff's Department did on this, because a lot of times there are objections in there in the report, but I didn't see anything per se. So.
Steve Heffelfinger, Sacramento Sheriff's Office. Thank you for the question, Supervisor Natoli. This establishment received our basic procedure, which includes a site visit, retrieval of calls for service from our CAD system, and check in with our homeless outreach team, POP team, and patrol services. While it is noted outside of the high crime status with the department, it is an active area and is known as such by those that are assigned to work there and patrol, hot, POP, etc.
Okay, so just Steve, thanks for that. But again, maybe those aren't comments that go into the staff report. I didn't see, and maybe I read over it to see that those comments. Your point that you may not meet the high crime statistics, but that maybe that applies in lots of ways. It's not it wouldn't necessarily drive the PCN. There are two factors, obviously, as pointed out by Chris. So would that be something that you would normally note, or just, that's matter of course, and if it doesn't rise to the threshold of, high crime area, you still do the assessment either way. And I guess, does that get built into the staff reports, or is there a reason why that wouldn't at least get included? So again, for those of us who may not be as knowledgeable about the area as the supervisor of the district, kind of get some idea though about, calls for service may not be the thresholds that are exceeded and so forth. And I guess I just asked, because it's been raised here, does this property had maybe not an inordinate amount, but because a couple of the letters we received were some pretty serious crimes against persons that were alleged.
I have fresh calls for service that I pulled in preparation for this event today, and specific to the address of 3040 Auburn Boulevard, the CAD system shows 41 calls. And just for information, our standard here is to go 2 years backwards for retrieval of activity. The calls for service at that location are fairly static in that they're what you expect to see from a business of that type. As far as anything really, really serious, of course, all these are serious to some extent, but anything that would a violent felony, we don't have that in the calls for service. Not to say that not all victims report. So there could have been instances there where somebody got hurt bad or was victimized in some other way and did not contact us for reporting purposes. That happened.
Okay. Thanks, Steve. That's all I had, Madam Chair. Thank you.
Okay.
I'm sure.
Thank you.
Thanks, Steve.
We do have one public comment, so I don't know if anyone else has questions before we go to public comment and deliberation. Seeing none, Flo, if we could please bring in our public comments.
Yes, we'll transfer them in now.
I'm sorry, I just checked. I received a message that the caller dropped.
Okay.
What about the applicant?
We do have the applicant on the line.
Oh, thank you, Supervisor Natoli.
Oh.
Yes, would the applicant like to make some comments?
Sure. Hi, my name is Vikash Diol, and I am the manager at Circle D food store on 3040 Auburn Boulevard. So our vision, our plan is, if you guys allow us to get beer and wine, is to bring in local craft breweries from around Sacramento and bring their product in. So we're trying to elevate the area, and kind of seems like right now we have our hands tied behind our back because it's a struggle to run the store without what we need help. And with COVID and everything, it's just really tough over there for us right now. And to touch on the incidents, as the sheriff was saying, nothing really serious is occurring. And we would like to invest into our business and grow that corner so we can catch up with the rest of the community, because there's a lot of development going on in that area, and recently large car dealerships and made a Toyota, and so we'd like to tag along with that vision over there, and provide higher craft beers at higher premium prices and wines, and make it into a really nice grocery market and clean the area up and help the sheriff's department by, and we need money to invest into that corner, and definitely beer and wine is going to help. And, our vision is not to sell, 99-cent beer cans, all day and have a ugly show out there. Like, that's not what our vision is geared towards. It's to do the opposite and to eliminate all that by raising the value and raising up and creating a better business, a better product. And definitely with COVID right now, I think, it's real tough, and a lot of the members that live around the area is like elderly, or they don't have that great means of transportation to travel around. So it's a more of kind of a retirement setting, honestly, with the mobile parks around the area. And we get asked constantly being in the business 20 years, good customers, looking for beer and wine, and we're unable to provide it for them. So that's who we would gear towards, is the working class, the retirees. We have to deal with these people too. We don't want to deal with, the mess anymore. We're trying to evolve and take a step into the right direction for the community. And I just feel we have a good plan, a good vision, and if you guys would allow us to take that step, that would be great. And I definitely think we'll have a more positive impact on the community, because we would clean up that corner, and allow us to evolve and, hire more staff. And we even would hire security staff out in the front, because we would be able to afford it, and we'd clean up the whole area. We'd help out the sheriff's department by, weeding out unwanted crowds. That's all I have to say for now.
Okay, thank you, Mr. Deal. And I hope I pronounced that right. I do have one public comment. I don't know if you want to speak first, Rich, or if you want me to.
I'll wait.
Okay. With that, I will ask our clerk if we can bring in the public comments.
Yes, we'll transfer them in now.
Please start with your comments. You have 2 minutes.
Hello, my name is. To speak?
And I hope I pronounced that right.
Yes, you can speak. Please start now.
Okay, my name is Troy Donahue.
Can you mute the meeting in the background while you're talking?
Okay, 1 second, please.
Yes, thank you.
All right.
There you go. Okay, go ahead and start.
Yeah, my name is Troy Donahue. I'm not sure if who that was speaking about the actual area, the vicinity, and other places that sell alcohol and or things similar to what Circle D food store is trying to acquire for it. Like they're trying to get the ABC off sale beer and wine type 20 liquor license. I understand that, but I don't think that's good for this area. Number one, there's, as mentioned before, Chris Desmond, I believe. There's plenty of alcoholic selling places around here for that. Number two, the Circle D food store is they're not really caring about the community or the residents. I'm not sure what they're saying. They just really out to get for the money, I believe. Alcohol will make the situation around here worse. I am a resident around here, so it'll make it worse, I feel. And many residents feel that way too, I would assume. And it just would not be a good idea for this area for them to, it wouldn't make anything better. Plus, their prices are already high. They're already rude to the residents here, and it's just not good. Those are my comments.
Thank you, sir. Do we have any other public comments? I don't believe we do. Supervisor Desmond.
Thank you, Madam Chair, and I certainly am mindful of the manager's presentation and appreciate some of the ideas he has for the business, and I'm certainly mindful of the impact of COVID on all our small business owners. This is an area, of course, in my district, the northern part of Arden Arcade. It's a struggling area. Certainly, there are a lot of empty storefronts there. Even though it's not designated a high crime area, I think there are probably a lot of unreported quality of life crimes that affect residents and other business in this area. And I'm glad we have this PCN process because it allows us to have this discussion and deny these requests when it's inappropriate. And I certainly think that it's inappropriate to allow a type 20 license at this location because of the saturation. You can all see on your map that and Chris talked about it. I'm also very persuaded by the how this is inconsistent with the environmental justice component in our general plan. You know, I was on the CPAC for Carmichael Foothill Farms, and you know, I took that very seriously in implementing that environmental justice component to keep faith with the communities that we make decisions that are not going to result in more harm to these communities that have historically not been the recipient of good land use decisions. And I think that's what we're confronted with here. And for those reasons, I'm going to recommend approving the staff recommendation and denying a finding of public convenience. Thank you.
Is that a motion?
Yes.
And we have a second by Supervisor Kennedy. Roll call vote, please.
Supervisor Desmond?
Aye.
Kennedy?
Aye.
Natoli? Oh, did we lose Mr. Natoli? Oh, hi, Mr. Natoli.
Yeah, aye, yes, aye.
Okay, and Supervisor Cerna?
Aye.
And Supervisor Frost?
Aye.
and that's a unanimous vote.
Thank you. And
For your
next item, please.
Okay, your next item, item 43, is the zoning code and county code amendments related to industrial hemp. Zoning ordinance amendment to chapters 3 and 7 of the Sacramento County Zoning Code relating to industrial hemp. Addition of chapter 6.87 to the Sacramento County Code relating to industrial hemp, and waiving full reading and continuing to February 9th for adoption. The environmental determination is exempt.
Good afternoon, members of the board. This is Leanne Moffett, your planning director, checking that you can hear me okay.
Yes, thank you, Leanne.
Thank you. I will be giving the staff presentation today, and also on the call is Chris Flores, the county's agricultural commissioner, if there are any questions. We were previously before you on November 17th, 2020, when Chris gave the full presentation on the ordinance items. I am not going to be repeating that full presentation. I will provide primarily a report back, but just to frame this item up, the package of zoning code and county code amendments in front of you does provide a framework of requirements to allow the cultivation of industrial hemp, seed production, processing, and nursery uses, where outdoor cultivation would be allowed in the agricultural zones with an annual license from the agricultural commissioner and registration with the state. It would allow indoor cultivation in light and heavy industrial zones, and indoor processing, and only indoors, in the agricultural and light and heavy industrial zones. And there are significant requirements that are detailed in the prior report and in the attached ordinance. There were some community concerns expressed previously, particularly from the Delta CPAC. In general, the board was prepared to move the item, but you had a few questions, request for a change to the package, and information on program administration, and so today's report back cover those items. Starting with slide 2, the first item is that the Agricultural Commissioner's Office will be conducting neighborhood notification and considering those comments during their annual approval or denial process. Second bullet there, the board had asked about requiring a minor use permit to allow indoor processing in the light industrial M1 zone, and in part that's because M1 zones tend to be a little more proximate to residential than the heavy M2 zones. Upon further consideration, staff was concerned that the minor use permit process didn't provide for community input, so in the package that we have back before you today, we are recommending instead that we start with a use permit to the zoning administrator to allow for that review and for more discretion to be applied, and we would also require submittal of an odor control and mitigation plan and a safety plan. Now moving to slide 3. We have a few other items to cover as an outcome of the board member questions and some subsequent staff discussions and proposals for clarifications, starting with a clarification in the zoning code that post-harvest activities like drying, curing, or pressing are considered primary processing, so they aren't part of cultivation. Because of the odor issues, we felt that that was important to clarify so that any primary processing has to occur within a fully enclosed building, including in the agricultural zones. We added a state law definition of processor, and we also clarified that there is a 5-acre restriction on buildings in the ag zones that would cover both cultivation and processing in order to address a general concern about the potential for large buildings. So with that, the package before you would have you recognize the exempt status of the amendments, adopt the Ordinance 1, which is the Sacramento County Zoning Code components, and then introduce Ordinance 2, adding Chapter 6.87 to the Sacramento County Code, and then continuing the County Code component to the next hearing for adoption. And that concludes the staff presentation.
Question.
Thank you. I believe I see Supervisor Natoli's hand.
Yes, thank you, Madam Chair. Thank you, Leanne, for your presentation. Thank you to your staff, yourself, and to Chris Flores, the Agriculture Commissioner, for needing to follow up on this. And I wanted to be clear about one point, which you just ran through, and that is the primary processing, drying, storage of the hemp on the agricultural property relates to that which is grown on the property. And for example, you couldn't set up a facility to process for other growers in the area. It has to be on the property, or no?
I am checking here. Hold on.
And while you are, Leanne, I get it for M1 or M2 zones, you would, if you're a processor, then you would, accept it from, if it was a horizontally or a kind of vertical company of some sort, they would, do different elements and they might take it from others. But I'm just concerned about on the property in which you're going to be processing, so you don't get this heavy volume.
Right.
All hypothetical of being, moved in to an agricultural property for the purpose of, you said processing and all the various iterations of that.
I think it's actually silent on that. So you could give us direction to add that.
Okay. Again, certainly respecting my colleagues may have some questions or thoughts on this. I think that would be one more element that would, provide some assurance to folks that wherever it's situated, and again, I have no idea, what the demand nor the numbers of folks who may apply for licenses to actually grow and process hemp under, the prescriptions as outlined here. But I think that would be helpful and would, again, I think provide that level of construct for folks that are going to process it on their own agricultural site versus going to somewhere else, another facility somewhere, but limited to their own processing of their own products. So, I would be supportive of that. Yes, I don't know if others have other thoughts about that, but I think that I would cover some of the issues that I've heard, from folks being concerned about what this might increase to over time relative to the activity. I think we do that for other products. That don't we have a zoning code references that for products that are grown or produced on the property, right?
Yes. So just to clarify, we are going to add to the zoning code a requirement that for processing of hemp in the ag zones, that the hemp must be a product grown on that property.
Yes, that's what I would suggest.
Got it. And I think, yeah.
Any thought when you started? Any other thoughts on that? Again, you attended all the hearings, even though they were virtual.
Yeah. I guess my only thought is that sometimes we do have farming operations that cover more than one parcel. So I think we would want to make sure that we phrase it in terms of it can cover multiple parcels, but it's part of one farming operation as licensed as a totality by the Ag Commissioner.
I'm fine with that.
So, great. Just to clarify, I just want to make sure I'm clear. Are you saying that if they want to produce and package it or products, it has to be products using hemp that was grown on that property, but can they grow it and export it to be processed somewhere else? Is that what you're
Yes, yeah, no, that's proper characterization, and I think the clarification, Madam Chair, was that they may have a farming operation that incorporates, several parcels. They'll all be under the same license or related licenses, that they would be allowed to process that which they grow and produce on the ag parcel, but they're always free to send it to, once they've harvested or cultivated it, to send it to, another location. And that's the M1 and M2 zones provide for that. Again, but recognizing those are more industrial orientations in those areas, and or they can send it, out of county, I guess, wherever to process it. So, and it provides for what you just said, though. Yes.
Yeah, I think we've run into things like this before, where they were there was a production, but it wasn't grown on the property, and so they weren't. There were some disconnects in what is allowed on that property in that ag zone, and so I imagine you're sensitive to that, given.
The whole board, as Mr. Desmond avoided that here, but I think we all, yes, we're very familiar with other situation in general vicinity.
I think it's probably a reasonable approach. I agree with it.
Thanks.
And
I mean, nothing else. I think Chris Flores was going to just touch on in her presentation about the administrative process she was going to use for noticing. That was the only other piece that I wanted. If we could just have a quick report on that, Madam Chair, and then I'm prepared to, after you have public testimony, to make a motion.
Okay, Chris.
Yeah, good afternoon, everyone. Chris Flores, Sacramento County Ag Commissioner. Can you hear me okay?
Yes, thank you.
Okay, thanks. Yeah, so Supervisor Natoli, we have a process that we're developing where we have quite a few application documents that we would require. We have a safety plan requirement, a mapping requirement, etc. So we get all the information about the site. And then part of that process will be notifying parcels that are adjoining the cultivation parcels. And we're looking at doing a 500-foot notification radius from the parcel lines, actually. And then we would give the people notified 15 days to respond. And I would take all of those comments into consideration when looking at that application. And then we could either mitigate the locations of the plots, work with the grower to mitigate any concerns. And if we can't mitigate, then we would deny the application. The grower will be required to get a license from the county first before being allowed to apply for the registration with the state. So, and then the state registration requires a lot of information as well, including a criminal background check. So they'll be under a pretty strict and onerous process to grow hemp. And I just wanted to also add that San Joaquin County, they passed their ordinance last year for hemp growing, and they also require a license process. And they only had 5 registered growers last year. So I'm hoping that this would be a slow growth kind of thing for us. But I am prepared to do the notification and accept those comments and then use those as a mitigation tool.
And I'm sorry.
I'm just going to say, could we do a courtesy notice to the CPAC in the area, the Community Planning Advisory Council? I trust most of these are going to be in a rural setting, so we can do a courtesy notice, please.
Yes, of course.
Okay. Yeah, Madam Chair, that's all I had. Again, I know that Chris and her staff, along with planning staff, has spent a lot of time, and our board has heard this on parts of it on several occasions. So, and I appreciate the deference colleagues have given so we could work through some of these, and assuming folks are satisfied with what is before us with the modification as noted. If there's no public comment, I'm prepared to move the item.
There's no public comment, and so we have a motion by Supervisor Natoli, and Chair will second. And so roll call, please.
Supervisor Desmond?
Aye.
Kennedy?
Aye.
Natoli,
Aye.
Serna,
Aye.
Frost,
Aye.
and you have a motion. This is unanimous vote, so that passed.
And this will come in our next meeting to be voted on, correct?
Correct, for the county code adoption, county code ordinance. Okay, for item 44, you have the Correctional Health and Mental Health Services Facility Construction Management Services approve agreement with Kitchell CEM in the amount of $10 million.
And this afternoon, we have Britt Ferguson with Debt Management as our presenter, as well as Jeff Cassaway with General Services.
Thank you, Madam Chair. This is Britt Ferguson, the county's interim chief fiscal officer, members of the board. What I'm going to do here briefly at the start of this item is just provide some background information. Many of the board members, all of you really except for one, have been on the board since the inception of the consent decree and even preceding that, some of the things we've been doing. So I'll just remind everybody and remind the public about what the history of the consent decree and how we got where we are and some of the things that we're doing and how this project fits into that. And then Mr. Gassaway will be talking specifically about the contract for construction management services. So just to remind everybody, probably I think maybe 4 or more years ago, the county was approached by the Prison Law Office and Disability Rights California about concerns they had about conditions of confinement in the county jails around a variety of areas, including things like suicide prevention, out of cell time, treatment and housing conditions for people with mental illness, medical care, compliance with the Americans with Disability Act, or ADA, with the Health Insurance Portability and Accountability Act, or HIPAA, a whole variety of areas, and and with the possibility of a lawsuit coming as a result of that. At that time, the county, with county council, with the county executive office, with the sheriff's office, entered into discussions with the DLO and PRC to try and reach an agreement on on solutions to those problems, which we acknowledged existed. There were problems there and they needed to be addressed. And those negotiations took a number of years. A lawsuit was filed, and in the end, in June of 2019, agreement was reached on a consent decree that governed a variety of aspects of the way the jails operated and, in fact, the ultimate physical structure of the jails. That consent decree included, basically provided for agreement to 5 remedial plans, and these remedial plans were in the area of segregation, restrictive housing, in the Americans with Disability Act, suicide prevention, disciplinary measures and use of force for inmates with mental health or intellectual disabilities, and medical and mental health. These remedial plans were lengthy, and they included a variety of specific things the county needed to do in terms of policies that we needed to either implement or update or create. And in other cases, they were not specific in terms of exactly what we needed to do, but they identified specific goals that we needed to achieve. And this would be things like the amount of out of cell time that inmates received, the level of medical care that inmates received, the level of mental health services and how people with mental health issues were treated in the jails. So these were broad goals, or actually they were very specific goals, but how we implemented them were not spelled out in the remedial plan. When we negotiated the remedial plans and the consent decree with the plaintiffs' attorneys, we put together an implementation plan that spelled out how we intended to go about the details of what we would actually do to achieve those goals. And I know the board is aware of that. And that implementation plan looked at things like over a 5-year period, how many staff we would add, what kind of staff we would add in terms of both correctional staff in order which were needed to get people out of their cells more frequently to provide more security, so that could be done. It included medical staff, mental health staff. It included a variety of programs we would implement, like intensive outpatient pods for people with mental health issues who did not need to be in the most high-level mental health housing, but could not be in the general housing or general mental health housing. And so we agreed to implement a variety of these things over 5 years. And one of the things that we agreed to do was to build additional space adjacent to the jail downtown, as well as to make significant improvements out at the RCCC, all designed around being able to achieve those goals. And specifically with regard to the downtown jail, we were focused on a number of things that we determined could not really be accomplished within the existing jail facility. And those were focused primarily on providing booking and intake. And one of the issues there is on booking, there is a medical screening that needs to be done in order to medical and mental health screening in order to adequately determine what housing inmates need and to make sure that they receive the services they need. And under HIPAA, that needs to be done in confidence, and the current structure of the jail did not allow that. So one of the key things that needed to be provided was a new intake and booking facility for the jail, downtown jail. The other things that we needed to address were specifically both housing and space for programming and services for those inmates with mental health issues and medical issues. And so that was one of the other major things that we needed to address in the jail. We also needed to address ADA issues, which included retrofits that would need to be done in the existing facility, as well as things that would need to be done in the added facility. As the board is aware, while this was going on, and really before this, starting back in 2015, the county had launched a major effort to look at alternatives to incarceration. Even back then, the board recognized that jails were our most expensive correctional facility far and away. And if we could find a way to keep people out of jail, whether on pretrial or on sentence status, safely in the community, that would be a cost-effective measure. So back in 2015, the county launched the Adult Correctional System Review, which looked at a variety of things. And as you know, that wound up in 2019 with a number of recommendations around things like developing an effective supervised pretrial release program, providing enhanced pretrial diversion opportunities for mentally ill offenders, realigning the probation caseload so that they can more effectively supervise those sentenced offenders on probation and reduce recidivism. We recommended looking at alternatives to incarceration for sentenced offenders and a variety of other things. Since that wrapped up, we've continued to pursue those goals. And as you know, we have implemented a pretrial release pilot project that right now has over 500 offenders or people who would be potentially otherwise in jail out of the jail. One of the things that this pilot project was designed to do was to assess how effective it would be in reducing the jail population. And frankly, that has proven difficult because of the COVID situation, because everything is sort of, different in the jail right now for a whole variety of reasons, including various efforts to just get people out in order, in order to relieve pressure on the jail and avoid potential outbreaks, and a backup of people who are in the jail because the state prison system stopped taking inmates. So it's been hard to fully assess, but whether those are people that actually would have added to the bed count in the jail, but we believe that a substantial number of them would. And as I said, we have over 500 people on that. We implemented a mental health pretrial release program under AB 1810. We did implement a new model for the probation department supervising their sentenced offenders, and we have now embarked on an effort to identify and implement alternatives to incarceration for sentenced offenders, a planning process based on a report prepared for us by the CARI group. So there's a lot going on to reduce the jail population. Notwithstanding that, we think it is important. It will be necessary to add additional mental health and booking facilities in the downtown jail or adjacent to the downtown jail. It's not entirely clear the size and scope, what the size and scope of that is. That's one of the things that will be finalized as we bring the construction management firm on board and continue our process of doing that planning and programming and taking into account those efforts. But we do believe that it is necessary, and we do believe that it's part of our commitment to the DRC and PLO to continue to move forward on this project. We had originally hoped to be actually under construction, probably very optimistically, and we told PRC DLO that this was our goal, although it was optimistic, by 22-23. We will not meet that goal, but that was our original sort of commitment to them, that was what we were shooting for, and we think it's important to keep moving forward on that effort in order to be ready in order to meet our obligations in terms of achieving what we told them we would do in terms of addressing the needs in the downtown jail. That's a summary sort of where we are, and with that, I'd be happy to answer any questions that you may have.
Supervisor Natoli.
Yes, thank you, Madam Chair. Thanks, Britt. Just by way of information, I appreciate the summary. The proposal before us today, I know Jeff's going to address the specifics relative to what's being recommended, but I wanted to ask about, when I did have a chance, I appreciated that Mr. Villanueva and Mr. Gasaway met with me earlier to go over at least some of the background behind this, but I wanted to ask about how this, if you could take a moment and describe how, with what we've already set forth, almost an $8 million contract with Stockton Lewis for, I guess, doing programming as such. And as I understand it, we've expended just a little more than 10% of that contract amount, somewhere between 10 and 15%. And now we're being asked today in this recommendation to, again, not that you haven't, you and others haven't, talked about some $16, $18 million to do this pre-planning, but also now this design, build, construction activity. But if you could kind of provide a brief update as to what has been done with the money we allocated previously, by which, again, there hasn't been a tremendous amount of that expended. And the other part of my question is, so if we're looking at here $18 million, we've yet to, as you said, to know exactly what it is you're going to be asking this board, this county to obligate itself to as it relates to some sort of a construction project and all that goes with that. But if I look at $18 million in what's being proposed in the Kitzer contract, I see that that's, construction management right through what's contemplated to be, an opening of a facility at a date that's probably 4 years out, if not further. So with that, though, that's about $18 million. And I asked this of Mr. Gasaway, Mr. Villanueva, typically soft costs on these projects, on construction projects, run in that 30% range. So am I to assume, or is the public to assume, that we're looking at a project that's going to be on the order of some $60 million if I take 30% of project, or is there a number much larger? And so what we're looking at today is only a down payment on what might be, again, I don't want to get too far ahead of it here, but in the past we've had discussions at anywhere from $100 to $200 million, somewhere in that range, and maybe it's been lowered expectations or not. So I guess, Britt, kind of a two-part question. One, what have we gotten thus far? And, that contract was let some 10 months ago. And secondly, how does this all factor into what are, you know, at least somebody's doing some ballpark figures around what it's going to cost to build a facility all in. And I guess I'm trying to get some sense about that.
Sure. So, and Jeff Gassaway can probably weigh in on this. So, as you rightly said, Supervisor Natoli, we don't know exactly the total size and configuration of this facility. Our initial, when we put together the proposal that we provided to the PLO and DRC, we did a very preliminary sort of assessment and thought we were looking at potentially a facility in the area of about $150 million. And our commitment to them was that we would move forward. We proposed to put about $8 million aside each year for 2 years, starting in fiscal year 1920. So we had $8 million set aside last year, which carried over. As you rightly said, we haven't spent most of it yet. And then $8 million this year, $16 million. And our plan was whatever additional costs would be related to the construction would come from the proceeds of a bond issue, which we had hoped to be doing now. Basically, as I said, we're behind. So right now, there will be. We don't know exactly what all the costs will be until we get everything worked out. We certainly will spend, $16 million between this and everything else, and probably more. We will also spend obviously a lot on the actual physical hard construction costs of the facility, whether it's $150 million or $80 million or $200 million. We don't really know yet. That's going to come out of the remainder of this process that both our architects and the construction contract managers and our staff will be working on as we move forward. I don't know if that answers your question, but that's sort of the way we were looking at this as we move forward on it.
But a rule of thumb, if I'm not mistaken, in enough public works contracts come through the board over the years, big or small, it runs around 25-30% soft cost. So if I'm to assume what's embedded in the recommendation here with Mitchell and Knockton Lewis, they're doing programming, they're doing outline, but they're also dealing with design build, because what I see with Kitchell, at least in the contract, is that they're supposed to run this all the way through to the end with what we're being asked to approve today, including inspection services, including design, the design build process. And so is it safe to assume that maybe with, a little fudge factor, my word, that we're only going to be in for but $20 million to basically do the soft costs for a project that could run $150 to $200 million, which would be pretty remarkable soft cost allocation for any public works project I've seen in this county in any recent times or even over time. So I guess what I'm maybe getting at, Britt, maybe you're not the one to ask this, what else is there? Because apparently we're getting architectural services, we're getting construction services, we're getting design services, we're getting programmatic services. And if I read this correctly, at least the way it's portrayed, this is kind of all in. And so, there may be some other costs, as I said, maybe a bit of, that maybe would be unanticipated. But then the rest of it's going to be capital. Is that accurate?
I'm going to have to let Mr. Gassaway address that part of the question.
Chair Frost, members of the board, this is Jeff Gassaway, Director of General Services. Supervisor Natoli, I'm really hesitant to throw out at this point a percentage of soft costs, not knowing, being so early in the programming and not really knowing what the overall project looks like. But I think you are correct that, typically on public works contracts, the soft costs are, somewhere in the 20-25% range. I think, on this, project with what we've got, in front of you today, the $10 million, and then what we have with the Knockton Lewis contract, that covers a lot of the cost with the exception of some of our internal project management costs. And at this point, I don't know what those are projected to be, because we don't really know what the facility looks like at this point.
It's the high number because it's easier to do the math. And I even use your number of 25%. If you have a $200 million project, 25% of that, $50 million. And so we're being asked basically go now this next step for $18 million. What that says to me is that there's a whole lot more to the package, because you could basically double more than double, you could almost triple the soft costs before you ever got the project all done. But I guess the value added here with design build, and again, I don't want to capture too much time here, but because your point, Jeff, and I appreciate it, you don't know, and I'm not pinning you to any number on that, but it's just, I do this calculation, and we've got now, we're going to enter into a contract. I say Kitchell, but we went out to bid, and then we had 4 firms that responded. That we're taking on an entity that's going to be with us from here all the way to the end. Their price, again, with the few contingencies that are built in, is $10 million to see this thing through to the end. And maybe that's a good deal, assuming we go through with the project. But I guess I'm not totally confident that we're seeing all the costs. But again, that would be a pretty remarkable number. If you came in at $20 million on a $200 million project as a 10% soft cost, that's a pretty remarkable number. So Madam Chair, I'm going to stop with that. I know that there's other questions, I'm sure, but one final comment on this, I would just like to add that, this is more information than we've had in the past, but we still, albeit it hasn't been a year, Knocking Loose is still doing their work. They're halfway through or partial way through their program. We really haven't had a discussion around what it is. Again, there's being said that we have to have Kitchell on board in order to get us to the point about what it is we're contemplating here. And I, for one, would just say that I think there's a piece here that needs to take a look at the current main jail facility and how we might modify certain aspects of that as a complement to anything else we may be looking at as it relates to some of the needs that certainly Britt accurately described in his presentation. So I'll leave it at that. Thanks.
Do we have any other comments? We do have 17 or so public comments. So seeing none,
Supervisor Frost, if I may,
yes.
We're going through a design build process, and it's the construction management firm is a crucial piece in the discussions and decisions in the planning of the facility, as well. They're a partner to the county, as well as Knockton Lewis, and part of the design team, which includes the sheriff's department, medical, the correctional health, and the DGS staff that will be maintaining the building if it moves forward. So they're a critical piece, and it will prepare them to effectively manage the construction of the facility. So I just wanted to state that before we moved on to public comment.
Thank you, Jeff. Okay, at this time, I'm going to ask our board clerk if we can bring in the phone comments.
This is Alma from the clerk of the board's office. Would you start with caller number 1?
Please start with your comments. You have 2 minutes.
Thank you. My name is Dr. Christina Bourne, and I live in District 1, and I'm a physician. There are over 400 consent decree requirements, and only a small number of them are being met by the construction of this new jail. Overall, the majority of what is actually cited in the consent decree has little to do with the physical space and more to do with the practices, culture, and management in the jail. It is disingenuous to cite the consent decree as the reason for the $10 million expansion. I have had firsthand experience providing medical and psychiatric care for those who were incarcerated at the jail, and they were some of the sickest patients I have ever cared for. Instead of treating patients with dignity and respect, I witnessed the sheriff assault patients for things like requesting extra milk or not taking their medications. Sheriffs would often stand in front of individual cell windows, provoking or scaring people in mental health crises. In communal spaces, sheriffs would make fun of patients using derogatory and racist language. Still to this day, we are documenting our patient interactions on Microsoft Word and saving them onto a computer. This is not a HIPAA-compliant medical record. The culture which is normalized in the jail and the sheriffs has proven that there is little concern for human life and safety. This was unambiguously on display when they initially refused to wear masks while at work, selfishly putting everyone at risk. In summary, the consent decree has little to do with the physical space in the jail, but has to do with the inhumane and untherapeutic culture that is inherent in the carceral system and the sheriff department. I have seen it firsthand. The county should explore alternative options for meeting the consent decree requirements. I implore you all to think creatively, invest in preventive health and non-law enforcement first responders like mental health first. This is $10 million and maybe even $150 million that our community needs, and it is your chance to create a political legacy for yourself. Thank you.
Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Good afternoon. Thank you. First of all, I'd like to thank Supervisor Frost for kind of filling in. My supervisor is Supervisor Desmond, but she's always been available to answer questions, even if I don't agree with her in the past. And I'm excited to be represented by Supervisor Desmond now. And I'd like to thank Supervisor Nolte for his questions. I'm a little concerned having listened to this presentation. It sounds to me like the facility is already built and that there's going to be more investment in the city, which does not benefit people in the unincorporated county. I was concerned to hear individuals who are pre-trial, which means innocent until proven guilty, correct, referred to as offenders already. They haven't even met with a judge and they're being called offenders. And as far as Mr. Nolte's questions regarding one sole provider for every service on this project, so what you're telling me is we don't want to invest in projects to better the community, nor provide more jobs to the community, and those jobs would provide more services and improve our community, but we're going to give some jobs to some people in a private company. That's very concerning, and I hope that you will consider this comment when making your decision. Thank you, and have a nice afternoon.
Thank you. Next caller, please.
Please start with your comments. You have 2 minutes.
Right now?
Yes, please.
Hi, my name is Natalie Anselin. I'm a resident of Sacramento County and a support line advocate at Weave. I do not support using county resources to invest in more incarceration. The pandemic highlights that our jails have always been a public health crisis and will never be a place where medical and mental health needs can ethically or effectively be met. Jails are not therapeutic, healing, or rehabilitative, and an improved facility will not solve the systemic and cultural issues of the sheriff's deputies' behavior and abuse. Beatings and medical neglect are the norm because sheriffs have unchecked power and jail tenants' lives are not valued. At least 10 people have died in our jails in the past year. The county continues to ignore that the vast majority of May's consent decree requirements involve the behavior and decision-making of sheriff's deputies inside the jail. And yet the Board of Supervisors have received absolutely no status reports on how these hundreds of consent decree requirements will be met, even over a year after the consent decree was finalized. The sheriff needs greater accountability measures for when the behavior of his staff caused lawsuits against the county. The sheriff's department should have financial consequences, not the general fund that ultimately diverts more funds away from social services.
You have power over who bears the financial burden of the consent decree requirements and how the consent decree is met. Your staff and the Sheriff's Department must give regular public status reports on how the consent decree is being met now. And if you need to lower the cost of the Maze consent decree, decrease jail populations first before moving forward with the construction project. The $10 million for this contract coming out of the general fund will divert funding from already underfunded public health and human services
Please wrap up
programs.
your comments.
Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Hello, my name is Kara O'Shell, and I am a resident of District 2. I'm also a mental health professional, and I am calling in to urge a no vote on item number 44. I'm really glad that we have these resources to spend, but these resources need to be allocated to alternatives that support individual and community health, and not to expanding the jail building or jail infrastructure. Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Thank you. Hello, my name is Sarah, and I'm a resident of District 3. I am aghast at the possibility of spending $10 million plus of general fund money on a new jail in Sacramento. This is a waste of precious funds in light of several very important factors. First, the Rio Consumas Correctional Center is ADA and HIPAA compliant, so that facility could be used instead. Next, there's a systemic culture of abuse and even torture inside our Sacramento County jails that can't and won't be solved by building a therapeutic jail. There have been beatings, medical neglect that's rampant, and those are the norm because the sheriffs have unchecked power. And the tenants in the jail, their lives are simply not valued. So many people have died in those jails and been treated badly. At least 10 people have died in them in the past year. So I implore you to vote no and instead promise to spend that precious money, which I guess I'm hearing now is not just the $10 million, but could be balloon up to $150 million of general fund money instead on much needed programs and services for our community. For instance, that money could go to alternatives to calling 911 for those experiencing mental health crises. And that would help meet people's needs, de-escalate situations, would reduce conflict between police and police violence against community members. And more importantly, we need to stop criminalizing mental health. There are other very effective and important programs that the money could go to, like the Black Child Legacy Program that keeps families out of this cradle to prison pipeline. So I implore you to vote no. And thanks so much for.
Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Thank you. Hello, my name is Ellen Schwartz, and I thank you for this opportunity. Over 40 years ago, I was in a coalition that researched alternatives to incarceration. We presented our findings to the Santa Clara County Board of Supervisors. One of the most stunning things we found was that for a given offense, given a choice between issuing a citation and arresting the person, police overwhelmingly chose to arrest. And the reason we found was that issuing a citation required more paperwork than arresting someone. By simply switching the requirements, the number of arrests would have been significantly reduced. And by the way, That would free up space for the needs of people with medical or mental health issues. We presented a thick packet of possibilities, but they elected to build a new jail instead. Instead of building a new jail here, Sacramento should be exploring alternatives to incarceration and ways to provide appropriate conditions as quickly as possible for the people in their care. Perhaps using some of that construction money to providing mental health service before people wind up in jail. What a concept. I'm sure the construction industry would love a new jail, but I implore you, please do the right thing. Thank you.
Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Hi, PJ here. We don't need more incarceration facilities. I understand that the goal is to comply with the consent decree, but we need to look at viable alternatives. We need to stop looking at a lack of robust public mental health infrastructure as a jail-sized hole that can only be filled with another jail. The reality is that the only reason why any people with mental health issues are engaged in crime of any sort is because our system has failed them. Our system pushed them out onto the street when we should have been taking care of them. Our system made them fend for themselves when they were just trying to survive their own mental health realities. The last thing we need is to further criminalize something that is oftentimes well beyond their control. What we need is more public mental health services available and options for those who cannot afford the mental health meds and services they need. What we need is to care for those whose mental health issues exceed their own capacity and who may not have family who are willing or able to care for them. We as a community need to step up and step forward and show our empathy when helping them navigate these hard situations. And all the time, we need to have buy-in from those who are affected. We need homeless people and mentally unwell people to speak to their reality and for us to listen when they tell us what they need. We need the mentally ill to speak to us so that we can know what is best to do for them. Now, this may mean having to treat people with mental health issues so that we can get them into the necessary frame of mind, which is conducive to them conveying to us how they feel, what they need, and how they feel they should proceed. All of this is centered on approaching this process with empathy and an eye towards treating adult human beings as adult human beings, not being condescending to them, not acting like a parent to them, acting like a partner who has a vested interest in their well-being because we do as a community. What we do for them reflects on us as a community and how moral we are. Stop building jails. Start building care facilities. It is possible to comply with the consent decree without building more jails. The county has simply not explored all alternative options for meeting the consent decree requirements without the construction of a new building.
Please
Thank
wrap
you.
up your comments. Thank you.
Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Hi, my name is Laura Holstage. I'm from District 1, and I was calling to ask you to vote no on item 44. I think it's kind of dumb to be spending all of our money on keeping people with mental health problems incarcerated and not use it instead to try and actually help them before they get incarcerated. Like, we've seen that there's a need for mental health services. We have community-run stuff like Mental Health First, and police aren't trained to de-escalate problems. So if we could spend the money instead on treating the issue before it gets to the point where we need to incarcerate people, that would be a lot better. Thanks.
Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes. Go ahead with your
Good
comments.
afternoon. My name is Jolie Terrazas. Yes, can you hear me?
Yes, I apologize.
Hello?
Yes, we can hear you.
Okay, thank you. My name is Jolie Terrazas. I reside in District 2. This is the ancestral tribal land of our present-day Native American community members, including the Nisenan, Maidu, and Miwok people. Tomorrow is International Holocaust Remembrance Day, and I hope we can all remember how dangerous it is to dehumanize people. We can diminish our own humanity by not acknowledging the truth, by putting profit over and power above people, above humans. On a related note, I have a little true-false quiz. You can shout out the answer if you're at home. True or false, the county has explored all alternative options for meeting the consent decree requirements that do not include new construction. According to my understanding, consider not incarcerating people in wheelchairs or those who have severe mental illness, and use RCCC and Elk Grove for intake and ADA accessibility requirements. True or false? It is impossible to renovate the current space. It's my understanding that this is false. It is not impossible, and given the space limitations that have been mentioned, reducing the jail population, especially during this pandemic, with a slow vaccine rollout and variants of the virus forming as we speak, this should be a starting point to reduce the jail population, decarceration. And a little context for this last question, are any of you familiar with organizational culture change? If so, you know it's difficult, it's time consuming, it takes resources. So related to that, true or false? All you need to do to change culture in an organization is change the building. False. The people make the place, people. Especially in this case, merely making your feng shui more therapeutic is not going to bring about the change that addresses the human rights abuses and address the root causes of the consent decree. So I am urging to the board to please do not invest $10 million in the jail expansion. Thank you.
Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Hi, thank you. My name is Alex Severson, and first I would like to discuss or talk to Supervisor Natoli. I would really encourage you to press the idea that we don't have a solid budget for this situation. Is it $80 million? Is it $200 million? Kitchell Incorporated isn't even located in Sacramento. They're based in Arizona. This is $10 million that is not going to Sacramento workers. I'm a member of District 3. Supervisor Desmond, as a lawyer, I would like you to consider the fact that this does not hit the 5-year mark for the Mays decree. Estimating construction being done in 2026 does not do anything to alleviate the unconstitutional situation that you have left incarcerated people inside of the Sacramento main jail. Opening and spending this money without checking out the other alternatives that we have rather than incarceration is a gross misconduct of your job, and I might bother to remind you that you won your election by 1.6%. And as civil servants, we need to make sure that we are doing everything that our constituents need, and putting more people inside of prisons isn't it. Thank you for your time.
Please send the next caller. Please start with your comments. You have 2 minutes.
Hi, my name is Ashley Mitchell, and I am urging you to vote no on this, partly because it's already been stated that we're not even sure how much money this is going to cost, and that sounds extra suspicious if I'm hearing board members mention that it sounds like a good deal. That definitely sounds like it's not going to work out in our favor, especially when we need to be allocating these funds to needier parts of our community and not incarceration, especially based on these previous comments of how officers are treating inpatients with mental illness, which we also do need to decriminalize, especially because the statistics already say that police officers are 16 times more likely to kill somebody with mental health issues, and I'm not comfortable having people who are very vulnerable under that quote-unquote care. So I'm going to urge a no on this, again, in the interest of not giving more money to police officers, which we already cannot trust, as we saw in June, to be compassionate and not be overly aggressive or abusive. So, yeah, thank you.
Thank you. Next caller, please.
Please start your comments. You have 2 minutes.
Good afternoon, board members. Thanks for taking my call. I'm calling in from District 3, and I urge you to vote no on item 44. From my understanding and hearing other comments, approving this $10 million addresses only a tiny set of requirements from the May's consent decree, and in a fiscally irresponsible way. Incarcerated people are suffering due to a number of human rights violations that are outlined in the lawsuit. And the culture of cruel behavior of the sheriff's deputies is not changing. Yet the county has done little other than to prioritize a building that will not even be operational until 2026, and a building which does not even have the buy-in of the sheriff's department. Instead of jail expansion, I urge you to require that county staff and the sheriff's department give regular public status reports on how the consent decree is being met now, especially as COVID-19 spreads out of control in the jails. While a new building may allow for greater social distancing, it is again the behavior of sheriff's deputies that is allowing the virus to go rampant. And this behavior will not change with a new building. This general fund money can and should go to underfunded mental health and social programs that actually serve those who are in need of them, as well as alternative response teams to law enforcement for mental health related incidents. Both of these will reduce a currently bloated jail population. And by safely reducing the jail population, it will be easier to address some of the consent decree requirements for infrastructure improvements within the current jail without needing a whole new building. Funding mental health services also helps address the more root concerns and needs of our county's at-risk residents rather than locking them away in yet another unsafe environment, especially as the pandemic rages on. One potential solution I urge the county to explore is to apply for money through the governor's recent CalAIM initiative. This money is for investments in infrastructure to expand the behavioral health treatment resources within the community. CalAIM also includes an opportunity to access federal matching funds for services that offer support for community-based mental health care. Sac County needs to commit to a more humane approach to serve those suffering mental health crises. Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Hi. I want to urge the board to not go ahead to not put money into this construction. I have been in the Sutter Psychiatric Hospital inpatient, as well as the Heritage Oaks inpatient hospital. One might argue that Sutter looks or is much more architecturally therapeutic. However, neither of these hospitals had any effect on me getting to the place that I am right now, where I am able to be in community with others and actually love life. It was only when I received mental health care, when I lived my life in my experience in my home, where I am able to do things for myself, and I am able to talk to people in my community and go out into the world and do other things. It's not being trapped. Being trapped had only worsened my conditions. I also want us to think about what it means to be a whole community, and treating people like individual problems will not solve this. We need to look at the community programs that already exist that are blooming, like mental health first, the Black Child Legacy Program, and other groups that already exist, like the one that I just came from, the Decarcerate Sacramento program.
Please wrap
These
up your
programs
comments.
have really helped, and I urge you to think about them. Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Hi, my name is Dr. Philip Summers. I am an emergency and addiction physician here in Sacramento and a homeowner in District 1. I'm calling to urge you to vote against wasting hundreds of millions of dollars on this jail expansion. This is an ineffective and irresponsible use of our public funds. The board needs to take a holistic approach and consider the best use of these dollars for our community's mental and physical health. A bigger jail is not the answer. We are in an unprecedented health and economic crisis. Our emergency departments are bursting at the seams, with patients sick with COVID and other critical illnesses and also with mental health crises. However, we cannot get these patients placed into psychiatric care in a timely manner due to lack of funding. This not only means substandard mental health care, but also clogs our emergency departments and impedes our ability to provide life-saving care for other medical emergencies. Jailing more people is not a solution to this problem. Our overburdened system of psychiatric care urgently needs this investment. Expanding the jail only perpetuates the criminalization of mental illness. No one benefits from being incarcerated, and the jail will never be a place for therapeutic care. No amount of investment in infrastructure can overcome the inherently antagonistic and oppressive nature of incarceration. If you truly want these people to thrive, remove them from the toxic environment of the jail and provide them with the support they need and deserve. This is urgent right now. In the jail, human beings are forcibly exposed to crowds of strangers, poorly ventilated spaces, unmasked deputies, and involuntarily placed at risk of COVID infection. This is unethical, and we need to decrease the jail population to make it safe. Why is it that the sheriff's office has the gall to ask for millions of dollars on top of their already bloated budget? Do we truly believe that a bigger jail will lead to better health outcomes? Do we think that the sheriff's deputies are the best mental health care providers that our county has to offer? Of course not, because that makes no sense. Supervisors, you speak your values with the county's pocketbook. Do not build a bigger jail. Decrease the jail population and invest in supportive housing and access to care. Thank you.
Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Hi, Board of Supervisors. This is Liz Blum with Decarcerate SAC, and I have had loved ones who've been incarcerated during mental health crises. And first, I just want to say, I just want to share a story that an architect shared with me recently. He said he was part of a similar project that designed a, quote, better intake space at a jail in Denver. The project team apparently wanted folks to have a more relaxing, spacious environment when they were waiting to be booked into the jail. Once the project was completed, a sheriff's deputy murdered someone in that very space a year later. I'm not sure how many stories like this you need to hear to understand that a newer, nicer jail is not going to magically provide better health care for people inside. If you declare racism as a public health crisis, if you truly believe racism is a public health crisis, you cannot separate this expansion project from the politics of racialized constructs of criminality, of mass incarceration, and cultural embraces of punishment. We must acknowledge that these politics and ideologies exist here locally in our county, in your county, that you have the power to do something about today. A more, quote, therapeutic architectural design is not going to solve root causes of the consent decree and ongoing human rights abuses inside the jail. An improved facility will not solve the systemic and cultural issues of sheriff's deputy behavior and abuse. I don't know how many times we have to say that. This is a treatment-centered framework and vision for the new jail is nothing more than coercive, and the very technology of a cage will inhibit this project from promoting any form of therapeutic justice. Of course, we understand that the lawsuit has requirements that have to be met, but why is this county more concerned with just 4 of the 400 consent decree requirements? By prioritizing a building first, you are complicit in the suffering and torture of people currently living in the jails where COVID-19 is out of control. Your priorities are killing people. The 711 G Street project is only planning to serve 150 people per year, while tens of thousands of people cycle in and out of the jails each year. Even if you think that building might be needed to meet the consent decree, the price tag of this project does not guarantee that the county will meet the consent decree. Moving forward with this project, it will not prevent future lawsuits and
Please send the next caller. Please start with your comments. You have 2 minutes.
Okay, thank you. My name is Nikki, and I feel like I know most of you, or have been there enough to know most of you, and have let y'all know my story of being inside Sacramento County Jail while experiencing a mental health crisis, arrested for that mental health crisis, and then experiencing it for 12 hours of incarceration, and then released on the street at 3:30 a.m., which, of course, my life was only saved because my friends were there, not because any part of the system that you operate or function or fund was able to intervene in a way that was life-affirming. And so, I want to say that I've also experienced care at Sutter, Davis. Shout out to all the people calling in and saying where they've been. You inspired me. Sutter, Davis, and Sierra Vista. And I can say by far that while none of these experiences were liberatory or trauma-informed or helped me heal, the jail is where I experienced the least amount of care and the most amount of trauma. And what I really need from this county board is to take a look at where you're going, what you're doing, what your trajectory has been. We've been coming for quite a long time now to talk about this trajectory, and we needed to go in another direction. I mean, we had a 30% jail population reduction under COVID, and then this county, the all state actors did nothing to make sure that stayed in place and to ensure people were protected. And here we are again with a high population. And these folks are folks that should be experiencing care in the community. And if you funded care in the community with this $10 or $150 million, those people wouldn't be experiencing incarceration. And that is the place we need to get to. And I encourage you to try to get there instead of this. Obviously, vote no.
Thank you. Please send the next caller. Please start with your comments. You have 2 minutes.
Yeah, my name is Keon Bliss. I'm calling from District 1, and I want to ask this Board of Supervisors, how much money are you all going to waste on a decrepit, aging monument to oppression that is our main county jail, rather than putting that money into services where it could actually do some good right now? Not 6 years from now, but right now. You have, I keep hearing, and many people have been advocating for alternatives to 911, which the sheriff has publicly said he would support, and multiple boards of supervisors on his board are down with. All you need is to look for the money, to find where the money can come from. Well, congratulations. You've got it right here. $10 million whole dollars that you can put to actually creating a viable program that diverts mental health emergency calls away from the sheriff's department, which they don't want to do, into actual behavioral health professionals to use. And you could divert that money here today, this month, right here. Why are we spending money on this when even experts on jail management and mental health all agree that this is a waste of time and money? You raised the right questions, Supervisor Natoli, in questioning where's the plan. Even your acting CFO, Britt Ferguson, admits that you've been talking about needing a plan since as far back as 2015, right? And yet here we are in 2021, and we still don't have one. And we haven't even talked about the ongoing cost of maintaining this facility if it is built. So why are we even having a conversation? This isn't a hard vote for you all at all. It should be a straight no.
Please
we could put that money to better use right here and now. Vote no on this stupid jail expansion and put it towards actual alternatives to 911, to actually addressing the ongoing current mental health crisis that Scott County has been facing. You can do it. You have the power to do it. Stop wasting yours and our time, please.
Thank you. Please send the next caller. Please start with your comments. You have 2 minutes.
My name is Lamaya Coleman. I live in Supervisor Cerna's area. I oppose the $10 million for the Correctional Health and Mental Health Services Facility contract. General funds are very limited, and this will divert funds away from already underfunded housing, health, and human services. As a Christian, I really believe that we need to invest in expanding community supports and treatment, not increasing funding for incarceration. Please invest the $10 million that you're considering investing in this today. Please invest it instead in a 24/7 county-wide 911 alternative in which mental health providers and peers trained in de-escalation respond to mental health crises instead of law enforcement. Thank you very much.
Thank you. Please send the next caller. Please start your comments. You have 2 minutes.
My name is Ryan McClinton, and I'm a resident of D1, and I'm a lifetime resident of Sacramento. And I'm very concerned with how we're approaching the building of this mental health annex that we're calling it. One being positioned in downtown Sacramento, when we actually have another facility, RCCC, that has more than enough room to build facilities on, but even more so that facility has a history of opening and closing branches of its facilities to pad its budget that doesn't actually get cut nearly enough from our general fund. When we're looking at $10 million and where it's going to come from to pay for the much-needed needs, especially if we're aligning it with the consent decree, which is very inauthentic in its approach, there's serious concerns where there's already been major general fund allocations as well as COVID relief funds to the Sheriff's Department, but we're not using those funds to actually pay for this mistake that's happened by the Sheriff's Department. This is an issue that should have been addressed 50 years ago, and the fact that it's having to come from taxpayers' backs to fix this problem is a serious concern. The other thing that I'm highly concerned about is the inauthenticity of this approach when we're actually building a program to have alternatives to 911, at the same time building a jail facility to house those folks who would hopefully be diverted from the jail. When the county staff says that since 2015, we've been working on plans to reduce the jail population, yet there's been no solid plan laid out in 6 years, there's a graver concern about how we're making budget allocations to continue housing more folks to incarcerate them. We have to get serious about this plan. Community stakeholder groups have reached out. Decarcerate SAC has been at countless city council meetings and meeting with all of you, all board of supervisors, to really understand what is this plan going to go forward and how can we get it moving. It's been slow in approach. There hasn't been the greatest transparency that we need for the community to understand what that's happening. And I'd say the same thing about the alternatives to 911. We have to get serious about what our real plans are and how we're actually going to approach them with authenticity to make sure they have the impact that our county residents deserve. Sacramento is a growing county with a huge problem with homelessness.
Your comments.
Yes, with homelessness and those in mental health crisis. We have to get serious about the approaches to keep people home and keep them out of incarceration. Please make the right decision. Do not vote yes on this agenda item.
Thank you. Please send the next caller. Please start with your comments. You have 2 minutes.
Good evening. I hope everyone is doing all right on what looks like is going to be a very stormy night. I am a lifelong District 2 resident. I'm going to be completely honest. It feels like every few months I have to call you all and tell you to stop trying to dump resources into incarcerating people. There's a real cause and effect, like based on where you choose to put money. When you continuously try to put money into structures that require a continuous, non-stop incarceration rate, you're going to have an effect of people needing to continue being arrested and incarcerated. Police and state agencies have to justify that you put money into these systems by upping arrests, and what you end up getting is you get a county where it's actually a benefit to criminalize people. This is this is the polar opposite of safety. We need prevention services, and we need to reduce our incarcerated populations. You all have loved ones. How would you help them if they're struggling and harming themselves or others? Would you put them in a cage, or would you give them actual support and resources? I'm urging you to vote no on this item. Please conduct yourself with compassion rather than callousness to the people who you serve. Lives do depend on it. Thank you.
Thank you. Please send the next caller. Please start with your comments. You have 2 minutes.
Thank you. It doesn't matter what my name is, what area of the county I live in. What matters most is that constantly people, the same people, as a matter of fact, continue to call in and express issues and concerns about a very backwards and antiquated system that does not lend to the voice of the people, that does not, by choice and intention, does not give agency to and space to actually collaborate at tables and intersections where we know have been proven to reduce harm and promote restorative, transformative justice practices other than incarceration. What we know is that we live in a system of white supremacy, a political and economic, a structural system in which whites overwhelmingly control power and material resources. The conscious and unconscious ideas of white supremacy and its entitlement are widespread in relation to white dominance and those who are non-white subordination. There are daily reenactments across a broad array of institutions and social settings where we can find white supremacy lurking its ugly racist head. And the carceral system is at the top of that list. And so there's nothing therapeutic you can ever mask by building a building, a structure, a cage, making it prettier if it is within the realms of a carceral system. So I just ask that as we stop wasting the community's time, please stop wasting the community's time with bringing these issues back to the table when the community has said no. Thank you.
Thank you. Please send the next caller. Please start with your comments. You have 2 minutes.
Thank you. Good afternoon. My name is Leslie Napper, and I'm in District 1 and a mental health consumer. Please vote no. The jail is no place for mental health treatment. Stop criminalizing mental health. I'm concerned how this project will disproportionately impact communities of color, particularly Black, Brown, and Indigenous, which goes against your resolution declaring racism a crisis. Specifically, the resolution states to design, develop, deploy community-based alternatives to prevent trauma and eliminate harm associated with racial inequity. And this is, and we know that everything that's happening in this world and how it's impacting particularly our communities of color of late. To continue this project is a slap in the face to your own resolution, not to mention it further stigmatizes mental health. Jail is not a place for mental health treatment. Thank you for listening.
Thank you. Please send the next caller. Please start with your comments. You have 2 minutes.
Hi, Courtney Hansen, District 1 in Decarcerate, Sacramento. I want to note that you also have 87 public comments posted online, every single one of them in opposition. So I want to know how this board is going to account for that. 23 people tried to take their own lives in our jail just this last year, and this county still feels no urgency to reduce the number of people in our jails. It's almost like you are deeply committed to incarcerating people living with serious mental illness. And I want to address Kitchell Construction specifically in their 80-page proposal filled with optimism and false promises. But make no mistake, the decision-making power today lies with you and your choice between a legacy of more incarceration, desperation, destabilization, or hearing your community sounding the alarm. We're tired of your patronizing rebuttal that the goal is not to increase bed space. It is insulting that you continue to repeat this after hearing hours of testimony from experts who have been incarcerated in your jails with mental illness, have family members in your jails, have worked in your jails. We are part of a movement that will not go away because we know deeply that a different route is possible. We can see the roadmap. It'll keep families together. It will save people's lives. It will result in a more sustainable county budget that isn't always choosing between jails or parks, jails or schools, jails or 911 alternatives. But we are not the only ones who are part of a movement. You are part of a movement if you build this jail, and it's called carceral humanism. It is a strategy of portraying jails as social service providers, especially mental health providers, to secure more funding and public support for an institution that faces mainstream critiques of racism and mass incarceration. 37% of people in our jails are Black. 11% of the county is Black. You are complicit if you build this jail and significantly growing a system whose number one goal is control, surveillance, punishment, and torture.
Please wrap up your comments.
This board will vote on how to move forward with alternatives to 911 in late February, and we are already anticipating the scratching of heads and wringing of hands about where in the world we could ever find funding for this life-affirming service. What is the total price tag on this backwards project? What will go unfunded as a result? Thank you.
Thank you. Please send the next caller. Please start with your comments. You have 2 minutes.
Good afternoon. My name is Judy Hyman, and I live in District 1. After this year of very public reckoning about our criminal justice system, when so many of its long-standing problems have been laid bare, I find it truly incomprehensible that any of our elected leaders could fail to see that this system must fundamentally change. The current system has failed our community. We have better evidence-based alternatives as recommended by public safety and public health experts and by many of the previous commenters on this line who've spoken from their personal and professional knowledge and experiences. I believe that continuing to invest in the jail under these circumstances would be a huge step in the wrong direction, making it yet more difficult to find the resources for the proven strategies that could truly improve public health and safety in our county. Please vote no and direct staff to meaningfully investigate alternatives that rely on evidence of effectiveness and that respect the human rights of all Sacramento residents. Thank you.
Thank you. Please send the next caller. Please start with your comments. You have 2 minutes.
My name is Robin, and I live in District 3. I'm calling in today in complete opposition to the use of $10 million of general fund money or any money for the construction of a mental health jail expansion for many reasons. First, this construction is not necessary to comply with the May's consent decree. Nowhere does it specify that new construction is necessary, yet the board has not sought any alternatives besides new jail construction. The consent decree does, however, mention that decreasing the jail population would work towards significant improvements, and that is what I'm asking you to focus your attention on. We have 60% of folks inside of our jails who have yet to be even convicted of a crime, yet Sacramento County chooses to incarcerate them, some for years, before they even have their date in court. We need to change this and could be looking at significantly decreasing our jail population by using a variety of alternatives to incarceration. But the Board of Supervisors has failed to do so much as lift a finger to investigate or engage the community about what those things could be and how we could keep our jail population to a minimum. Instead, you continue to bring millions and millions of dollars worth of new construction proposals and nothing to help our community now. Why are you more concerned with new buildings than people? We should be funding people, not buildings. Decreasing our jail population in general would be a tremendous thing, But right now, we're seeing an outbreak of COVID-19 in our jails, where nearly 10% of the jail population is positive with this deadly virus that has been ravaging our country, our county, or in the entire world. If we had significantly lower jail populations, the Sheriff's Department could better and properly care for those in custody. This type of issue is exactly one of the things that the Mayor's Consent Decree is calling for action on, proper medical care. If there was a commitment to less people in our jail, there would be space for quarantine, medical treatment, and more. Why are you more concerned with new buildings than with the health of people? We should be funding people, not buildings. The community has been asking for substantial funding for alternatives to police involvement in mental health crises, i.e. alternatives to 911, so that those with mental health crisis can receive the help they need rather than incarceration and police violence, like people like Robert Calderon. Okay, basically, I've got more to say. I wrote it in, so please read that message if you haven't already, but vote no on this. We do not need this. We need to be funding people and funding our community.
Thank you. Please send the next caller. Please start with your comments. You have 2 minutes.
Hello, my name is Claire Vogel, and I don't have much to add but my voice, but I would like to commend everyone who's called in and spoken so well before me. My father is a defense attorney, and I've seen him represent many cases of medical malpractice and neglect in prison. I found it disgusting how dehumanized and ignored these inmates have been, especially in cases of mental illness. Mental illness is inherently alienating on its own, and the shame that these people feel often feeds back into their own mental illness. So we do not need to shove them out of sight and shun them from society. We need community-based mental health treatment that can meet them where they're at and work with them to improve themselves. The people struggling with mental illness in Sacramento County are among the people that you represent, and they should be able to trust you to look out for their best interests as well, not just others' financial interests. Thank you.
Please send the next caller. Please start with your comments. You have 2 minutes.
Thank you. I'd just like to stress that we know that this project is not going to increase bed capacity, but we can still call it an expansion. It is an expansion of county resources, general fund dollars, and the county is not even sure how much yet. But the ongoing cost of this jail will most certainly be in the hundreds of millions. Let me remind you again that the county does have the power over who bears the financial burden of consent decree requirements and how the consent decree is met. The county first needs to prioritize depopulation before attempting to meet the structural pieces of the consent decree. And is it too radical of an idea to stop incarcerating people in wheelchairs and divert this population to services that they need? How exactly would building a bigger and newer institution reduce recidivism? There are a number of counties who are planning to build, other counties who were planning to build mental health jail facilities after being faced with shockingly similar consent decrees. Many of these same counties were able to meet the consent decrees without new buildings. The county's current plan is not going to comply with the Mays timeline and yet has been rushed forward with zero community engagement and with so many legitimate questions left unanswered. Please, if you care at least about good governance, vote no on this contract today. The Sheriff's Department has killed 2 people in the last week, Krishan Geiger and Robert Calderon. As one of my heroes, Ruthie Gilmore, says, where life is precious, and life will never be precious. Never be considered precious inside of our jails.
Please send the next caller. Please start with your comments. You have 2 minutes.
Yeah, just a couple of questions around this funding. This $10 million is supposed to be coming out of the general fund, according to the CFO, right? Why isn't this money being taken directly out of the sheriff's budget? It's almost $600 million. And by the Office of Budget Management's own admission and this board's own admission, has the most money on hand at the end of each year to easily be able to afford whatever construction costs that this jail is supposedly associated with, or at least this $10 million. It easily can be pocketed, or it can be spent directly from the sheriff's budget. Why are we spending more general fund money to actually fund this boondoggle that, even according to the National Alliance of Mental Health Illness executive director, is long obsolete, doesn't need $10 million Band-Aid to delay the eventuality of tearing it down and starting from scratch, which the Sacramento County Jail absolutely does need to. Furthermore, why are we talking about a construction project that will take 6 years to complete, well outside the Mays consent decree, when we already have a crisis inside the jails right now where people are dying in custody? In fact, just 9 last year died in custody, which was a record high since at least 2013. And we're talking about putting more money into building a facility that we're not even going to see the benefits of until 2026? Makes no sense. Furthermore, what about the majority of the requirements of the Mays consent decree? More than 400 or so requirements around that are specifically around policies and procedures in the Sacramento County jail system. Most address decisions being made by county sheriffs, deputies, and jail staff. And while we know that you all do not have the power to change the majority of these policies, we should just first recognize that the majority of the consent decree requirements can be met with zero renovation cost. Yes, I'll finish up my comments by saying vote no to give $10 million more to this jail and actually spend it towards services that we really need, particularly alternatives to 911, as well as COVID response.
Thank you. Please send the next caller. Please start with your comments. You have 2 minutes.
Thank you. My name is Sonia Lewis, and I am a citizen in District 5, Natoli's district. And as I watch the proceedings here today, I first wanted to say, Ms. Frost, if you are tired, you should get some rest, because rubbing your head and making it seem as though you're not connected to this process is kind of infuriating for people to spend their time and energy calling in consistently over the issues that come before your board. I just, it's implorable that we continue to have this conversation when too many people are just asking you to really reevaluate and reimagine what we can do when it comes to the constructs of helping people in times of crisis and just helping people in general, right? We're talking about social services. When we talk about the social constructs of race, there are 5 areas that all people rely on: employment, housing, education, voting rights, and health care. And when we're talking about those things being the major components of people's lives, whether or not they are able-bodied, mentally sane, and not suffering from mental health issues, they still need those basic areas met. And so if we're talking about millions of dollars being spent in Sacramento, it would be responsible of you as our Board of Supervisors to invest in the people where they're aching the most, and that's with housing, that's with education, that's with employment, that's with health care, and that's with being able to vote in people who are going to make sure that the most fragile in community are taken care of. And every time we have this conversation about jail expansion, jail improvement, therapeutic jails, anything that has the word jail in it or incarceration, know that you are talking about your mind-sucking comments. Thank you. You're mind-fucking the community to believe that you're doing us a favor. You're not doing us a favor. This is insane. And as long as we keep doing the same thing, we will keep getting the same results.
Does that conclude our public comments?
Yes, it does.
Okay, thank you. So now we're back to the board with deliberation. Call on Supervisor Kennedy, please.
Thank you, Chair. Okay, this is, as all of us know, and welcome Supervisor Desmond to the conversation. This has been the most difficult thing for us to get our arms around for the last several years. I participated in the mediation with the federal judge, and a judge who, by the way, was extremely fair and has a great deal of experience in these particular cases. And I believed him when he said that the deal that we got was the best deal we were going to get. Some of the callers who called in, I consider friends, and I see the points. I do, and I wish that I could take every bit. And I think that anybody who knows me, including the four of you, would know that I wish we could take all this money and put it toward mental health services. That would certainly be my choice. But we do have to abide by the consent decree. Number one. Number two is, as Mr. Bliss said, this is an ancient and decrepit facility. And I agree with him on that. And does that mean we should, pour all of our general fund into, the jail? Absolutely not. Have we neglected the facility for a long time? We have. Because inmates and with the care and resources, and what is that done for always? Okay.
We're struggling to hear you for some reason.
Well, there's all kinds of background noise going on for whatever reason. I'll speak up. It is a decrepit and ancient facility that we have neglected for too long. Do I like to put more money into institutionalizing people? No, but the fact is that as long as we're a society, we are going to continue to institutionalize people. Can we and should we find ways to keep them out of the criminal justice system and put them in areas where it's more appropriate and give them care that's more appropriate? Absolutely. But in the meantime, the jail facility does need investment. And a lot of people are going to disagree with that statement, but it's true. It is not ADA compliant, which means that we are breaking the law. It is not HIPAA compliant, which means we are breaking the law. We are lucky that it has taken this long for us to be called on those things. And frankly, we could put all the money in the world into diversion programs, specifically for mental health diversion programs, and we're still going to have inmates who require mental health services. That's not going to go away. And what is there now is inhumane. It is not the appropriate level of care. And so we do, those inmates with those needs deserve it as human beings. So therefore, there's a lot of ways I'd like to spend this money, but I do think that we have to continue to go forward with these changes and with the development of a correctional health facility at that location. That being said, I would like to look at, and this might be, toward our CEO and Mr. Wagstaff and Mr. Ferguson. Mr. Wagstaff and Mr. Ferguson also been in relationship with the litigants to look at our proposed 911 diversion program that we are going to be hearing in approximately a month, considering and giving staff direction on, and see if diverting some money out of the consent decree and dedicating it toward that, which will alleviate the need for people to go into the criminal justice system and get them to the services, more appropriate services they need in mental health. Can we divert money out of the consent decree plan and get credit for it if we divert that money for the 911 diversion program? I still think, and the sheriff disagrees, but I still think that we could also look at some money for the 911 program, which we'll be talking about in a month or so, out of the sheriff's budget, because I think there's a direct nexus to alleviating the need for full-time deputies to be mental health service providers and social workers, which they shouldn't be, which I think will alleviate money out of the sheriff's budget, which should be moved over to this program. But that's another story for another day. But what I would like to do is specifically ask Mr. Wagstaff and Mr. Ferguson to reach out to the litigants, explain what we're talking about with the 911 program, and see if we can take some money out of what is to be allocated toward the consent decree and allocate that money as meeting the needs of the consent decree, but towards something that wasn't contemplated when we entered into the consent decree. Those are my comments at this time. I may have more. Thank you.
Thank you, Supervisor Kennedy. Supervisor Cerna, please.
Thank you. So first of all, let me just say I appreciate public comment today, and I've appreciated in past encouraging this board to be thoughtful and creative about how to meet the intent of the consent decree. And I'm convinced that this board has really circumnavigated the issue with staff's help, of course, and legal assistance. I don't think any of us wakes up in the morning and says the next thing we want to do is, spend $10 million on the jail facility. We understand our obligation, certainly to the people that we represent that happen to be incarcerated. We owe them as much attention as we owe anyone else that we're elected to represent. And so it is a very, very frustrating thing to get to this point where we're now talking about brass tacks. We're talking about the intent to appropriate, in this case, $10 million to initiate a design build effort for the jail. And I realize, there have been past confrontations or confrontational discussions with Decarcerate and others about capacity versus space for programming. So I'm not going to go there. There's probably a large part of that remains categorized as, we agree to disagree. But I do think that the comments that were made in particular about practices and behavior by the Sheriff's Department and how they treat inmates, especially those with disabilities or learning disabilities or mental health challenges, I think that's a responsible thing for us to continue to explore in terms of how best to ensure that individuals, our constituents, those particular challenges and needs, if incarcerated, have the best chance for a positive outcome. I think, like Supervisor Kennedy, I'm interested in other parts of the intent to satisfy the consent decree that don't fall under the category of capital expenditure in the form of a jail annex for correctional health. And I got to believe, I'm not an attorney. We now blessed to have another attorney on the board, so maybe Supervisor Desmond here will chime in. But I got to believe that those inmates that do suffer mental health challenges, depending on the acuity of the individual, could be perhaps considered for home detention with ankle monitors and still have access to mental health treatment outside of the confines of a jail facility or jail annex facility. And so that's something that I'm eager to explore again with our executive staff and I think it's thematically, it's I think along the lines that Supervisor Kennedy has suggested. You know, we look at and consider the 911 alternative, and if there are resources that we think could or should be applied to enhancing the ability for what would otherwise be our incarcerated population to have access to mental health treatment and programming outside of the confines of the jail, I think we have every obligation to exhaust that. And so that should be part of, you know, our collective intent as this board to help meet the consent decree. That's my opinion, but I would hope others would generally share support for that. You know, again, this has been a long time coming. This has been something that hasn't happened as fast as the executive staff, I'm sure, would have liked and that are comfortable with. Mr. Ferguson said at the conclusion of his presentation that we are quote unquote behind, and I understand that, but I think that's also testament to the fact that we have now taken the time to really understand what it means to legally satisfy the consent decree, and to remind ourselves and to, as tortured as it can be, to remind our constituents that the alternative to not meeting the consent decree, in fact, would and will, if we don't move forward with this, compromise our general fund budget even more so. And believe me, I get it. I want to spend money on Black Child Legacy more. I want to enhance all the programs that are proven so successful, whether they're public health or COVID related or mental health or behavioral health, child welfare. Believe me, that's part of all of our agendas. But if we were not to move forward with what has been negotiated in the settlement agreement or the consent decree, our general fund would be much more exposed. And I think we would be having a conversation in the not too distant future with angry constituents who declare, well, why didn't you seek the less costly alternative? And now look what you've done. You've now compromised the ability to continue all the programming that you want and that we want. So yeah, this is a rock and a hard place, no doubt about it. But it does not mean that we cannot jointly walk lockstep with, especially with the advocates that want the same thing that this board does and the county wants, which is to minimize jail population as low as we can possibly get it and stay within the confines of the law. I think that should be and continue to be present at the forefront of our thought processes and our agenda. That's something we all, I think, have a vested interest in. So those are my comments. I'm eager to hear from my colleagues.
Supervisor Desmond.
Thank you, Supervisor Kennedy and Supervisor Cerna. I agree with a lot of the things you've said. I obviously have a little bit of a different frame of reference here. I was a law enforcement officer for 24 years. I'm very proud of that. I've been in a lot of situations where I have unfortunately arrested folks for committing a crime who clearly had a mental illness issue. And it struck me when I got into the legislative role in the California Highway Patrol and worked with Senator Mitchell and prior Senator Mitchell and Senator Bell on legislation to require more de-escalation training for law enforcement throughout the state of California. During that legislation, during that process, developed very good relations with NAMI California and other advocacy groups, and came to realize that in the state of California, our local county jails and state prisons are the biggest providers of mental health in the state of California. That is a policy failure across the board. And unfortunately, we are the ones at the local level left with cleaning up that situation, addressing that situation. And I found myself in situations many times as a peace officer where I wish there had been alternatives where I could take someone who was suffering from some kind of mental health crisis, but there wasn't, and there still isn't. And so that is something that I will always be fighting for. And Supervisor Cern, I think we can, it seems to me we have to go down this road to comply with the consent decree, but I think you're absolutely right. We can still at the same time be working to divert folks from going into jail in the first place, and folks who get there with mental illness, get them out quicker so they can get the treatment they need. But the bottom line is this, does not increase capacity. It's not designed to do that. And it improves the conditions for, unfortunately, folks who are going to be incarcerated. As Supervisor Kennedy mentioned, it is unfortunately in our society, we're always going to have incarceration. We're always going to need to have places to incarcerate people. It's kind of a necessary evil, I guess, of our society that we have. A question I had, and kind of, a lot of Supervisor Natoli's. Oh, and one other thing I want to say, I have not had the opportunity yet to meet with decarcerate groups or some of the advocacy groups, but I can tell you, I look forward to bringing my kind of unique experience to bear to work on a long-term goal of making changes that results in less people incarcerated in Sacramento County. I think we have some great programs, some great ideas, a lot of things that I would like to join you and find common ground with you and see where we can push for some of these things and make sure they become successful, including the alternatives to 911, including more pre-trial diversionary programs. But when it comes to the financing for this project, I understand it's a design build project, which is something a little bit different for the county. It's something we did at the state level, I think, a little more frequently. And Supervisor Natoli brings up some very big concerns that we're kind of getting in bed with Kitchell here, and they'll be taking us all the way through to the end of this thing. So I guess my question for maybe Britt or Jeff is, what other kind of benchmarks along the way are they going to have to meet and then bring back to this board before we, what other decision-making authority will we have as this project continues? And I specifically am keeping in mind Britt's comment that, look, we don't know ultimately what this is going to look like. It may be a little smaller, it may be a little bigger. So I'm wondering if you could speak to that, either Britt or Jeff.
Supervisor Desmond, this is Jeff Gasway. I would say that around May timeframe, I'm hoping sometime in May I'll be able to come back to the board with a workshop to kind of discuss the programming and what this will look like. And then there are also other key dates that will be coming back to the board for approval for the RFP for the design build entity, as well as discussion around the budget and what we're going to need to fund the construction of the facility. So I hope that answers your question.
I mean, it does generally, but thank you. I appreciate that. Yeah. And thank you, Madam Chair.
Thank you, Supervisor Desmond. Did you have any additional comments, Supervisor?
Yes, I do. Thank you, Madam Chair. Just a couple of things. One is that certainly I know that in trying to meet the obligations of the consent decree, that obviously there's been a lot of energy and effort expended, not just on what's before us today, but obviously on other elements. And I guess I would say it actually goes to Supervisor Desmond's last question in the response, is that Knox and Lewis, along with county staff, have been charged with doing programming and all the work that goes behind that, including, as I understand it, you're looking at functionality and the requirements for space under various scenarios, but it also takes into account, as I understand it, some confirmation, and I don't know exactly how it's going to be achieved, of inmate and staffing numbers, other documentation and such. And I would say at best what's before us is premature. Others would argue not so. I get it, that's not the recommendation before us, but I would think, and I said this last fall, and again, not to depart too much from some of my colleagues' comments, but that a workshop around what it is. And I think a component that's been spoken to here by all three of my fellow supervisors have spoken to it. You know, we had a discussion back in budget in September about the alternatives to 911, about other things we could do. I've seen it once, I've seen it multiple times in staff reports about exploring alternatives to incarceration, other efforts between certainly involving the courts and criminal justice entities relative to dealing with population reduction, but certainly doing it in a manner obviously it doesn't compromise safety of the persons in our community, either those who would be alternatively directed as it relates to keeping them out of jail, but also I think just the aspects of some of the things we've been talking about here, that they have budget implications and certainly go to elements of the consent decree. And my understanding is that, again, Nocton Lewis, who was given that charge working with our county staff, and you've heard from some of those folks today that have been on point, that, they're going to have a programming document prepared sometime in the next 6 to 8 weeks if the schedule that I've seen is correct. It would seem to me that a workshop, not to continue to belabor the point, certainly we may, even continue to be in different spots on this, but before this board member is prepared to set aside another $10 million to design, build, ever how it might be integral to the conversation, I want to see what some of the work product is, and I want to do it in a public context with our board in a workshop fashion, and to talk about it and to have an opportunity for something we talked about going on 5 months ago now as it relates to the alternatives to 911. And and again, I've said this on a number of occasions, and certainly in discussions about budget and around issues of our correctional facilities, we're going to need to make modifications to the existing structure. There's no question about that. Supervisor Kennedy pointed out, we all know it was in the consent decree. There are ADA and HIPAA deficiencies, serious ones, and they impact upon the people who are in custody, certainly, but on the entirety of the day-to-day activities that go on in the jail. But again, I'm not an expert, but I'm not convinced that all those things, unless we have the discussion, have been taken into account. I know it's difficult working in correctional facilities to modify space, but if you know with some certainty, as much as you might know, that you're going to have a certain inmate count at any given time, and how we function, because we have the ability with our CCC and certainly to, I think, look at how we program for the capacity, but also for the time that folks are in there and provide, for the services that obviously are part of the consent decree. But again, for today's purposes, and again, I'm not going to belabor anymore. Again, at best, this is premature, and I am not willing, when we've spent less than $1 million of the first $7 million that we appropriated, put another $10 million on the table to basically runs this all the way through to construction completion. But I don't think anybody knows what it is we're going to construct, and maybe that's why the argument is there for catch-all, but I don't intend to support this today. Leave it at that.
Thank you, Supervisor. So I just want to keep my comments short. Is there an echo? Or am I the only one?
A little bit.
I don't know where it's coming from. I'll just say that I know this is difficult. I agree with Supervisor Kennedy's analysis that, obviously we've been working on this for a long time. I want to thank Rick Ferguson and Jeff Cassaway and all the staff who worked tirelessly to try to put together something that all parties could agree upon as we were negotiating through the consent decree. I feel from my vantage point that we were lucky. It could have been a lot worse than it was, and we were motivated to, to accept the opportunity and the deal that they gave us. Otherwise, it could have. It was clear. They came right out and said it can be a lot worse. So we definitely have a failure of the mental health system, and I totally agree that we should do everything we can to try to look at programs that will create jail diversion and create better opportunities for people who really don't belong there. They should be somewhere else. And we're already doing that. We've released a lot of people during this time of COVID, people that were not a danger to the community. We've let them release them early. We're working on a pilot project right now with probation for jail diversion, and we're trying to identify opportunities. And I love the ideas that came out tonight regarding mental health and 911. I want to say that I know that the staff has tirelessly tried to identify, ways that we could work with the jails that we have now, but they're old and the towers are made of cement, and there just wasn't a way to meet ADA and time out of cell and all the requirements of the consent decree. So we didn't have a whole lot of choices. And the design build is, from my understanding, is the most cost-effective, expeditious way to get this done. And the consent decree isn't going to go away. We're on a timeline that we have to meet in a certain period of time, or it can get worse. And so I'm prepared to support staff's recommendation, and I believe Supervisor Kennedy said he would be prepared to move the item. So out of respect for Supervisor Kennedy, yes. Supervisor, I'm sorry, you're muted.
My wife wants that button. Begrudgingly, I do second the motion. But something else came to mind as I was listening. As I had mentioned earlier, I'd like to have staff reach out to the litigants and see if we can divert some of the money that was to be earmarked for the consent decree for other things like 911 diversion, which I think goes directly to the heart of the intent of the consent decree. And the reason that I'm comfortable in asking that is because during the mediation and the negotiations, the litigants and we agreed to leave a lot of it flexible and not be terribly prescriptive, because opportunities may come up to satisfy the intent of the consent decree in ways that we hadn't anticipated. So I think what I have asked for previously, I think goes toward that. So that further illustrates my belief that this is an appropriate use of diverting this money for and still satisfying what we're hearing from the community, what we think is best practices, hearing from our medical and behavioral health staff, but also satisfies what the litigants were looking for. So I'd like to reemphasize my desire to have staff reach out to the litigants as I second the motion.
And I'll go ahead and move the motion. And Ann, did you want to comment to, Supervisor Cerner?
Thank you, Madam Chair. I'm going to go ahead and make a substitute motion. And the substitute motion is pretty simple, based on the fact that I'm always a little bit uncomfortable anytime this board is asked to take a vote on a controversial, expensive issue, and whether it's one member or two members or others that are uncomfortable supporting it by citing the fact that they believe that there's not enough opportunity to explore alternatives or hear more from the public. And that always bothers me, no matter if I'm intent on supporting the substance of a motion. And because our colleague Supervisor Tolley has expressed himself the way he has, and I think made clear that he wants to or is interested in a workshop, I want to make the substitute motion and look for a second to do that, but to do it in very, very timely fashion, to do it without delay. I don't know what the calendar looks like, Madam Clerk, but I would offer that as a substitute and ask for a second.
And I find nothing wrong with that. I would second that motion, keeping in mind that the 9th and 23rd are pretty darn full. So most likely have to be after that.
Okay, we have a motion and a second. I can support that as well. And so do we have any other comments from board members? So at this time, I'll ask our...
I think Supervisor Tolley is speaking.
Oh, I'm sorry.
Yeah, I was going to ask you, Madam Chair. So was the substitute motion just for a workshop, or you just tagged it on to the motion to move forward with staff recommendation? I want to be clear about that, Phil.
No, staff workshop before we take action on this.
Oh, I thought you were attaching it to, so can you please reiterate?
Yeah, it's to basically do what Supervisor Tolley has communicated in his comments, and please correct me if I'm wrong, Supervisor Tolley, but I think you requested a workshop before you're comfortable taking action on a $10 million contract. And like I mentioned, anytime I think any of us is that uncomfortable that they can't support going forward with something, I want to make sure that we have every opportunity to get comfortable, because something like this, I think, deserves every opportunity for unanimity, whichever way we go. So that's what's really driving my interest in this substitute motion.
I'd like to ask Britt or Jeff to comment on the timeline, because I think there was a timeline on this that we needed to move forward.
This is Jeff Gasway. So as far as the Kitchell contract, it would be beneficial to get them on board as soon as possible. I will say that I don't believe that we have enough information or from the team to be able to get a workshop put together at this time. We just finished up our last bit of programming on the week of the 11th, and we still have a lot of information to put together. And I just, I don't know that we would be ready in March to be able to do that.
Supervisor Kennedy.
With all due respect, if we're not prepared for a workshop and to provide answers at a workshop, then I'm even less comfortable going forward with this today. Then we don't have the answers we need to spend $10 million. And I'm one who believes that getting the team on board earlier is better than later, because in my experience working in the construction industry, the later that you bring in these people, the more change orders you're going to see in the future and costs go up. But at the same time, Mr. Gasway, and I appreciate your being forthright with your answer. I want those answers before I sign on to this. So I guess I appreciate Mr. Cerna bringing it up more now than I did before.
Supervisor Cerna.
Thank you, Madam Chair. I just want to make clear too that I would be open to having a special, if necessary, having a special Wednesday meeting to accommodate our.
Is there? I don't know how Supervisor Natoli feels about this. He's saying he needs. It sounds like there's work that they need to do in order to come back with a workshop or some kind of a public meeting, would you consider moving it forward with the idea of a public meeting with updates? Since we already know we're going to have to do this.
Madam Chair, if I could, and again, I certainly appreciate what Supervisor Cerna and Kennedy have said, and as well as your question. And I would just say that my view, to the point, is that recognizing that staff has been working with consultants to go through a series of inquiries, information gathering, and then to poise for decisions yet to come. And again, maybe it seems a bit backwards to some folks relative to bringing a design management firm, a construction firm oversight firm on board. But I think Mr. Kennedy said very clearly just a moment ago that, that's information, again, and maybe it wasn't available before, so I'm not saying anybody's deficiting this intentionally, but my perspective, I said, premature at best. And, what we have before us today, and I just think that if given that opportunity, it may not change anybody's opinion, it may not change any of what people are contemplating. On the other hand, if we take today's action as recommended, then that sets us on a course where we still don't know those answers. We'll know them at some juncture because we're going to spend a whole lot more money. And I guess I'm just asking, before we get to the juncture where we commit to $10 million, in addition to $8 million, and then commitment that we have, and maybe it's the best information available at the time. And we're going to hear from folks just like we did today and maybe others. But I think at least we've got an opportunity as we're looking at whatever modifications and or investment of public dollars on the lot across the street here, that we have, I think, more information rather than what we have here today. So that's my point. Again, I'm not trying to belabor it. I know you're looking to try to get some action, but I think having a workshop, and if it takes, a number of weeks to get there, obviously we've been delayed, not because of anything anybody intentionally has done. But I think once you take today's action, you can have that information come back at any point in time, but you've moved this on a track that's pretty clear in my view. So I would support doing that workshop, and when staff has the information available, maybe a little late winter, early spring. But to me, that's important information, I believe anyway, to have. Of course, I've heard others echo that. So thanks.
So Jeff, my understanding is with the design build, that concept of design build, you're doing it while everyone's working together to design and build, and it's an expedited process. And we've gone out for an RFP, so do we have to make a decision right now? And what was that? Is there information in that in those bids that we can put into a workshop?
So,
I had the impression you needed this entity on board in order to move forward to work out the details moving forward. So I'm not sure what.
Sorry, Supervisor Frost. I think it's crucial to the process to get them on board. And I understand everybody's hesitancy. I would also like to point out that, in any contract the county has with any one entity, there is language in the contract that it can be terminated at any time. So I throw that out as a option.
Is there, so I think what Supervisor Natoli is saying, he wants to see the plan, but the plan, this contract is so that they come together to make the plan. So And the reason for the design build was to create efficiencies and savings. So I guess, are you saying you don't want to do design build, Supervisor Natoli?
I'm saying what I just said, that I'm not supporting going forward with this contract this evening. And, you know, whether it's design build or any other approach, that at least again, from my viewpoint, I don't know who we're buying with this, and I don't think we really have a plan. We have a consent decree we have to meet. We've got discussions about what it is from a facility standpoint, and we've been exploring a number of alternatives. I think to this conversation we've had over the last, 45 minutes or something or so, we've got some ideas about some things we think would help with a plan of approach to, address the consent decree, but also improve conditions in the existing jail and anything else we may add to it. And so that's where I'm at. I don't think let me boil down. We let a contract last April. People have been working on that. It's programming. I don't recall, and maybe it was in there and I supported that. But that we had to, at some juncture, before we got to a point where this board could have a full airing of what it was going to be that was going to be a part of any plan going forward, construction or otherwise, that we had to have a construction management team on board in order to accomplish that. I don't know those are inextricably linked, and maybe they are in everybody else's mind, but they're not in mine. And I'm not saying I oppose design build, because if there are efficiencies and economies built in that, then that may be the best value for whatever we decide to do.
Okay, well,
Chairperson Frost, may I intervene for just a moment?
Yes.
So I think that I'm hearing a variety of things. I think we want a plan, and it sounds like this contract is what will help us get to a plan. And I know that's challenging because it feels a little bit backwards. I'm also hearing that there was some frustration about not knowing how the previous money was spent and how is this money going to be spent. And I wonder, Supervisor Natoli, if I'm not completely clear on exactly what you want in a workshop, and I think that might help Jeff, figure out if we can do a workshop and when we can do it so that we're answering the questions that you have, understanding that the design build is what gets us the plan for the building.
Yes, it seems Supervisor Natoli wants a plan in order to approve such a large amount of money, but the design build was the cost-effective, time-effective way to get to that plan and stay on task time-wise. Supervisor Kennedy.
Yeah, I just wondered, as we continue to talk in circles, if maybe we don't take action this evening, but we give Supervisor Natoli an opportunity to meet with Mr. Gassaway and other pertinent staff to further edify exactly what it is he's looking for, give staff an opportunity to explain to him what is and isn't possible absent having a contract, and maybe that will help alleviate Supervisor Natoli's concerns, but also get us to a better understanding of exactly where we are. And I would fully trust the dean of the board to have those conversations in a fruitful way that would benefit us all.
I would. Yes.
If I could, and I spent some time last week, and again, I want to make good use of people's time and certainly explore whatever other question. But part of it goes back is to we've employed a firm to talk about programming, and I said, it's outlined is that they're making certain estimates and so forth. That is feeding into, I believe, into part of the conversation. They're making assumptions about what inmate population is going to be, about obviously what's needed, maybe very informed assumptions about those things. Why is it that we can't have that discussion about the elements, in addition to obviously things we may do outside the walls of a jail, before we embark upon the construction aspect? I don't know if that's...
I would like to ask Jeff, I know the consideration of the cost of construction goes up by what, 15% every year? So time is time is an issue. Am I correct in that analysis, Jeff?
Yeah, I'm not sure it's 15% per year. I think it's been trending at 5 to 7% a year.
Supervisor Cerna.
Thank you. I think we're talking past each other here a little bit, and I appreciate the spot that Jeff's in, but to the point that Supervisor Toller just made, and let me put a little finer point on it. What I'm interested in knowing, and to Supervisor Kennedy's earlier point about the amount of uncomfortableness perhaps that has been garnered here in the last 45 minutes about the fact that we don't have a whole set of parameters or information on something as important as a $10 million contract being let. But my point is that I want to know about the substance of the activity, not necessarily just the building. There's been all this focus in the last 30 minutes on the building. And there's so much more to it than just the building. We've all come up with, I think, and to Supervisor Kennedy's credit, he's come up with some bold ideas about the intersection of this decision relative to, our collective interest in looking at how to get the sheriff out of the mental health business outside of the jail, and 911. And I've raised some suggestions here tonight about home detention and how that might be perhaps reshaped to better serve people that would otherwise be in the jail system. That would otherwise, that would get their services while on home detention. There's been question about the budget of the sheriff. We haven't even had that conversation. I get it, it's not June, but we're being asked to make a fairly large appropriation decision here tonight. But so the point here is my concept of the quote unquote workshop is that to kind of globally cover these, what I believe are pretty important, outstanding issues affecting this decision. So I get it. There's the building part, but there's so much more about it that I think we need to exhaust. And again, Jeff, I get the spot you're in, but to be very blunt with you, the five of us are the ones that have to go face to face with our constituents, and then give them the narrative that we've looked under every seat cushion, we talked about every exhaustive alternative. At least that's the way I feel. And I want to be able to say that in all honesty.
Supervisor Natoli.
Yeah. Thank you for those last comments, Phil. I maybe just, again, put another piece to this, that how do we know we need 100 mental health beds? If we do more in the community, and if we maybe have other alternatives, all of my colleagues have spoken that to this evening, that again, someone enters the criminal justice system, that's one piece of the equation. But if they don't, where else will we might make some of those investments? And again, that's a part of the conversation. Now, can we predict that with great certainty? I may be doubtful that we can, but those are the types of discussions about, and then also, we're talking about new construction, but there are modifications, certainly ones that are needed many yesterdays ago, but also as you, and I had this conversation with staff, that as you do something with new space, what do you do with old space, and how does that, from the functionality of those who would be incarcerated? And those are types of conversations. I think, again, we five of us, I think sitting at the dais or in this setting, with the community and have those conversations. And I think and maybe I need to have a fuller understanding, but I think I understand enough about it that predict you're going to need that amount depending upon, and what are they basing it on? So if there's a strong basis, but again, I haven't seen all that information, and I don't think any of you have either, because I don't know that's even available. But anyway, I think to the point, I think that spend a little more time, and this is not delay for delay's sake. I get it. There are other things that come into the consideration here, and I didn't mean to sort of gum it all up here this evening, but I felt pretty strongly, and I think others have spoken to it. So I think there's a way, to your point, Phil, and to others, that we can have, and maybe it's not just a general services conversation; it's broader.
So Jeff, is there a way you can, if we continue this, that we can come back to a special meeting with a workshop in a fairly quick manner? That, or would you want a workshop, or would you want to meet with staff, Supervisor Natoli and Cerna, and get your answers from staff?
I would prefer a workshop, because I think we necessarily have to have the public engaged on this, and that's, to me, is the way we do it.
I would concur.
And Madam Chair, I hate to do this, but I'm feeling a little nervous. I want to call the question only because I don't know what the weather's like where you're at, but if we lose power here, we're going to leave this hanging.
Jeff, can you, do you think you can bring something? I think Supervisor Kennedy's hand is up.
Yes, thank you, Madam Chair. Real quickly, just as a suggestion to staff, if we go that route, which it sounds like we are, of a workshop, I would suggest that staff reach out to board members to identify as specific as possible the issues that they would like addressed, those that can be addressed, so as to make it as efficient as possible.
That's excellent suggestion. Jeff, could you, and does that sound doable?
Yeah, I think we have February 24th blocked as a special Wednesday meeting, and I don't know, Flo, could we use that time?
Yes, we can.
If that's agreeable to all of you.
This is Britt Ferguson. Can I just make a point? I've heard many different things talked about for this workshop, and some of these things will probably not be, frankly, will not, depending on what comes out of the discussions about what you want to talk about, it may not be something that would happen in the very near future. If we're talking just about a very narrow workshop, that might be possible, but some of the stuff might take longer than February. It might go into March or April. And if that's what the board wants to do, we can do that. I just would hate to tie it down to a particular time until we figure out exactly what it is that we're going to be dealing with.
What about a workshop that discusses the design build process and why it's efficient and how it can save us time and money and the benefits of that and how that works compared to the alternatives that we could take? Supervisor Kennedy.
Yeah, I appreciate that, I'm sure, but I think that whether it's design build or not design build is not the burning issue that I've been hearing from my colleagues here today. Mr. Ferguson, I understand and I agree with you, but maybe some of that needs to be said in public in a workshop setting, that we don't have these answers, and here is why. Mr. Ferguson, you and I have had, the benefit of spending hours on this in close quarters with the litigants, so we probably have a deeper understanding than others. We were probably remiss in not adequately giving the board as many answers as we should have. And so perhaps this is a way to remedy that.
Madam Chair, just in order to get us past this, why don't we just, the motion to be to have a workshop that won't be held any earlier than February 24th. That doesn't mean that we couldn't have it later than February 24th. Mr. Ferguson's question and comment.
Is that? Go ahead.
No, I was going to second the motion. I think for purposes of this evening to move it forward, it sounds to me like it may slip some weeks beyond that, but I think the motion allows, if folks can pull some of that together, I don't know how narrow it's going to be, but I would second the motion in order to move this off of dead center.
A workshop on or later than February 24 to the best of our ability to zero in on the details.
Yep.
And then take a vote after. Okay. We have a motion by Supervisor Cerna and a second by Supervisor Natoli. If the clerk will please take the roll call vote.
Yes, Supervisor Desmond.
Aye.
Kennedy.
Aye.
Natoli.
Aye.
Cerna.
Aye.
Frost.
Aye.
Unanimous vote.
Okay, thank you very much for all of your thoughtful comments. We'll move to the next item, please.
Okay, so for your next item, item 45, you are making appointments to your own ranks. You discussed this at your last board meeting, and there were just a few boards that we needed to clean up or make an appointment. The first one is Adult and Aging Commission. Supervisor Frost.
Chiefs nominate Megan Maston and Catherine Koss and continue the remainder to February 9th.
Oh, I'm sorry, Supervisor Frost. I'm on item 45. I'm not on your nominations yet.
Oh, I'm sorry.
No, that's okay.
Okay.
For Adult and Aging Commission, we were putting, I believe, Vance in that position.
Okay, I do not have. Is that what you have? I'm sorry.
That's okay. That was the correction that came at the 112 meeting, but we had already moved past the item, so we'll just put it in the record now.
Okay, thank you.
Yes, okay. The next one is Sacramento Area Flood Control Agency, Supervisor Desmond.
Vanessa, I'd request Vanessa McCarthy Olmsted to serve as my alternate.
Okay, thank you. And then your final is the Sacramento Homeless Policy Council. It looks like Supervisor Kennedy was sitting in that, and then previously it was Supervisor Peters. So we just need to know, will you be sitting in that seat,
Madam
Supervisor
Clerk?
Desmond? Yes.
Supervisor Cerna?
Yeah, I would highly encourage Supervisor Desmond to remain in that seat, because there's actually some history behind, at least I recall, there's some history behind the composition, because as was mentioned before earlier today, we wanted a supervisor with a good portion of the city in his district and someone that primarily represents the unincorporated area.
Thank you, Supervisor Cerna. I appreciate that.
Okay, so we'll have Supervisor Kennedy and Supervisor Desmond on the Sacramento Homeless Policy Council, and that concludes your actions for item 45.
Thank you, Flo. Next item, please.
Okay, your next item would be item 46. This is your nominations. You are continuing to February 9th, the Cemetery Advisory Commission, Children's Coalition, Gulf Arno Cemetery District, Sacramento County Mental Health Board. You're continuing to March 9th, the Cordova Community Planning Advisory Council, the Summit Area Community Planning Advisory Council, County Service Areas Blue House, Walton, Consumnes, County Service Area 4C Delta, Developmental Disabilities Planning and Advisory Council, Disability Advisory Commission, and the Southeast Area Community Planning Advisory Council. And for your matters today, we have the Adult and Aging Commission, Supervisor Frost.
Chiefs nominate Megan Maston and Catherine Koss and continue the remainder to February 9th.
Okay, and then we have Antelope Community Planning Advisory Council.
Please nominate Arthur Christopher. Sorry.
Okay, got that
correctly.
Delta Citizens Municipal Advisory Council, Supervisor Natoli.
Yeah, to February 9th, please.
Yes.
Thank you.
Okay. Equal Employment Opportunity Advisory Committee, Supervisor Frost.
Chiefs recommend we continue to February 9th.
Public Health Advisory Board.
Nominate Christine Lee and Elizabeth Abbott to the community member seats, Ashley Sterlin to health member, and Larissa May to public health professional seat. Continue the remainder to February 9th.
Yes. Recreation and Park Commission. Supervisor Cerna?
Yes, please continue to February 23rd.
Okay. Rio Linda Alberta Community Planning Advisory Council, Supervisor Frost.
Please nominate Chris Ellis and continue to February 23rd.
We have the Sacramento County Alcohol and Drug Advisory Board.
Chiefs recommend we continue to February 9.
Sacramento County Treasury Oversight Committee.
Please continue to February 9.
And the Sacramento Environmental Commission.
Chiefs recommend we continue to February 9th.
Okay. So your next item would be the county executive comments.
I just want to take a brief opportunity to thank the clerk and her staff for in very short order putting together this remote meeting for the regular meeting and closed session. Outstanding job, Flo and staff. Thank you.
Great job.
Yes, thank you.
Thank you.
And thank all the clerk staff who do all the public comments. They do an amazing job.
Department of Technology has to take all the credit today.
They did.
They were sitting in as deputy clerks.
Okay, great. And do we have any, I'll just say next item, please.
Your next item are your supervisor comments, reports, and announcements.
I think we have a in memoriam that will be presented by Supervisor Desmond, and I have another one. Do any other supervisors have any comments? Seeing none, I will begin with Supervisor Desmond.
Thank you, Madam Chair. I'm going to move that we adjourn in memory of Dennis Catania. Dennis passed away on January 14th, 2021 at the age of 46, fatally wounded while on the job and succumbed to his injuries after. Dennis was an environmental specialist and was a 15-year employee of the Environmental Health Division of the Environmental Management Department. He worked in the Sacramento County Food Protection Program, which is responsible for the enforcement of state, local health codes at all retail food facilities in Sacramento County. Dennis graduated from Sacramento State University in 1998, the Bachelor of Science in Biology. He was a model employee who was dedicated to his family and his job. He had a passion for public service and the health and safety of people in the community. He was very well liked by his colleagues, who enjoyed his lively personality and respected his professional integrity. The board would also like to express our condolences to the Environmental Management Department employees that come to terms with the heartbreaking loss of their friend and colleague. The death of Dennis is an extraordinary loss to his family, the county, and the community. Our hearts go out to his friends and family as they cope with this incomprehensible tragedy, and I ask that we adjourn in Dennis's memory tonight. Thank you.
Thank you, Supervisor Desmond. I'm also going to be closing in memory of another county employee, and I just want to say that it's difficult to know how to make sense of these things. I'll begin with, on January 18, Sacramento County Sheriff's Deputy Adam Gibson passed away in the line of duty. Adam leaves behind his wife Rachel, his 9-month-old daughter, his parents, and several siblings. Adam was a 6-year veteran of the Sheriff's Office, and since joining in 2014, he worked in corrections, patrol, and most recently as a canine handler. He received the Sheriff's Office Bronze Star for bravery and a major incident ribbon in 2018. Adam's quick action in 2018 helped to safely rescue a possibly suicidal man who climbed over the fence of Highway 99 overpass in Elk Grove. Deputy Gibson, ending the parole shift, saw that happen and directed a tour bus to drive underneath the bridge, catching the man, and they both fell on top of the bus, breaking the man's fall and potentially saving his life. Prior to joining the Sheriff's Department, Adam served in the United States Marine Corps and did 2 tours in Afghanistan. During the incident that took Deputy Gibson's life, Sacramento County K-9 officer Riley also died at the scene. K-9 Riley was 5 years old and had been in the service of the Sheriff's Office for 3 years. We are grateful to Deputy Adam Gibson for his service in our community, as well as K-9 Riley. Our thoughts and our deepest condolences go out to Adam's wife, daughter, family, and friends, as well as the men and women of the Sacramento Sheriff's Department. It is beyond heartbreaking when a deputy pays the ultimate price while protecting their community. And so this evening, I want to adjourn our meeting in memory of Deputy Gibson, K-9 Riley, and Dennis Catania. May they rest in eternal peace. This meeting is adjourned.